All right, welcome everyone. Good morning. And good morning to those of you watching the live stream, which we have just kicked off. So we are streaming this conference on our website. I'm Abby Wozniak, and I'm director of the Opportunity and Inclusive Growth Institute here at the Minneapolis Fed. And I'm delighted to open the Institute's 2024 Fall Research Conference and to welcome so many of you to Minneapolis. We launched this event 4 years ago to serve as a showcase for research related to our big mission areas. But if we only wanted to showcase, we wouldn't need to convene this group in person on the banks of the Mississippi. We could do something more distributed. Instead, we have a second goal in mind, which is that we want to accelerate the knowledge building around how to foster opportunity and inclusive growth. And to do that, we need to build more connections and faster across scholars who produce and use work under the big tent of those topics. So our meeting today helps to build those connections by bringing together Fed researchers, our growing community of current and past visiting scholars, many of whom are here today, and a broad group of experts and emerging scholars who want to know more about this work. Those are all groups that I hope you'll have a chance to talk with over the course of today. I'm grateful to Amanda Michaud, who leads our effort to produce and grow the reach of this conference. As we get started, I want to remind us all that an important foundation of any community is our behavior toward one another. And a research community is no different. We expect to have exciting and challenging discussions here, and we expect to make friends and create new connections and interactions. That's what sets a research community apart in many ways from other places that we might gather. But we know that these discussions and interactions can be substantive and respectful, professional, and free of harassment. Should you have any concerns about conduct, you can share them with me or Amanda or another bank contact that you might have. Your cooperation in this helps all of us keep our community maximally productive, and we really appreciate it. To that end, I want to take a minute to highlight some of the fruits of that productivity. And I want to mention just 2 things that Institute researchers have brought into the world this past year. I want to emphasize that this is not an exhaustive list. The first is work by Amanda and one of 2024's visiting scholars, Catherine Elliroth. Together, they have developed a more complete picture of layoffs and quits. This gives us new and timely information on these critical flows in the labor force. Their work is summarized in an Institute working paper that you can find on the website, and we will make sure that folks have that correct link. We can drop it as well later. But it is on the website under the Institute working paper series, and you can find the data available on their website called qlmonthly.com. So second, I want to highlight ongoing work on the income distributions and dynamics in America, or IDA, dataset. This work is led by economist Ilan Kondo in conjunction with researchers at the US Census Bureau. We announced the availability of IDA's 6 million plus statistics at this event last year. But since then, in 2024, there have been 2 big improvements to the usability of these data. If you are a user who's seeking a small number of statistics by state or demographic group, these are now easier to visualize in our expanded online tool. It's easy to compare groups across demographic groups, space, and time on a number of earnings and distributional dimensions. If you are one of our power users who are interested in downloading the entire data set and using big pieces of it in your research, the data are now summarized for a technical audience and in a working paper that also compares their outcomes to those one might get in the CPS. That information is available on the IDA website, and it appears in an NBER conference volume, available online now and coming out next year in print, should you want the print version. You can keep up with all of this work and more by signing up for our magazine for all, and also our quarterly newsletter. You can do both of those at our website. So while it's exciting to share this news, I'm very much looking forward to our day. I'm particularly delighted to welcome our keynote speaker to kick off today's presentations. We are excited to have Dr. Raphael Bostic to open this year's conference. Dr. Bostic, I don't know if you had a bet going on whether I would say Dr. Bostic or Raphael, but there was chuckling. Dr. Bostic became the 15th president of the Federal Reserve Bank of Atlanta in June of 2017. He's a member of the Federal Open Market Committee, which is the monetary policy-making body of the Federal Reserve System in the United States. In 2024, he's a voting member. He has also served in roles in academia and at the Department of Housing and Urban Development, and spent several years as an economist at the Federal Reserve Board of Governors. Dr. Bostic is particularly interested in working with policymakers and researchers to help find ways to make the economy work for every American. Raphael helps guide the Atlanta Fed's multifaceted program aimed at enhancing economic mobility and resilience. Prior to joining the Atlanta Fed, Raphael was a professor of public policy at the University of Southern California. And as such, he shares a research background with so many of our system economists and has studied topics of deep interest to the Institute. This combination means that he has long been a person that our program committee has wanted to be able to bring to this event, and so we are really excited that this is our year. After his remarks, President Bostic will be joined by Neel Kashkari. President Kashkari leads the Minneapolis Fed, which serves a district encompassing Minnesota, both Dakotas, Montana, and parts of Wisconsin and Michigan. Along with President Bostic, he serves as a rotating member of the FOMC. Neel began his career as an aerospace engineer, developing technology for NASA space missions, and he later held a variety of roles in public service and finance, most notably as Assistant Secretary of the Treasury during the 2008 financial crisis, where he oversaw the Troubled Asset Relief Program, or TARP. President Kashkari launched the Institute in 2017, bringing it to the Minneapolis Fed. He'll join President Bostic on stage for discussion following his remarks. Neel will also moderate questions from the audience, provided that time allows, later in the discussion. So wait for that invitation and look for folks with microphones to ask your questions. And with that, welcome President Bostic.
Am I still using this mic? All right, so thank you, Abby, for the warm introduction. This appearance is actually years in the making. I think the first invitation came like 2.5 years ago, and trying to get calendars and things together was difficult, but I'm really glad to be here. So I have some prepared remarks, and then I'm looking forward to the conversation. So good morning, and thanks to the Federal Reserve Bank of Minneapolis, and especially the team at the Opportunity and Inclusive Growth Institute for putting this conference together and for inviting me to participate. As I said, it's great to be here, and I'm really excited to be talking about these issues and to get to see the community that is working on this stuff in the system. The pursuit of inclusive economic growth is at the center of much of my work, and it's a soapbox issue for me at a personal level. Economic inclusion has been a theme from my earliest days in the economics profession. A chapter of my dissertation, which was also my job market paper, focused on better understanding discrimination in mortgage lending. And my initial job as a PhD economist at the Federal Reserve Board of Governors focused on efforts to increase access to capital for those living in lower income and minority neighborhoods and for minority and women-owned small businesses. Some years and a few career stops later, I joined the Atlanta Fed. In Atlanta, we use the tagline, everyone's economy, which I often modify to an economy that works for everyone. And that mission is grounded in promoting broad opportunity and inclusive economic growth. Now, as you probably know, Congress bestowed us with a dual mandate to promote price stability and maximum employment for the entire population. And here, let me say that I think of the employment mandate as a charge to foster sustainable maximum employment. And sustained employment is crucial because unstable employment, where one gets a job and then loses a job and repeats that cycle, is so very disruptive for individuals and households, and by extension, for communities. Now, one way we get to sustainable maximum employment is by maximizing human capital. Thus, my conception of sustainable maximum employment envisions an economy in which everyone who wants a job can find not just a job, but a job that allows them to use their talents and training to the fullest and earn a family-supporting income. At its core, sustainable maximum employment is about expanding opportunity. When we achieve our dual mandate of stable prices and sustainable maximum employment, the result is a more vibrant and inclusive economy, an economy that works for everyone. Now, several years ago, our bank embarked on a strategic planning exercise, and one outcome of that effort was identifying increasing economic mobility and resilience as a strategic priority. This appealed at the time and continues to appeal at our bank because, in my view, there's a direct link between our employment mandate and economic mobility and resilience. A household's economic mobility and resilience begins with a job, and it continues and strengthens when a householder keeps a job. So if we do better in attaining sustainable maximum employment, we will also be making progress in expanding economic mobility and resilience. And more broadly, I believe that the case is clear for pursuing economic inclusion, mobility, and resilience. Inequities put a ceiling on opportunity for millions of Americans. Limitations for workers limit employment, which limits the economic prospects of businesses, which in turn constrains local, regional, and national economies. Now, we don't know where the next innovator, the next great entrepreneur, or the next brilliant researcher is coming from. So we need to spread opportunity as broadly as possible to ensure that we are not leaving potential untapped. Now, you all know the research, but to quickly cite a couple of prominent studies, President Mary Daly of the San Francisco Fed and co-authors estimated that the racial and ethnic gaps in economic opportunity cost the U.S. economy almost $3 trillion a year in output. And another study by the USC Dornsife Equity Research Institute, PolicyLink, and Burning Glass Technologies showed that eliminating racial inequities in incomes could boost annual output by more than $2 trillion. Now, these are enormous numbers, even in a $25 trillion economy. And the lost economic potential could grow even larger in coming years, given that racial and ethnic minorities are projected to make a larger share of the U.S. population in the decades to come. Gaps in opportunity happen not just along racial and ethnic dimensions, though. As one example, the rural-urban divides are stark in many parts of the country, as the evolution of our economy over the past half-century toward the service sector and white-collar jobs has disproportionately benefited metropolitan areas. So we should be thinking about these things in as broad a way as possible. Now, many of you are part of the Federal Reserve System, so presumably you know what we do to try and broaden economic inclusion. Now, numerous elements must interact to make sustainable maximum employment a reality, including, for example, having a quality education system and strong workforce development programs. Now, most of you also probably understand that the Federal Reserve cannot directly access or address these sorts of structural economic issues. Monetary policy, after all, is not well suited to target particular barriers to opportunity or specific populations or economic sectors. Yet there are things we can do. Obviously, we conduct research into economic disparities, and there will be several instances of that on display at this conference. This conference is also an excellent demonstration of another thing that we do, namely convene the best thinkers and practitioners to develop a deeper understanding of and explore solutions to important challenges. We can also promote by lifting up efforts that have proven effective in a particular locale, spreading the word about policies or programs where the evidence shows there's been a positive impact. Now, in that spirit, let me briefly talk about a couple of areas where the Atlanta Fed has had or is seeking to have a significant positive impact. Our bank has built an initiative we call Advancing Careers for Low-Income Families. Our team has conducted pretty groundbreaking research that shines a light on benefits cliffs that historically have functioned as huge disincentives for people in lower-wage occupations to pursue training and education, to climb a career ladder, and to achieve self-sufficiency, economic mobility, and resilience. The findings of this research served as one basis for important state legislation in Florida that broadens eligibility for the state's public children's health insurance program, truly groundbreaking development. And our team has formed partnerships with workforce agencies and other groups across the country who are seeking similar breakthroughs to improve economic inclusion and self-sufficiency. I'd like to quickly mention another aspect of the efforts of the Atlanta Fed and our sister reserve banks to open the doors of economics and finance fields to populations that by and large have historically not considered these fields as opportunities and options for them. Our economic education program is trying to inform and reshape K through 12 curricula so that people from all walks of life hear about economics and finance early in their lives and understand that they can access these fields and that there is a range of occupations at places like the Fed that tap into economic knowledge. In our teaching recruiting efforts, we're pivoting in a concerted effort to reach out to schools that train large numbers of people from communities underrepresented in economics and finance. Now, the goal of these initiatives is not to get to everyone to fall in love with economics. Rather, the idea is just to get more people to know about economics and to view it as a viable career choice, and make them aware that you can find jobs other than being a PhD research economist. Not that there's anything wrong with that. Ultimately, people need to choose pursuits they are passionate about, and you simply won't know if you develop a passion for something if you've never been exposed to it. Now, I want to also commend the work of our host, the Opportunity and Inclusive Growth Institute. I think this work has been nothing short of exemplary. Now, while there's a lot that's going on in the Institute, I'd like to give a particular shout out to the database that Abby mentioned, the Income Distributions and Dynamics in America resource, which is expanding access to the powerful information that lives within administrative data. Now, for many, that term, administrative data, sounds hopelessly dry. Not me, I love administrative data, actually. But as you know, administrative data is truly critical to what we're about in this work. And that's because it can represent very high quality data. And we are all aware of how difficult it often is to find high quality data when conducting studies into economic disparities. Now, I've long had the view that evidence-based research is essential to effective policy. And it's been a principle that has guided me throughout my professional life. We need sound research to undergird policy that seeks to reduce and eliminate barriers to economic opportunity. Because in important respects, the best ways to address economic disparities are still not well understood. And those knowledge gaps are among the reasons the nation has made only incremental progress on key dimensions of inequality. One quick example, the most recent survey of consumer finances from the Board of Governors, which is the 2022 edition, tells us that the median white family in America holds more than 6 times the wealth of the typical black family. And that gap has not narrowed much over several decades. Now, everyone here can help. I think every person in this room has the potential to deepen our understanding of how our nation can dismantle barriers to opportunity. And over the next 2 days, we will together explore research into important puzzles, including gaps in retirement wealth accumulation, the effects on home ownership of institutional investors in the single-family home rental business, the impact on income inequality, of geographic differences in inflation, and much more. Now, you have the agenda, so I'm not going to recite all of it. But if I can take a speaker's prerogative and brag for a moment, you will hear from two Atlanta Fed economists today who I'm sure are going to dazzle you. David Wixer will discuss a paper on disability insurance that he co-authored with Timothy Moore of Purdue University and Amanda Michaud, a Minneapolis Fed economist and organizer of this conference. And right after Neel and I finish, and Amanda does a little opening remarks, another of our economists, Veronica Penchiakova, will present work on the origins of business formations. It's good to see you both here, and I'm really proud to see that you have prominent roles in this program. Now, suffice it to say, we're in for a couple of days of thought-provoking discussion. And this is super exciting. When leading thinkers get together and wrestle with important questions, it can yield key clues for broadening inclusion and opportunity. Now, I hope I've helped to frame what's to come, and I hope you're excited about this program as I am. I want you all to enjoy the conference and participate fully. Now, I'm going to go sit over here for what I think will be an interesting and lively chat, as it always is, with my friend and colleague, Neel Kashkari. Thank you very much.
Thank you, Raphael. That was great. Really, let me just add to Abby's thanks. Really appreciate you coming out here today for this conference. Let me start with this. You know, the Opportunity Inclusive Growth Institute is taking these huge issues facing society. And we have in the room health experts, people in education, people focusing on criminal justice. Almost every aspect of American life is somehow woven into these issues. So I'm just curious, you as a researcher, how do you decide where to begin?
So that's a big question. For me, I think, well, I'll tell it from my background, my perspective. So in my career, there were areas that I had passion in. So I cared about access to capital, mortgage flows, those sorts of things. And then I had to marry that with the data that I felt that I could get access to. So for my dissertation, it was right after the Boston Fed had collected all that information from the banks about their underwriting rules and tools, and it was publicly available. So in those days, you actually had to call them. The email wasn't so good. And they sent me a floppy disk with the data on it, and I downloaded all of it and just started running analysis to try to see if there were aspects of it that I hadn't seen people working on or revealing. And so that's kind of how I think about it. So I like to live in my passion spaces. I feel like that's the only way I'm really going to get through the hard parts of research, when your programs aren't converging or you're seeing bugs or all those sorts of things. And so that it was essential. But then it's also trying to be creative about like where you think there might be data, and then being persuasive to try to convince people to give you that data. It's one of the reasons why I think that the added database is really important, because then that part of the effort has been handled already, and you can spend much more of your time and your focus on the questions to be answered. But it's an ongoing thing, and one of the things I've been trying to encourage businesses and public sector agencies is that they should be thinking about their data as a resource to help them. And as you think about how you collect it, how you store it, how you manipulate it, put the research component into this to make it easier for all of us to be helpful. Because when researchers learn things and they bring it back, it can actually help these programs work better, and it can help the outcomes be better as well.
So that makes a lot of sense. But now think about, I get it from an individual graduate student's perspective, which you were very clear on. What about you've been president of the Atlanta Fed for quite a while now. How do you think about guiding the Atlanta Fed? Now you've got the resources of the Atlanta Fed and the Federal Reserve System behind you. How do you think about where to focus?
So I don't. One of the things that I try to do, I feel like I'm an aggregator of perspectives and viewpoints. I go out, I talk to a lot of people, and I try to ask, like, what are you struggling with? What are the things that you're worrying about? I bring those things back. Like, so my job, I think, is really to just give a picture of where people are struggling, where people see there are opportunities, where people have hopes or wishes that things could work better, and then just put them out there. And then, I have a great team. I talked about a couple of them earlier. Karen Kopecki's here. She used to be with us as well. They all will know, well, I hope they know, and get a sense of which of these issues are closer in their passion spaces to where they might be able to advance things moving forward. As you noted, it's a super complicated world. There are so many different fields. There are so many different details and institutional knowledge that you could have, that trying to have insight to say that's the one that will make the difference or that one will, I don't think that's helpful. It's really going to be everybody coming together, and it'll be the aggregation of all that knowledge that works.
Related to that, one of the initial ideas of the Institute was to have a very broad mandate related to these topics, but intentionally invite people beyond just economists to the table, because there's so much knowledge and expertise that they bring that historically, as a Federal Reserve system, I don't think we have fully appreciated or embraced. And so I'm really happy that we have economists here today, but we also have other experts.
So can I just speak to that? Totally agree with that. One of my, the best class I taught, my favorite class to teach when I was a professor, was the class I team taught with a historian. And it was about urban economics, but the history lens kind of lifted up a different set of things, that history happens in sequence and in context, and there are all of these relationships that will drive the setting by which policy gets pursued, the way that programs or potential initiatives might be articulated or considered. And if you're not totally aware of that, then you can miss things in terms of how you might design an analysis, because no initial context is totally random. And having an appreciation for that moving forward is quite important. So I love the multidisciplinary. My undergrad, I was a psych and econ person, right? So I already had some predisposition to that, but it's really interesting.
We can have a long conversation about that. I'm going to keep going, though, because I want to make sure we have time for the audience. Of all the topics that one could approach, I know, and you touched on it in your remarks, the benefits cliff work is a signature issue for the Atlanta Fed. How did the Atlanta Fed get into that work? You gave an example of where it's making a real impact. Where do you see it going?
So this actually started before I got there. And there were, so Dave Valtig, who was the research director at the time, had this passion about trying to understand sort of what were true barriers to families and moving to self-sufficiency. And he worked with some private sector folks to build a tool that could actually kind of map out the trajectory of your income if you were participating in different mixes of social welfare programs. So housing vouchers, child insurance, all those sort of things. And they could show sort of when you get to a certain level, because these programs are being tested, you get an extra dollar, you start to your progress slows or sometimes falls backwards. And they started mapping this, and they would bring it out and talk to folks, and people didn't know. Like, they weren't aware that the incentives were such that people were locked in, not because they didn't want to be better, but because the incentives made it less.
But the participants figured it out.
Oh, they know.
The policymakers didn't know, but the participants
no,
knew.
they did the math,
Yeah.
right? Like, and so we actually started doing math, and we would ask the question, well, okay, suppose someone worked through the cliff anyway and decided to make themselves better. How long would it be before they broke even? And in many places, it was 10 years, 12 years, 15 years, and that's not viable. Like, it's not reasonable to ask someone to do that if you've got children you've got to support, if you've got like elderly people and all those sorts of things. That is not the rational decision. That actually not bettering yourself is rational. Then we did one other thing, which was we asked the question, did the thought experiment, well, suppose you had two people who are identical. One, you decided to pay to fill in the gap, and the other you didn't. Who do you spend more money on? And it turns out you spend more money over the lifetime of that person for the one you don't fill in the gap, right? So there's a fiscal cost to this in addition to sort of a self-sufficiency and a social cost. And once people saw that, they're like, well, we're going to do something about this immediately. And that's triggered all of these partnerships and memoranda of understanding that we've had, because now all these counties, and a lot of these rules are set, the variation happens at the county level. They want to figure out how to not do that. And so the Florida action was to sort of not make the penalty on the children's health insurance be acute. So they raised the poverty threshold to 300% of the state poverty level from 200%. And the difference between being covered and not covered in terms of a premium was going from something like $300 to $3,000.
Wow.
Right? It was sufficiently large that nobody was going to cross that threshold because the extra income wasn't going to be enough. Right? And so it's that kind of stuff that has been very interesting. And the team has been quite creative in presenting this in ways to make people understand, like to talk about it in their domains so they get it. And you know, so much of this is the analysis plus a communication strategy that makes the issue or the solution compelling. And so you've got to have that partnership.
Excellent. I've got two more questions, then we're going to turn to the audience. You touched on in your remarks challenges in urban centers, challenges in rural communities. We face that dramatically in the 9th Federal Reserve District. We've got these big cities for us, Minneapolis, St. Paul, and a lot of rural areas around us. Curious, what do you see? What are some of the common challenges? What are some of the different challenges?
Yeah, so there's so many. So one is just having an infrastructure in place that can support the way business happens today. The most obvious element there is broadband. So many businesses require on having that technological connectivity, and broadband doesn't exist in robust ways in a lot of rural places. It's hard to get out there. Like just the business model for a private company to do this doesn't really work.
Correct.
And so you need to find some way to subsidize that, and policy is trying to address that. Second thing is, and that actually leads into a second thing, which is trying to create the possibility that the next generation sees opportunities located locally. Right, so one of the concerns is when children are growing up, they think, well, where am I going to get a job like that's going to be interesting and allow me to progress? If they don't have broadband, if you don't have the innovation, if you don't have the entrepreneurship that's visible and local, then they're going to say, I got to go somewhere. And that then runs the risk of leading to the spiral where the place can't be sustaining on its own. Another area that I hear a lot about is childcare. And it's particularly important because the population is far less. So you can't just assume that there are going to be neighbors that might be able to watch the kids or any of those sorts of things. So the existence and presence of these institutions is quite important. And then the last one I would just talk about is healthcare. So across this country, in my district, and I'm sure this is everywhere, like hospitals are closing in rural places. You can't get a lot of the important healthcare that you need to have. And that then becomes a challenge for, can you stay there?
Yeah.
Like if you can't get the healthcare that you think you're gonna need or your family's gonna need, like you might need to do a different calculus to figure that out. And so finding solutions for all of these is of paramount importance if we're gonna close this divide. I'll just say on the childcare, I think there's a huge opportunity if someone could develop a business model to deliver childcare in these type of places. I think there's a communication aspect to this, there's a coordination aspect to this, there's a certification aspect to this. If someone could figure all that out, the challenge is so ubiquitous in these areas, I think it would be very interesting.
All right, well, we could have a long conversation about that because I've got two very young children, so I'm in the childcare market and have analyzed this in some depth.
Well, you could be the
And
one. You could be the one.
I don't think it's solvable by the private market. It's like, I'll give you just a quick riff. At the same time that childcare costs for families are so high, childcare wages are very low. Those two things seem to be in tension. Well, it's because the more you make it a living wage, the less affordable it becomes for families. So it's like, why does every country in the world subsidize agriculture? Because they want high prices for farmers and low prices for consumers. Those two things are directly in tension. So the only way to square the circle is with some form of subsidy. Otherwise, it's just impossible. The private sector cannot solve it on its own. My conclusion. I'm not advocating anything. I'm just making an economic observation.
This is lived experience, right?
This is lived experience. And I finally tried to cut through what I think is kind of like a Gordian knot. Last question for you is, you talked about maximum sustainable employment. Since we've both been at the Federal Reserve roughly the same amount of time, before the pandemic, the FOMC, us included, kept getting surprised that the unemployment rate went lower, down to 3.5%, and we didn't see inflation. Now we're at 4.2% unemployment, and we all think we're somewhere around maximum employment. I'm just curious, in the arc of what you've learned in the last 8 years or so, how do you think about maximum sustainable employment, and how will we know it when we're there?
So,
I saved the hardest question for last.
Yeah, this is a big question. So let me just say, look, I think that there is sort of a short-run maximum employment, and then there's the real maximum employment potential. All right, so you could take where everybody is in their human capital and where they are in their employment as fixed, and that will define one level of maximum employment. But the question that I always ask myself is, well, am I happy with that? Or should we be striving to do better and improve people's productivity, get them into better matches, get them better human capital, such that the benchmark will actually move? And I think if we do our job well, the benchmark should move. And I think one of the things that we've learned is that there has been movement, right? So like when I started being an economist, the idea of the natural rate of unemployment was well north of 5%. It could be almost 6%. Now, when I started here, it was 4.4. We got to 3.4, right? So it's obvious that the notion of what this is evolving and shifting. It shifts with technology. It shifts with how we provide supports. And so for me, I view the exercise as trying to reduce something equivalent to a dead weight loss. Like, to what extent can we position every person so that they are their best self, that they are doing the best work of their life, the best productivity of their life. And if that happens, then our economy is stronger, our economy is bigger, our economy is more resilient, and our job actually gets a whole lot easier. There's less that we have to do. And so that's how I think about it. Now, everyone always then wants to say, well, what's the number, right? I don't really know what the number is, right? But I know that the number could be lower, right? And you were a strong voice through that period when we were getting below 4 to say, let's not jump to a conclusion, because our institution has historically been preemptive.
Correct.
Right? And not allowed those last few people to get jobs. And then we learned, if you let them do it and you manage well, those can actually be sustainable jobs. And so, to me, I think this is an area that we need to continue to be focused on, thinking about, and being creative to try to find ways of how to quantify this, and to find the places. I use the phrase, an economy that works for everyone. It naturally flips to, well, for whom is the economy not working? And that's where our potential is. Like, that's the space where we can actually close that gap and get much more to that real highest potential number.
Wonderful. All right, let's open it up to our experts in the audience who might have questions. There are a couple microphones around. Shy group this morning. Okay, I can keep going. You talked about the urban-rural divide. What you described in your district is almost exactly what I experience traveling around our district. And I'm just curious, healthcare, for example, you talked about that. Hospitals are closing here too. But here, technology is showing some promise of closing some of those gaps or increasing access. You don't have a specialist in your town, but maybe through technology, you can actually access that specialist. Are you seeing progress there?
Yes, so the telehealth and the use of technology has been very, very interesting. And this is, like, with all these different frontiers, you see the opportunities, but then you also learn new challenges, right? So definitely the potential to use people's phones, people's laptops for apps, for having appointments, for having communication, that all has increased. The challenge we have, so yes, so we need to see that, and we need to see that become more sophisticated, more nuanced, more innovative, and all those things. The challenge is that it then requires like a level of personal self-discipline that I think can be challenging. Like we know that many of our health issues are not because people don't get the medicines, is that they don't take the medicines or follow the protocols as ruthlessly as they might otherwise. And so then the next challenge is then how do you incentivize that? How do you create processes to address that in this new domain? And so there's all that learning that's going to happen that I think it can be done, but it's going to take work, it's going to take investment, and I mean, I'm actually fairly optimistic on this because it covers such a wide area that I think policymakers will be able to gain consensus on this because it's everywhere, and that's quite interesting.
One other thing, just jumping around, just because it's partially in your district, obviously the hurricane, very big news, a lot of damage, especially in North Carolina, which I know is not in your district. I'm just curious, what kind of reports are you all getting from around your region in terms of the effect, and how are people navigating it?
Yeah, so my district has been facing these sorts of things with increasing frequency. So when I first started, there had never been a hurricane, a storm that had gotten to Atlanta and was hurricane strength. I started in June. In September, was the first time that it ever happened. It's 2017. And then you just have Helene, which is like this massive storm into the Appalachian Mountains, which
is amazing.
Is not close to the ocean, right? And yet the storm can still have that kind of power. To me, it's really causing everyone, like what I'm seeing is it really causing everyone to rethink what their relationship to risk is and how geography plays a role in it. So I've talked to a number of people in the last month and a half who are either rethinking their decision to buy something on the coast or regretting their decision to buy something on the coast because they didn't appreciate how powerful and how rapidly the dynamic has evolved. Right? When you used to have, where you thought you had 50 yards of sand that was going to be a bunker, it's not that much as much of a bunker as people have thought, and that has real implications, I think, for how all these places are going to work. So I was talking just with someone yesterday. That whole area in North Carolina around Asheville, there are going to be some hard decisions that have to be made about like how viable is the place if this sort of thing could possibly happen again.
But if it could happen there, it could happen in a lot of different places.
That's correct. And so one thing I've been hopeful for is that people throughout the country actually take on board the experiences of their neighbors a bit more in making judgments about what their actions should be, what kind of precautions they should take, how should they think about their posture. That hasn't happened as much as I would like. And there have been, as I said, there have been these giant storms coming across the Gulf Coast, and my district covers the whole Gulf Coast except for Texas. And then I have also as part of Tennessee, there's not as much mitigation as I think one could do. And at some point, I hope that people kind of step back and say, collectively, we've got to figure out what we want for our community and how are we going to make it more resilient against these things. And that'll be really important.
Here in our region, I'm sorry,
let me just say one other thing. What we are seeing, which is important, is that the private sector is making choices as well, right? So in Florida and other parts of our district, insurance rates have gone up a lot, like 300%, 400%, adding thousands of dollars of cost because there's math there, right? So if their actuarial tables, I guess not actuarial, but their risk tables were, the storm of that magnitude and that loss is only going to happen once every 70 years. And now it's happened 3 times in 5 years. Those premiums don't work anymore. Like you will go out of business. So just the economics of it means that the economics of living in these places is going to change, and that's not a policy thing. Like, that's a business thing.
Right.
And businesses are going to start. I think we're going to see more and more of that in the years to come, because I don't think these storms are going to stop happening.
So it's interesting you say that, because we have a couple insurance CEOs on our board of directors, and we talk to other members of the insurance industry, and I ask them, I say, can you explain to me why are premiums in our region going up so much? We don't have hurricanes here, thankfully. And they say, yeah, but it's a national market. And so, yes, the storms that are affecting the Gulf Coast, forest fires, they're actually getting spread out across the country. And so that's one of the factors that's driving premiums up all over the country. So it definitely is it's a big problem.
It's getting folks' attention, for sure.
We got 2 minutes left. Any remaining questions that folks have? I see one over there. Go ahead.
Eric Hurst, University of Chicago. So when you're talking earlier about thinking about the sustainable unemployment, why the unemployment rate now as your target? I've talked to Andrea about it yesterday. There seems to be a much bigger class of people on the margin between working and not working, and so are we thinking about these kind of employment rate movements as a potential other metric? And when you start thinking about that, things make a little bit more sense when you're looking at the full group of potential workers.
So that's a very good point and a very good question. I would say there's not any one measure that defines sustainable maximum employment. But when you talk to regular people, labor force participation rate doesn't mean much to them. Right? So like, there are a lot of the things that we would use as measures of sort of penetration, growth, health, vitality, of all those things, but that's inside baseball. Everybody knows what an unemployment rate is. And so using that as one of the benchmarks is going to be useful. But we should not ignore any of the other things. And for me, I'm actually trying to ask person to person, like, what are your skills? What's your job? What's your attachment? Like, that's sort of the metric to think about sort of how well these labor markets are performing.
I would just add, so Andrea and our team here has heard me on this point for years, because when I first started, a friend of mine who's now the deceased, late great Eddie Lazier, labor economist, called me and basically said, you guys at the Fed need to stop talking about the unemployment rate. It's meaningless. You should be focusing on EPOP, because it takes out the psychological analysis of whether or not I'm in the labor market. And he just pounded me on that. And so it's something that I think he was right. I'm not saying the unemployment rate is meaningless, but EPOP is a very important measure, because when you see so many flows from out of the labor force into a job, right, that in theory that shouldn't happen, but a lot of people move from out of the labor force into the job. And so I think employment to population measures are very important. But I agree with Raphael, we have to look at all of it. There's a question over here.
Hi, Abdu and Jai from NYU. So the opportunity to own a house, especially for young households, is certainly an issue currently. But I wanted to just, from your work and from how you see it now, whether this is more of a policy issue now or a market issue.
Housing affordability, is it a policy issue now or just the market?
It's a lot of market, in the sense that the big challenge we have is an imbalance between supply and demand, right? So we don't have enough units for the number of people in most of the places where we're seeing growth, and that's putting a lot of pressure on things. That said, the cost to do things actually is not irrelevant, right? And so it can influence the intensity by which people are experiencing things, and sort of make that larger dynamic feel more acute in places. I think, though, it's a hard question to ask. It's a hard question to answer, because our charge is not to fix housing markets. Our charge is to make the U.S. economy be in a position that people have certainty about where it's going to be writ large 3 years from now, 5 years from now, 10 years from now, which is why we want to have stable prices. But it does have implications on how people are going to experience things. I'm hopeful that in the next several months, as we start to normalize our policy, that the pricing for mortgages gets to a level that allows a little more action in those markets. I mean, we're seeing that already. financial markets are responding quite quickly, but we have our charge, and we have to face that.
Abby, any final? You had your hand up earlier. Microphone's coming to you.
Did you have a question? So when we are talking about maximum employment, and you mentioned maximum sustainable employment, I feel like that pulls in the idea that there might be different ways of achieving it, and there might be different, in a sense, levels of maximum employment as defined by a simple unemployment rate, but things that could look very different in that they impact different types of folks. It brought to mind kind of how the full employment mandate originated, and it originated not that long after we started really thinking about human capital and as a profession. So when you think of the publication dates on human capital papers, not that much before the kind of dual mandate, we now know a lot more about how to generate that and causally affect that. So I'm just wondering, do you think there's, given when that originated, is there a bit of a mismatch in just institutionally how we think about full employment as perhaps a single static thing, as compared to a choice among many equilibria that we can shift with our other policy decisions? Is there some mismatch in our own thinking, or perhaps a mismatch in how we talk about it with the wider public?
Yeah, I actually think it's the second. Well, first, we're unusual as a central bank in having two mandates, right? And because originally it was just stable prices, the dual mandate came in during the civil rights era as people were concerned that just the basic institutions that were foundational were not thinking about these disparities. But then the question came up about how do you measure this? Like, what does it mean conceptually? How do you provide a framework that allows us and the public writ large to know whether we're making progress or not? I don't think that it has, well, as the earlier question noted, we haven't been able to reduce this down to a number or an index or anything in a way that's comparable to the clarity that we have in the inflation or the stable prices. Even though I would note there are 1,000 ways you can measure inflation as well. Like, we have an underlying inflation dashboard. We show 8 of them, and they don't always say exactly the same thing. So I actually think this is an area where research would be useful, like having some thinking from people who are deep in this space about sort of what would this look like? How do you think about talking about the concept of multiple equilibria? And how do you think about creating consensus on what an appropriate benchmark is? Maybe maybe there's an institute that starts a project to say, okay, we're going to measure what we think the frontier should look like and how far we are from the frontier, and we're going to update it every 2 years, 3 years, forever. I think there's a lot of hard thinking that remains to be done to help flesh this out in a way to make it actionable where everybody understands it.
I think we are over our time. So please, everybody, join me in thanking Raphael for his remarks today. Thank you. Appreciate it.
Thank you. All right, and thank you. I really want to thank both Raphael and Neel. That was quite a treat for me as a researcher, but also for me as somebody who grew up in a rural area and whose family and friends live in rural areas. It was really nice to be heard. That was fantastic. So my name is Amanda Michaud, and I've been involved with this conference since the very beginning. The goals of this conference have always been twofold. So first, we want to showcase the research that's going on in the Federal Reserve System, but also from our community of scholars that are affiliated with the Institute. And you'll be seeing research from both groups today. But there's a second goal that Abby briefly touched on, which is as the here at the Institute, we're really committed to making the research better. Now, what you're going to see is a program that's topically diverse. It almost sounds like the introduction to a joke or a parlor game, which is what does disability, medical prices, retirement savings, business formation, and performance pay all have in common. Luckily, Raphael gave such wonderful remarks, I don't have to explain this to you. He explained how our job here at the Fed is to two goals, price stability and maximum employment. And all of these underlying workings of the economy are really important for us to understand in order to further those two goals. The diverse program like this cannot be handled by one person. Nobody has that broad of expertise. So I'm really grateful to our program committee who is coming from different backgrounds. We have a couple of people from the Fed, we have scholars from universities that all helped us put this together. You're going to be introduced to 5 of them who will be chairing sessions today, but there is one person who I know is tuning in at home, who is Sandra Black, and she also helped out on the program committee in selecting papers. Now, the discussants in the audience are really critical to that second goal of making the research better. The format for the research portion of our conference is going to be as follows. Presenters will have 25 minutes to tell us a little bit about their research. And the discussants have been selected from a variety of backgrounds and have prepared remarks after reading the paper that hopefully will challenge our views and help us think more broadly about where that research fits. But then the last 10 minutes are a question and answer portion, and that's where we need you. Okay, so we want the involvement of the audience. You guys are all here to contribute your talents and your thoughts to the program as well. Personally, I will mark this event as a success if we all leave feeling a little bit challenged. It's not just about making these one papers better, it's about what's next. How does this change my broader view of the world? Is there something I need to go back and revisit? And luckily, this program will be online for all of eternity on YouTube if you want to come back and revisit some of the ideas. Okay, lastly, I want to touch on an event that we have paired with the research conference since its founding, which is our early career event that's going to be taking place tomorrow. This event is also focusing on making research better. It's going to focus on workshopping the bold ideas of recent PhDs to shape and stretch and fine-tune them into work that is going to, I'm sure, have a big impact on the profession and the world. The topics there are going to range from how mental health impacts the economy to understanding worker shortages and how retailers set prices. I want to thank the system economists who have lent their time and their expertise to reading these papers and will be joining us tomorrow and today. They are Karen Kopecki, Raji Chakrabarty, Greg Gordon, Andrew Goodman-Bacon, Dan Aronson, and Dan Hartley. Also, many of the participants who are here today are going to be staying for tomorrow and lending their expertise as well. So I hope I've set the tone appropriately. I believe we're a community of scholars. We all have something to contribute, and I really hope that you are gracious and very giving of your talents to our program. So to start off the first session, we're going to have our program committee member, Alain Okondo, get us started. Thank you.
All right, good morning, everyone. My name is Lena, and I'm very excited to introduce our first speaker. This will be Veronika Pensiakova from the Atlanta Fed, and she'll be telling us about, in a way, the geography of ideas and their growth. We're very excited about it. Please come on board. And the discussant will be Eric Hurst later.
They're being loaded. All right, I think we're ready to start. Thank you so much to the organizers for including the local origins of business formation on the program. As you see, this is joint work with Emin Dinlersauce, Timothy Dunn, and John Haltwinger, and the usual very long set of disclaimers applies. The motivation for this paper is a really broad overarching question. What is the extent of spatial variation in early stage entrepreneurial activity, and what types of local conditions contribute to it? Now, underlying this question is the fact that we know in the United States that startups are important sources of economic opportunities for the entrepreneurs that begin them. And some of these startups actually end up contributing to job creation across the US. Therefore, inasmuch as there is spatial variation in the extent of this entrepreneurial activity, that might have interesting and important implications for local growth. Yet, it remains the case that in the US, we know a lot about startup activity, but we understand a lot less about the stages that precede it. And what I mean is these early stages when an entrepreneur is developing their business idea and then deciding whether or not to transition that idea into an actual employer business. And it's precisely about these stages of nascent entrepreneurship that we're going to focus on in this paper. By using administrative data, both on potential entrants and then their eventual entry into an employer business. We're going to do two things. We're going to decompose startups into these two margins or components of nascent entrepreneurship. And we're going to start by documenting the distinct contribution of each to the spatial variation we observe in startup activity across the US. We're then going to explore the relationship between these local conditions, startup activity, and the two components I've been talking about. Now, to really continue setting the stage and get everybody to the crux of what this paper is about, let me walk us through three figures, three maps. The first one depicts cross-county variation in startups per capita across the US. And what you'll notice immediately is that there is enormous variation across the US in startup activity. And in fact, startup activity is kind of concentrated in certain areas across the US, including the Northeast Corridor, states like Florida, and states in the West, including Washington State. Now, what we try to argue in this paper is that just looking at startups per capita themselves masks something important going on behind it. In fact, we argue that startups per capita can be thought of as being decomposed into two things: business ideas per capita on the one hand, which is depicted in the red map on the left, and the rate at which those ideas transition into employer businesses, or the transition rate, depicted in the green map on the right. And so what you should notice from these two maps is that there's a lot of variation in each component, but perhaps more interestingly, that you can get to similar levels of startup activity via quite different means. So remember, in the previous slide, you saw that counties in Washington State and counties in Florida both have high startup per capita activity. But the way they get there is quite different. In counties in Washington State, you have relatively low business ideas per capita combined with relatively high transition rates, while exactly the opposite is true when you look at counties in Florida. And so what we try to do in this paper for the rest of the paper is dig a little bit deeper into how meaningful these two components are and what types of local conditions are conducive to business ideas, what types of conditions are conducive to transition rates. In order to do so, we're going to rely heavily on the business formation statistics of the Census Bureau. Now, these data, these microdata, are composed of two key components. The first are applications for employer identification numbers, or EINs. What are these? They're actually quite essential in the United States. Every single business that hires an employee is legally required to have an EIN. So every business in the US has had to fill out this application. The information that we get from the IRS is detailed information about the business characteristics, including what industry the entrepreneur intends to operate their business, as well as why they filed the application in the first place. And here, for example, an entrepreneur can indicate that they intend to pay wages in the future. We also have information about the location down to the tract level. Now, there are two things that are worth noting. First, as I've hinted quite explicitly, we have information about business characteristics. But the IRS does not provide information about the individual entrepreneurs that are filling out these forms. The second is that we have to think about location. And so we've chosen to assign location based on the location of the application. Now, the concern that we had here is that it's not guaranteed that whenever you transition, you're going to transition in the same location that you applied for. So we checked. By looking at all the transitions that occurred, we found that in 90% of the cases, the transitions occur in exactly the same county, And kind of surprising even to me was that in 80% of the cases, they actually transition within the same tract. So we think that assigning location based on application is fairly reasonable. The way that we think about these EINs in our paper is as a signal about an entrepreneur's intent to start a business. Now here you might say, okay, Veronica, there's a lot of people who never intend to hire employees, right? They always just intend to be non-employers. You're gonna be picking up a lot of those. That's true when I look at all business applications or BA. And it's for precisely this reason that for the study that I'm going to be discussing today, we've honed in on a specific subset of applications, wage business applications, or WBA, where the entrepreneur has explicitly listed that they intend to pay wages, and some of them have even put an intend to start paying wages date on that application. And we interpret those applications as a stronger signal of an entrepreneur's intent to start an actual employer business. Now, what's nice about the data is because we have EINs, we can link this data to the longitudinal business database. In doing so, we can identify exactly which applications transition to employer businesses, and the way that we're going to define those transitions is as those that occur within an 8-quarter window. The reason we choose this 8-quarter window is because whether you look at BA or WBA, it turns out that the vast majority of applications that ever transition do so within these 2 years. We're then going to aggregate up our data from the micro level up to the tract by year level. We're going to link that data to external information from publicly available data sources to get a sense of different local conditions. We're going to focus on the period 2011 through 2016. So think about this as post-Great Recession, pre-pandemic, kind of a normal times period. And what do we see? So in the table, I'm providing some means for startups per capita, applications per capita, and transition rates separately for BA and WBA. First, you see that WBA is a lot rarer in terms of applications than BA. So it's not just that every single entrepreneur is putting down that they intend to pay wages. There's about 13.2 applications per capita overall, and only 2.3 in terms of WBA. Also consistent with our notion that WBA is a better proxy for an intent to start an employer business, while it's the case that only 12% of all applications ever become an employer business, nearly 40% of the WBA do. Now with that background, let's tackle that first question. Is it even useful to think about this decomposition? Are we getting distinct pieces of information from the applications or ideas margin versus the transition rate margin? To get at that, we're going to do something really simple, a variance decomposition, where we're looking at startups per capita, and we're thinking about what is the contribution to spatial variation in startups that is arising from ideas versus transition rates. And the table reports the results separately for BA and WBA. First, they're similar, right? So it's not that WBA and BA are giving you completely different pieces of information. Two, both ideas and transitions seem to matter. When you look at WBA, about 2/3 of the spatial variation we see in startup activity seems to be coming from applications per capita, about 1/3 from transition rates. But perhaps most interestingly is the fact that the covariance between these two is really low. And what that suggests to us is that if you want to understand the nascent stages of entrepreneurship and what it means for startup activity, it's not sufficient to just look at one margin versus the other, right? It's useful to think about both individually and distinctly. And that's what we try to do in the rest of our analysis. So just to set the stage here and be really upfront, this is entirely descriptive. I'm only going to be talking about correlations between local conditions and startup activity, ideas, and transition rates. We're going to use a very simple OLS framework where the outcomes, again, not surprisingly, startups, application, transition rates. And what we want to think about are what are the things that might matter when an entrepreneur is developing their business idea and deciding whether to transition it into an employer business. Perhaps one of the first things that will come to mind is that local labor markets might matter, as well as regulatory and legal conditions, right? Now, that's a really big bucket that we try to capture by the inclusion of county by year fixed effects. And what this means is that in all of our results, what we're exploiting is cross-tract variation within the same county in the same year. And what we're particularly interested in are the coefficients on the lagged own tract local conditions. There's a lot of them, So we've grouped them into different categories that we're trying to capture different things through. Demographic characteristics, age, education, race, ethnicity, and foreign-born status of the local population is meant to capture something about the characteristics of the pool of potential entrepreneurs in a location. Relatedly, household economic conditions, income per capita, employment to population ratio, owner-occupied housing share, is meant to capture, among other things, some notion of the types of opportunity costs that potential entrepreneurs in the location might be facing. We also know that potential entrepreneurs are thinking about their potential consumer and product market competition that they'll face. And so in order to get at that, we include incumbent firm characteristics measured using the LBD, including the share of employment in young firms, share of employment in large firms, average firm size, as well as the industrial composition of the location, measured by the industry employment shares of the tract. Finally, while a lot of regulations are measured at a more broader level than the tract, there are some that are quite local, including whether or not you're zoned as a commercial versus a residential area. And that might matter when you're thinking about what would happen with entrepreneurship. And for this reason, we also control for commercial share. Now, we are looking at things at a really granular level, tract level. So naturally, it's not necessarily the case that all businesses are only targeting consumers in their tract or are thinking that they're going to compete with other businesses in their own tract. For this reason, all of the covariates I've just described, we also measure in the neighboring tracts, and we include those as controls in some of our analysis. So what does our analysis show? Instead of throwing up a massive regression table with all of the coefficients on it, let me first summarize our results through a regression decomposition table. Now, what underlies this regression decomposition is the full series of regressions. We run everything with all of the control variables, all of the fixed effects. And then we go in and we calculate the contribution to overall R squared of every single individual covariate. And then just for ease of review, we're going to group them in those categories that I discussed: demographic, household economic, incumbent firm, et cetera. And what we see from there, whether we run the regressions with own tract controls only or those with neighboring tracts, and when you look at startup activity, it's those characteristics that we associate with those potential entrepreneurs or the pool of potential entrepreneurs, namely the demographic and household economic ones, that contribute most to the R squared of these regressions. But when we look separately at applications per capita and transition rates, it turns out that what matters more for applications per capita seems to be some of these household economic characteristics, whereas for transition rates, the demographic characteristics matter a bit more. Now, comparing what we get when we do versus do not include neighboring tract controls, I think surprisingly we find that they don't contribute that much. They don't change much what we see in terms of the correlations with the own tract controls, but moreover, as a whole group by themselves, they don't contribute much to R squared. The other thing to note is that while these regulatory conditions or labor market conditions that we're capturing with our county by year fixed effects are certainly important for understanding variation in startups, applications, and transition rates, they by no means explain the vast majority of the variation that we observe. In fact, just to be fully upfront, and probably surprising no one in the room, is that throwing out some local conditions isn't going to explain all of the variation that you see. And in particular, there's a massive amount of residual variation when you look at transition rates. And in many ways, this makes sense, right? This is the margin when people are thinking about whether to actually start their employer business. And there's a lot of idiosyncratic factors that are likely going around. Now, I will actually come back to this point in a few slides. Let's dig a little bit into what we see with individual covariates. So again, here, we have run the regressions with all of the controls. And what the table is reporting for just a select number of those controls, specifically those associated with the demographic and household economic characteristics, is the percent change in the left-hand side variable that's associated with a 1 standard deviation change in the right-hand side variable, okay? Now, what you see here is that there are some cases that are not surprising, right? So you would expect that when you think about places that have a higher college-educated share, they might likely have more startup activity. And this is true, and it's also one of those factors where we see reinforcing effects, meaning that there's also a positive correlation when you look at separately applications per capita and transition rates. But importantly, this isn't universally true. You actually see some really interesting cases where they have opposite effects. So let me highlight here what's going on with African American population share and foreign-born share. So if you just look at startups per capita, you would expect something completely different is going on, in the sense that places with a higher African American population share are associated with lower startups per capita, while places with a higher foreign-born share are associated with higher startups per capita. But when you dig into the separate components, applications and transition rates, you actually see that they look a lot more similar. Both places with a higher African American population share and a higher foreign-born share are associated with higher applications per capita and lower transition rates. It's just that for the places with higher African American population share, it appears that the negative correlation with the transition rate is dominating, whereas the positive correlation with applications per capita is the margin that's dominating for the foreign-born share. And we think this is potentially interesting. Why? Because whether you're thinking about more identified empirical analysis or a structural model where you're going to include frictions, or thinking about policy, you might want to think about where are potential frictions coming from. And what our analysis suggests is, let's say you are concerned about low startup activity in places with high African American population share. We're suggesting that maybe the place to look isn't so much about things that are associated with ideas, but rather things that are associated with transitions. Now, critically up to this point, I've been grouping all of the applications together, right? But you naturally would anticipate correctly that there's a massive amount of cross-industry differences in the relevance and importance of different local conditions, right? And so this is the direction where the paper is moving right now. And so for today's presentation, I'm going to highlight one result, in particular, our high-tech sector analysis, right? So here, we're interested in the high-tech sector because a lot of times we think about the potential high-growth businesses. And those you might expect are ones that are more concentrated in the high-tech sector than, for example, just overall applications across all industries. And you do see some interesting differences in terms of the local conditions that are associated with startups, applications, and transition rates in the high-tech sector. So here I've repeated the regression decomposition table, and in the left part of that table, I've just repeated our baseline analysis. In the right part of our table, I'm reporting the results for our high-tech sample. And what you see here are kind of two things I want to highlight. First is that demographic characteristics, particularly in terms of applications per capita, contribute more to R-squared variation, or explaining R-squared. The second is that when you look at these really local regulatory conditions like commercial share, you see that they become far less important in the high-tech sector. And that's hinting at actually something quite important. So you don't necessarily expect that the high-tech sector is one that is super local. They're not necessarily targeting only consumers or competing with only businesses in their own tract or even in neighboring tracts. And so this is probably one of the reasons why the commercial share or the regulatory conditions that are super granular don't matter as much. And this is the only regression table I will show you. Again, all of the controls are included, but here I'm only pulling out some coefficients of interest. So remember, applications per capita, the demographic characteristics become more important in that previous slide. What's really underlying this is the far stronger correlation between the bachelor's share of the population in the high-tech sample versus all industries. But there are other places where that relationship is actually weakening. So for example, if you look at all industries, the places with higher older age population tend to have higher applications per capita. But the opposite is true for high tech. In some ways, this is kind of a logical result. We tend to think about the high tech sector as kind of being a younger entrepreneur's game. And our results suggest that we see evidence of that as well. We also see, for example, if you look at the share of employment in large firms, while it's negatively correlated with all of our outcome variables of interest, whether we look at all industries or just the high-tech sample, you do see that the relationship is weakening in the high-tech sample. And we take this as additional evidence, right, that when you're thinking about the high-tech sample, they're not necessarily super local businesses. They're not just thinking about potential competition from large firms in their own tract or even in their neighboring tract. They're likely going to try to have a wider reach. Now, partly for this reason, where we're moving now in our analysis is to do additional cuts of the data. In particular, we're going to look at, and I know Eric is going to talk a bit about this in his discussion, we're going to look at Hearst and Pugsley sectors, so sectors that are dominated by small firms, right? Because you would naturally anticipate that many of those are probably more locally oriented, might attract different types of potential entrepreneurs, and we can try to speak to that in our regressions. To get even finer into that, we're also going to do, or are doing, an analysis where we focus on a certain subset of non-tradables that are very, very local. So grocery stores, restaurants, bars, coffee shops, et cetera, right? And what we think is interesting is we're going to be able to see how those local conditions differ, how important the incumbent firm characteristics are when you're looking at really local businesses versus sort of more high-tech ones that don't necessarily target that kind of market. Now, to bring it back full circle, let me go back to the original question, which is, how useful is this decomposition and the local characteristics associated with it for understanding spatial variation in startup activity? So what we're doing here is we're taking all of the tracts in the United States and we're ranking them based on their startups per capita and putting them into startup per capita deciles. And then in the left figure, we're calculating the average rank of these tracts within each of the startup per capita deciles based on their applications per capita and their transition rates. In the right figure, we're doing something slightly different. We're predicting applications per capita and transition rates based on the local condition regressions that we have, ranking them, and then also calculating the rank within the startup per capita deciles. And the first thing to note is that the story is consistent whether we use the raw data or our predicted values, and they're telling us that high startup tract locations are characterized more by what's going on the ideas margin, right? And in particular with the local conditions that are associated with the applications per capita. Whereas low startup per capita tracts seem to be characterized a bit more by what's going on with the transition rate margin and the local conditions associated with it. And what that suggests to us is that if you're thinking about what is conducive to startup activity, even though the local conditions we consider don't explain all of the variation in startups, or applications, or transition rates, they are useful in giving you information or insights in the types of locations that are going to be conducive to startup activity versus not, and they're going to give you some insights about whether the candidates for why you see the level of startup activity, let's say low startup activity, might be arising from things going on with idea generation versus what might be going on with the ability or the incentives to transition those ideas into employer businesses. And so what I want to conclude with is just a little bit of this. That in this analysis, we think we're, in an exciting way, uniquely positioned to be able to look at the full startup per capita distribution, right? We have all of the applicants for EINs, we have all of the startups. And so we're able to look both at businesses that might end up in the right tail of the startup growth distribution, sort of your gazelles, your high growth potential firms, as well as ones that will never grow. And we think looking at both is valuable. We think that our analysis on the high tech sector is starting to get a little bit at what's going on with these high growth potential types of firms. And the analysis we're after now is going to tell us a little bit about what's going on with probably the ones that will grow less. And we think that it's still valuable to think about the ones that will grow less. Why? So remember, we are looking at a very local level, down at the tract level, at employer businesses. And so it's not just the case that these businesses are providing economic opportunities for their own entrepreneurs that started the businesses, but they're likely also providing local jobs. They're providing local goods and services that the community might value. And in that sense, we think they're interesting, and it's worthwhile to try to understand what types of places attract those kinds of businesses versus those kinds of places that don't. Thank you.
They told me how to turn this on. I did it correctly, I think. Two quick things. First, I just want to thank the organizers for putting this together. They told me I can't walk too much further, so if you see me walk any further than David or the front row, I'll be in trouble. But I want to thank the organizers. In particular, I am giving the keynote at the Philadelphia Fed's conference tomorrow, and when I told Amanda that, she said, no problem, we'll put the paper early, there's a 1 o'clock flight, you'll be able to make it in time, but I'm mentioning that because I'm going to have to leave directly after this for another conference. And the second comment was, I predicted Veronica would have summarized the paper tremendously, so I'm going to do very little of that and just kind of get into a little bit of broader comments that she touched on at the end. So what the paper is after is looking at a spatial variation in some ideas of, entrepreneurial activity across the country at various levels of aggregation, at the county level, at the tract level, et cetera. And so their measure is going to be, the outcome, what they call a startup, is going to be an employer firm per capita, is kind of what they're after. And then they break that into two components. One they call idea generation, which is going to be, did you apply for an EIN? That's what an idea generation means in the context of the paper. And then there's going to be the transition rate from that idea into a startup, which is basically, did you ever hire an employee? So the parts of data that we're going to see is, did you apply for an EIN? And then, did you eventually hire an employee? The intersection of those, that's going to be the startup rate per capita. And then the goal of the paper is to correlate that with stuff and see if we could explain what explains part of the variation, at least in a correlation sense, across startup per capita in the data and its components, idea generation and the transition rate. So that's the paper. So what I'm going to do is going to kind of take a step back. And, to be honest, John and I have been doing this for almost 2 decades, where he discusses my papers, I discuss his papers, and we go back and forth. And I think we've come to a somewhat of, even though distinct perspectives, that are consistent with each other. So we go to these kind of talks, and I say, hey, essentially, no small business grows. And then John comes back and says, essentially, all growth comes from small businesses. Those two things are consistent because of the immensely skewed distribution of where these kind of entrepreneurial growths come. They are very rare, but when they happened, they are very impactful. And again, through our years of discussion with each other, you heard Veronica mention it, John labeled these gazelles, and so now we talk about these small firms that eventually, they're very rare, but then eventually they move very fast. And so what I'm going to do just for a few minutes is kind of show you what the distribution of EIN types and employer types are going to look like. And then we could kind of take a step back and see exactly what types of questions are we going to be finding these kind of decompositions useful. So I'm going to kind of highlight some work that I've done with Ben Pugsley across 2 different papers. Our paper, What Do Small Businesses Do?, where if you go to Brookings, John was the discussant on that, and his comments are there. He was a little grumpier in his first iteration than he is now. If you take those comments through, 15-year-old ago, John. And then a second one in a volume John published for an NBR volume, Wealth, Taste, and Entrepreneurial Choice. And so in these papers, Ben and I just kind of throw some descriptive statistics of what the small businesses do and what both on their composition and how they grow, et cetera. And so I'm going to show you some statistics on the next slide from the U.S. Statistic of U.S. businesses from the early 2000s, another stable period, post-2001 recession, pre-Great Recession. And I'm going to basically look at 4-digit industries. And what I'm going to show you on the next slide is let's take all industries in the United States with less than 20 employees, all firms in the United States with less than 20 employees. So that's going to be my denominator. And then I'm going to count of those firms with less than 20 employees, what industry are they going to be in? And I'm going to show you those shares. And on this next slide, here is the top 60%. 60% of all small businesses are in one of these 30 3-digit industries. So when we're thinking about these EIN generators, what you should have in your mind, by far the 10% of them themselves are going to be basically in restaurants. of these kind of small firms, either sit-down restaurants or limited service restaurants, fast food restaurants. I always like to mark that among these small firms, about 3.5% of them are religious organizations. These are all of your local parishes who have an employee are basically in this data as well. So we're basically, say, 10% going to be restaurants and churches and such. The blue ones here you should think about is another, I'm going to say another, 20% or so are going to be, kind of your skilled professionals, your doctor, your dentist, your real estate agent, your small lawyers, your accountants and consulting services. Again, these are kind of small in location, but that's what you should also be thinking. These are also these are probably the most akin to an occupational choice. It just so happens when you become a doctor, eventually the structure of your doctorness is you buy into a practice at some point, and then you become, a small business in your doctor practice. I'm going to tell you the other sides are going to be your skilled craftsmen. Okay, these are the people who are going to build the infrastructure of the local community. Your painters, your roofers, your plumbers, your electricians, your contractors for both residential and commercial construction. Again, another human capital intensive industry that is very hard to scale. But again, that's kind of when we're thinking about small businesses, and the rest are going to be on this list are just the small shops, your gas stations, your dry cleaners, your grocery stores, etc. So when we're thinking about EIN producers, again, that's what we are. Again, I don't want to minimize this, but I think in some of these, they are more akin to occupational choice. In others, they are a little bit more akin to providing local school services. So as a first approximation, a lot of the EIN producers are going to be your plumbers, your dentists, your dry cleaners, and your lawyers, which again, those are good kind of occupations, but that's kind of what we're talking about. When we do the spatial variation in your mind, you should be thinking about the spatial variation in restaurants, plumbers, and dentists, all else equal. Okay, now I'm going to kind of, that's what I just said on that side. So we also, in kind of those papers collectively, more in the former, our Brookings paper, used 2 data sets that also tracked people on the eve of inceptions of ideas. It's not from EIN generation. It's basically the surveys that were being done at the time, and they call people on the phone. They say, hey, Jonathan, are you thinking about starting a business? And he says, actually, I am starting to think about starting a business. And then he's in the sample, okay? And then we follow him throughout that business journey. Most of the time, he might not have started a business, but he was at least thinking about it at a time. So both the Kaufman Firm Survey and the panel study of entrepreneurial dynamics had these samples of what nascent entrepreneurs, people on the cusp of small businesses, they didn't have an EIN at this point yet, but they were thinking about it, and then transitioned over time into small businesses. So I'm just going to kind of show you some data on this. So this is from the Kaufman Firm Survey, and so these are going to be focusing on survivors. These are people who actually lasted 4 years. So they started a business and they lasted 4 years. So they had revenues consistently over these 4-year periods. So ask them how many of them added an employee. And so about half of them, a little less than half, 40%, added more than 0 employees, added at least 1 employee. But hardly any of them ever added more than 5 or 10 employees, like 10% and 3%. Going on. And just so you guys know, it's just a statistic. This is also what in the data Veronica showed before. Essentially, none of the EIN people ever became employers. Even the ones that said they were going to be employers, said, I'm going to hire an employee. That was only about 30-some% of those ever turned. So 70% of the people who reported in starting a business never even got to that. Let me just kind of show you some from the panel study of entrepreneurial dynamics. They asked the people in the survey, Jonathan, on the inception of starting the business, a whole bunch of questions about what they wanted to be when they grew up. Like, do you want to be big? Do you want to be innovative? Do you want to have employees? And so here's some of that data right here. So this is the percent of new firms in the panel study of income entrepreneurial dynamics that reported that they wanted to be big, and these are the ones who actually got employees eventually. So I've thrown out the nascent ones and actually took the ones that actually started having some revenues down the line. And only about 24% of them said that the best describes their preferences for the future size of their new business is, I want this new business to be as large as possible. And when you ask them what their forecasted of their number of employees are, the median firm was basically saying 4. Almost all of them had less than that, but it was at least reported that their natural scale was going to be relatively small. This is the last one I'll show you, and then I'm going to end with a couple of questions, and I'll conclude. Oh, God, I've already lifted too far for the camera. Am I okay? I'm going to be back in the back row in a second. So this is basically another side of, are we going to do an innovation part of these small businesses? So there's a question that asked them, what is your business going to be like? Are you innovating new products? Are you thinking about developing something that the market hasn't seen before? But then there was another option, is basically, I'm only going to produce a product that is already being served in my local area, and it's already targeting the same customer base. Those are your dry cleaners, your plumbers, your things like that. There's already dry cleaners and plumbers in the area. So they're just coming in as another small business in a small-scale service in these types of areas. And again, I'm only making these points to kind of give you a sense of kind of the distribution of the small businesses that we are talking about. Let me end with just 3 questions that I had when I was reading the paper. And so the first of these is, what is it that we're trying to explain with the variation that we're seeing in the data? We see EINs of people. We see them, some become employers. Again, you even heard in some of the language Veronica said, is there frictions or barriers or local restrictions that are preventing this? Or is it that people just sometimes have bad ideas, or there's some ideas that are just naturally small scale, like single plumbers that might respond to construction demand in the places that never is going to add an employee ever. My older brother works as a skilled craftsman. He's a roofer. Basically, 90% of the time, he has no employees. About 10% of the time, when things get really busy, he will add 1 or 2 people to kind of work from him. But again, these people never wanted to add more than 1 employee going forward. The second question, okay, so if we figure out what we want to think about between the frictions of starting a business, or applying for an EIN and then hiring a worker, we could think about what those kind of barriers might be. Why would they vary spatially? That's kind of the next point. And so again, a little tenor of the paper is, there could be frictions or so, but I also want us to think a little bit about industrial mix. We know that is very spatially correlated. And so in places that are very heavily manufacturing, less services, you're going to have more employment in manufacturing, which is big scale, and less employment in services. And we know some parts of the country are heavy manufacturing centered. And so when we take a look at this picture and you see where is the vacancy in kind of small business startups, it is basically the vacancy is in the places where manufacturing is most predominant. And again, because these tend to be small-scale services, and when you have less services, you're going to have less entry into these types of businesses. So how much of this is just occupational industry differentials across space versus some sort of frictions? And if it is frictions or barriers or sorting, there's a whole bunch of stories we could tell where there might be local agglomerations, and that's why things accumulate. There could be barriers, that's what it is. People are going to sort in the background. The question is there any evidence of those types of things we're trying to proxy for throughout the data? And demographics do some of that. But again, if it's really a friction story, which is I think some of the narrative of the paper, is that we'd love all places to be dark in those pictures, but not every place is. And so there's a tenor in the paper, is that a friction? And that might be the case that there is, but the more we could do to kind of unpack where those differences come from would be good. And then, this is kind of a deeper question. And I think you could see Veronica's answer towards the end. I think she was responding to my slides coming forward, because it's not, what is it we're trying to capture? And again, maybe the goal of the paper is to explain the spatial variation in plumbers and dry cleaners and restaurants. And so that could be good. And you can see in the data that the biggest thing in our demographic predictor in terms of R-squared was commercial district. If you're looking at a local level, where are the plumbers going to be, or where are the restaurants going to be? In the commercial districts. And so that was the biggest thing in the R-squares in some of those. So is that what we're trying to explain, is spatial variation in community districts? Or are we actually trying to get something about trying to identify places that are going to create gazelles? And if we're going to do that, maybe looking at the high-tech sector, maybe looking at regional variation in VC funding, something else that could try to get a sense of the spatial variation in this high-tech stuff. Now, if we just want to understand occupational choice and a little bit of industry, where's a dry cleaner, which is, you're going to do some dry cleaning, but you might also hire a couple of workers at the same time. It would be good to illuminate what those goals are going to be and then try to have studies and analysis that kind of supports each of those. Look at that, right on time. I'm done. Thank you so much.
Thank you so much, Eric. And so the way we'll do the Q&A is that we're just going to gather all the questions together, and then Veronica will come up and she'll respond to those questions and anything she'll have to say about the discussion as well. So we have Natalie and Richard in the back. Just raise your hand, and we'll be collecting questions. Super. Thank you.
I've been doing this for decades.
Okay, thank you so much for your paper. I had a quick question about, so thinking about the ideas margin, once you were throwing up these results about demographics across place, something that came to mind for me was, what about outside options as well and how those differ by different groups? I'm thinking about a recent JPAM article by Brittany Street and others that shows that people who have criminal justice records are more likely to be self-employed. And so I was curious, when you're thinking about that first stage of ideas, whether you've also been thinking about what is someone's outside option, even if two people have the same idea, but one has a better option to get hired by a firm. How do you think about that? Thank you.
Yes, hi. So I had a follow-up. I think it's similar to something Eric mentioned. So I'm trying to interpret the results, and the thing that came to my mind is it seems like we're trying to suggest that the quality of ideas is equal across space. And I'm trying to understand if it's not possible that it's just that some places have worse ideas, but they have a lot of them. And some places have good ideas, and then those are the ones that have high transitions rates. And in some sense, the interpretation of low transition or high transition is conditional on the quality of the idea, and then it's harder to interpret.
I was wondering if you could do anything to kind of get at access to capital, like barriers in access to capital in certain neighborhoods using your data. Thanks.
Just as we go, I know everybody knows. Oh, sorry. Just introduce yourself so that others don't know who you are. Thank you.
Dan Hartley, Chicago Fed.
Thank you, Dan.
Jonathan Dingle, Chicago booth. I think my comment is just a reminder that tracts are small and startups are rare. So tract is about 4,000 residents, so it's going to have about 1,000 prime age workers. So when you have like 0.7 startups per 1,000 prime age workers, it just means you have about 0.7 startups per tract. And that has implications for how you think about reporting your results. So like if the true expected value is half a startup in the tract, your R-squared it's never going to get that high because there's the integer constraint. It comes out as 0 or 1. So you want to think a little bit about what it means to explain variation when you're looking at that level of a granular outcome. And Azim Sheikh and Magda Mogstad and some other folks have a paper about inference for ranks, that ranking tract level outcomes is extremely difficult, and your confidence intervals are probably going to be very wide. Thanks.
I have a similar question about your choice to do this analysis at the tract level instead of the county level. So I'm wondering if you have ever done the same analysis, but instead of using county fixed effect, using state fixed effect, and does that change any of the coefficients, especially around the demographics?
Hi, Kevin Rins from the Washington Center for Equitable Growth. I was wondering if you know the identities of the people associated with the business applications, and thinking in particular about the demographic characteristics, given the relatively fine geography you're working at. How do you know that you're really getting at the effect of like other people in that place as opposed to the characteristic of the person themselves?
Any additional question? All right. Maybe I'll add one there. First of all, I know this is using detailed administrative data. It can be a little bit of a thankless work in our field. So thank you so much. Can you just tell us a little more about maybe some other components of the actual underlying application that you wish or hope to be able to use later that you haven't been able to turn to? and then you can just come up and selectively answer as you can. Thank you.
All right, let me start by thanking Eric for the really useful discussion, especially given the direction that we're taking the paper. I think all the points are super well taken, and I think the paper is really one where right now we're working on exactly this idea of, well, what are we trying to explain and what insights can we get? And that's precisely why we've done and are moving towards doing all of this subsector analysis, because I think that's going to help us kind of tease out some of the things that you're concerned about. So really well taken, and we'll definitely look at your slides closely when we and it's already given me some ideas that I'm excited about. Okay, now to turn to some of the questions. Some of them are a little easier to answer. So Kevin, unfortunately the IRS right now doesn't give us the identities. I know that there's some work with individuals at the census that they are trying to get the SS4. So I think we've done some reflection, and this is gonna relate to another question, which is, why are we doing things at the tract level and what do we think we're capturing, right? So tracts are small, and so in that sense, what we want to think about with the demographic characteristics is we're thinking about the pool of potential entrepreneurs in that area. In an ideal world, we would be able to measure individual characteristics. We simply can't right now. So I don't have an answer for you for whether or not we're, are we measuring the individual or measuring the pool of individuals? It kind of depends on how homogeneous the tract is in terms of some of these demographic characteristics. Thank you so much for your comment. I need to talk to you about the citation because you've mentioned this before and I have trouble jotting it down. So thank you for reminding me of that. Okay, so in terms of some of the additional things, for example, opportunity cost or access to capital, we are actually working right now on revising some of our results with exactly these kinds of things in mind. So we haven't actually thought about the crime statistics. That's a super important one. Where we are moving in terms of thinking about opportunity cost is sort of how would you map this in a model? A lot of times you think about, for example, what is the unemployment rate in the location or what are kind of the labor opportunities? And that's actually what we're going to start measuring now. In terms of access to capital, I think one of the things we think about is housing, right? A lot of times some of these small businesses, you want to use housing as collateral. Okay, in an absolutely ideal world, I would be able to measure this at the tract level. I can't. So what we're trying to get at a little bit more is from the data that we're using, we get information about kind of your medium house value, for example, and we're going to try to see if we can use that or potentially even better proxies to get precisely at this potential access to capital. And absolutely, Diego, about the quality of ideas. This is actually one of the reasons why we're doing a lot of the subsector analysis, because we think that in a very similar way that Eric was talking about, that there's going to be a lot of differences in the quality of ideas if you think about quality of ideas as those that may potentially end up being high growth. And so we think that by doing some of this analysis of different kinds of sectors, we can start getting a little bit of a story that's related to that. I apologize if I've missed any of the questions, and I'm happy to talk to anybody who wants to chat about this more. Thank you so much. I really appreciate all the comments. Thank you again to Eric for the excellent discussion.
All right, perfect. So now we're going to have a break to talk with each other, discuss this paper, meet new people, and we'll start up again at 11:35 a.m. Central Time.
All right, so our next speaker is going to be Taha Shohman, and he's going to talk about racial and intergenerational gaps in retirement wealth accumulation. And for the discussant, we will have Nadia Karamchova from the Congressional Budget Office.
So is there a clicker? So thank you for including the paper in the program. This is joint work with Jorge Colmenares, Cormac Odea, Jonathan Rothbaum, and Larry Schmidt. So we have a very long disclosure, and this only represents our views. So every year, the US devotes the equivalent of 1.5 percentage point of GDP to encourage contributions to retirement savings plans, such as 401k and 403b plans. Employers contribute roughly $240 billion a year to these plans, mostly in the form of matching contributions. You put $1, your employer is going to put 50 cents up to some cap. The government offers a tax beneficial treatment for these accounts. Money grows tax-free. You can defer paying income tax on your contribution, and that represents a tax expenditure of roughly $200 billion a year. This institutional design is going to benefit those who can and do save more for retirement. If you don't put money in the plan, you're not going to get the employer match, and you're not going to get any of the tax benefits. And so in this paper, we're going to link newly collected data on employer retirement plans with administrative and tax data to study the distributional impact of these incentives. In particular, we're going to focus on differences in the receipt of these saving incentives by both race and parental background. And we're going to do so trying to mostly focus on differences holding income constant and therefore Social Security constant. The idea is that if people have the same earning but receive different amounts of these saving subsidies, the broader retirement system, especially Social Security, is not going to mitigate the effect of these differences. So the question we're after is, how do retirement incentives contribute to wealth inequality by both race and parental income? And the reason we believe that this could be a potentially important channel for wealth inequality is that retirement wealth is the second largest asset class for US households. These plans are also one of the best investments available. We find that the average employer match is equivalent to a risk-free, immediate 60% rate of return on your savings. Okay, so if you want to start building wealth, this is probably one of the best places to start. And yet, many workers do not take full advantage of the incentives available to them. On average, workers forego 1.7% of their salary by not taking advantage of these employer matching contributions. So when thinking about incentives for defined contribution savings, you can think of two separate effects. First, there are behavioral responses. You get an incentive so that people change their behavior and contribute more to these plans. Here we have a pretty large literature that finds small to insignificant behavioral responses to these incentives. Particularly, it seems that people mainly shift the location of existing saving, moving money from their non-retirement accounts to their retirement accounts, rather than creating sizable new retirement savings. But these policies also have a mechanical effect. Even if people don't change their behavior, they will receive a transfer through the employer match or the tax incentives. And we think that these mechanical effects are large. This is a large transfer of over $400 billion a year, and yet it has received less attention comparatively in the literature, and that's going to be our focus today. So we link to a number of literature. There's a rich literature on racial wealth inequality that's been large and persistent in the US. We're going to provide some evidence of how the design of these retirement incentives contributes to it. There's a literature on how policy design can affect racial wealth outcomes, and here we're going to look at some counterfactuals, thinking about how changing the design of retirement incentives can reduce racial wealth inequality. We also link to a literature on intergenerational wealth persistence, and in particular that there seems to be an intergenerational persistence in rates of return, And here we're going to study a mechanism where, to the extent that richer parents and their children are more likely to save in these accounts, is going to create a positive correlations in the rate of returns across generations. So at a high level, I'm going to focus on three main findings. We're going to document that there are large gaps in retirement saving by both race and parental income. We're going to find that tax and employer matching incentives are going to amplify the impact of these saving differences. And I'm going to show that budget neutral reforms could close some of these gaps by roughly a third. So let's start with the data. To study this question, you need to see how much people contribute to these plans. You need to know something about them, their race and ethnic identity, their family background, and you need to see the incentive available to them through the employers. So such data didn't exist at a large scale, and so we decided to create it. So we have survey and administrative employee data on earnings and retirement saving decisions. So through the American Community Survey, we see people's race, education, location, and occupation. We have 12 million unique respondents to the ACS between 2001 and 2019. We have this linked with tax data. We're going to see through your W-2 how much you contribute to these retirement accounts, how much you withdraw early from these accounts. And we've linked this employee data set with a new employer data set on retirement plan characteristics. So every employer with a retirement plan of more than 100 participants has to file every year a form called the Form 5500 with the Department of Labor. This form contains a narrative description of the plans. So it's going to look like this. And so we had a team of research assistants in India and in the US read through over 50,000 of these PDFs and collect data on eligibility for the plan, the matching schedule, the vesting schedule, and auto feature. You have auto enrollment, what is the default option? As you can see, this is from one cross-section. These matching incentives vary a lot across employer. Depending on how much you save, and depending on your employer, you may get a very large employer match contribution or a much lower match contribution. So we bring this data and merge it with the employee data set, and we're going to focus on two samples. The primary sample are going to be people between the age of 25 and 59 who file taxes and have a W-2. We're also going to look at a smaller sample of younger people who we can link to their parents. So we're going to see them claimed as dependent by their parents, and we're going to follow them as they leave the parental household. And so these are going to be individuals under the age of 42 in 2020. So first, we document differences in contributions to these accounts. I'm going to focus first on, first result is going to be on the effect of matching. So you can see here, if just you take the raw data, white workers contribute roughly 40% more to these accounts than their Black or Hispanic counterparts. Similarly, those with parents in the top quintile of earnings are going to contribute over 40% more than those with parents in the bottom quintile of earnings. These employer matching subsidies are going to amplify the effect of these differences in saving. White workers are going to receive over half a percentage point of salary more in employer matching than their Black and Hispanic counterparts. Those with parents in the top income quintile are going to receive almost a percentage point more in employer matching than those with parents in the bottom earnings quintile. Now, obviously, there are differences in earnings between these groups, but these earnings differences are smaller than the differences in matching receipts. So in particular, and this is well known, Black and Hispanic workers earn roughly 75 to 80 cents on the dollar of labor income around the median. This is a well-documented wage gap by race in the US. However, the racial gap in this specific part of compensation, employer matching contribution to 401k plans, is twice as large. Black and Hispanic workers earn roughly 50 cents on the dollar of employer matching earned by white workers. You see a very similar picture by parental background. There is a gap in labor income by parental background, but the gap in employer matching is twice as large. So this suggests that not everything seems to be explained by income. So now we're going to move to a regression framework. The outcome variable is going to be your total contribution rate. The shaded area is the part due to the employer contribution, the dark area to the employee contribution. And so this is just representing the same evidence I showed earlier. Black and Hispanic workers contribute 35 to 40% less to retirement accounts. Controlling for year and age differences doesn't affect this estimate a lot. Controlling for differences in income across groups can account for roughly half of these differences. Similarly, there's these large gaps by parental background. Controlling for income explains a little over half of these gaps. We can control for even more characteristics. We can compare workers who work in the same firm with the same level of education, gender, occupation, live in the same county, have the same tenure level, and we still find sizable differences in total contribution rates in the order of 14% between black and white workers, 7% between Hispanic and white workers. Again, same thing, sizable differences are going to persist even among coworkers with the similar characteristics of roughly 13% between those with parents in the top income quintile and parents in the bottom income quintile. Okay, so far I've showed you separately evidence on differences by race and differences by parental background. Now we're going to bring the two together. And so we've shown that the kids of the rich save more. And in particular, they save more even conditional on working in the same firm, earning the same income, having the same level of education. So I can show it here. These are regression coefficients where the x-axis is parental income decile. The y-axis is the difference in contributions relative to those with median earning parents. If your parents are in the top income decile, you're going to contribute 0.7 percentage point more to these accounts than your coworker with the same earnings with parents in the median income decile. Now, taking this and the fact that there are large differences in parental income by race around the median earning, if you're black or Hispanics, your parents have income of roughly $50,000. If you're white with a median earning, your parental income is closer to $100,000. Bringing these two figures together suggests that part of the differences in contribution by race may be accounted for by differences in parental background. And so here, this is the residual gap I showed earlier, controlling for household characteristic, your spouse's income, are you married, do you have kids at home, and controlling for parental income can account for roughly a third of this residual gap. But we still see difference even after accounting for these broader household and income characteristics. Why might parental income be a driver of saving in these accounts? Well, it could be that richer parents are able to insure their kids against risk. And if you're better insured, you may be more willing to put your money in an illiquid account, such as a 401k plan that you cannot access early without penalty. In contrast, kids of poorer parents may in fact be using their available resources to insure their parents against risk, and thus are less able to take advantage of these retirement saving incentives. So we've documented these differences in contribution to retirement accounts, but what matters are also differences in withdrawals from these accounts. Indeed, early withdrawals, taking money early before reaching retirement, is going to reduce the benefit from these accounts. If you withdraw early, you're going to forego the long-term tax benefit of letting money grow tax-free in these accounts. Early withdrawals are often subject to a 10% tax penalty in the US, and you may lose your employer match if you're not fully vested, and in a sample period, you may get suspended from the plan and from earning the match for 6 months. These early withdrawals are very common. There's evidence that 10% of Americans aged 40 to 59 take a penalized withdrawal in a given year, and over a 12-year period, early withdrawals account for 22% of contributions. And so 22% of the money seems to leak out of these accounts early. When we follow, I'm going to show evidence on early withdrawals, but we're not able to separate penalized withdrawals that are subject to this 10% penalty from non-penalized withdrawals. So this is what we find. The outcome here is the 0, 1, and it's a dummy equal to 1 if you took an early withdrawal of at least $1,000, conditional on having saved some money in the last 5 years. What you find is that Black Americans are almost twice as likely as white savers to take an early withdrawal. The gap with Hispanics is smaller, 18%, and even after controlling for income and a whole host of individual characteristics, there's this really large racial gap in early withdrawals from retirement accounts. We see equally large gaps by parental background. If your parents are in the bottom income quintile, you have an 80% higher probability of taking an early withdrawal than someone with parents in the top income quintile. So these early withdrawal gaps are large, and they're largest following large income drops. So here on the x-axis are these income growth bins in ventiles. So the first bin corresponds to people whose income essentially drops all the way down to zero. You see that when you experience large income drops, Black savers have a 50% chance of taking an early withdrawal, and the gap with white savers is larger. You see the same thing by parental background. Following large income shocks, early withdrawals are going to be higher for all groups, but the gap between those who have the richest parents and those who have the lowest income parents gets wider. So to us, this suggests that we can think of these penalized and non-penalized withdrawals as revealing a preference for liquidity. If you're taking an early withdrawal, you're revealing that you don't have access to a cheaper form of liquidity. And this is a point made by a paper by Cohen, Fadlan, and Porcio. So to us, this is suggestive that liquidity constraints are binding more for Black Americans than for white and Hispanics, which is consistent with some other evidence in the literature, and they're also binding more for those with lower income parents, especially following an income shock. If you don't have the safety net of having parents with resources, you may be more likely to tap early in your retirement account and forego the long-term tax benefit of retirement saving. This also suggests that the fact that we've decided to make these accounts illiquid, there's nothing about these accounts or the underlying assets that's fundamentally illiquid, may deter participation and lower contribution rates ex ante. If you know that the money is locked for 40 years and you have binding liquidity constraint, you may be less likely to put money in these accounts. And this is also consistent with some of the evidence in the literature that when employers offer a loan option in 401k plans, participation increases. So, documented sizable differences in contributions by race and parental background, sizable differences in outflows, early withdrawals from these accounts. Now we're going to bring these two pieces together with a micro-simulation model to think about the lifetime effect of these incentives and think about policy counterfactuals. So, and in doing so, we link to a long tradition in the literature of distribution analysis of the retirement system. And the takeaway from this literature that goes back to work by Diamond in the 70s is that we have these regressive subsidies for private saving. I think people have long recognized that subsidies for 401k plans mostly accrue to high-income workers, but these are balanced by other aspects of the system. In particular, the fact that Social Security is progressive, is going to give more to those with lower lifetime earnings, and the fact that the system has income-based non-discrimination testing. Every year, each plan has to show that the benefits and the employer match doesn't accrue overwhelmingly to highly compensated employees. However, the focus on income, which has been the focus of most of the literature, misses some important distributional aspects. As I've just shown you, there are large differences in contribution across groups, by race and parental income, even conditional on income, and so only focusing on income may understate the regressivity of this system. And these are unlikely to be undone by Social Security because Social Security is independent of your race or your parental background. So what we do here to get at this lifetime effect, we're going to simulate whole life cycle by taking following people over 4 years and then linking them to people who look like them. And this way, we can create a full life cycle. We're going to put this simulation through a model of taxation and Social Security. We're going to make some assumptions about portfolio composition, asset returns, and withdrawals. What we get from this micro-simulation model is both a measure of defined contribution wealth at retirement. And we can divide this retirement wealth into the part that is due to employee contribution, the part that's due to employer contribution, and the part that's due to this tax expenditure. Using the model, we can also look at broader measure of wealth, in particular a measure that includes Social Security, and put our study in the context of the broader retirement system. So what do we find? Here on the x-axis are quintiles of earnings, of lifetime earnings, with the last quintile divided in 2 deciles. And so what we find is that across the board, over 40% of the wealth in this defined contribution account is accounted for by the mechanical effect of employer and tax incentives for retirement saving. Using the model, so this is a figure I showed you that showed that these employer matching benefits are more unequally distributed than labor income. But using the model, we can also look at the distribution of lifetime tax incentives. And what we find is that over a lifetime, black workers earn only 30 cents on the dollar of lifetime tax benefits that white workers receive. And this is in part due to these early withdrawals that are more common among black savers. Similarly, for Hispanic savers, they receive roughly 60 cents on the dollar of lifetime tax benefits. We can do the same thing and look at the distribution of these tax benefits that we cannot read directly in the data because they depend on the full path of contribution and withdrawal over a lifetime. And again, we find that gaps in tax benefit are almost twice as large as gaps in labor income. Finally, we can use this microsimulation model to study counterfactuals, where we break the link between compensation and saving. And we're going to do so in a budget-neutral way for both firms and for the government. Okay, so what we do is that we go firm by firm, sum up all the employer matching contributions, and then redistribute them so that all employees in a firm receive the same percentage of salary. Okay, so it's going to be 3% for everyone, or 5% for everyone, and in a way that keeps the bill for the firm constant. We do the same thing for the tax benefit. We sum up all the tax benefit, and then we redistribute this $200 billion of tax expenditure in a way that's proportional to lifetime earnings, so that everyone gets the same share of their lifetime earnings contributed to the account, rather than these tax benefit depending on how much you save and how much you withdraw. So doing so, again, on the x-axis are quintiles of earning. Doing so can increase the wealth in these defined contribution accounts for white workers, especially white workers in the bottom income earnings. For white workers in the bottom quintile of earnings, it's a 70% increase in retirement wealth. However, the effect for black workers is much larger. At the bottom of the earnings distribution, that's a 133% increase in defined contribution wealth. And all the way up to the 9th decile of earnings, black workers are going to benefit. This is obviously going to come at the expense of lower DC wealth at the very top for those with the highest earnings. And finally, we can do the same thing for Hispanic Americans who would benefit by sizable increases in DC wealth. Now, this is DC wealth. DC wealth is one part of the system. If you look at a broader measure of retirement wealth that includes Social Security, you still see sizable increases in the broader retirement wealth, roughly close to 10% for people in the lowest income bins. Again, at the expense of lower retirement wealth for those in the top. We can do the same thing by parental background. Again, these simple counterfactual would mechanically increase retirement wealth at the bottom of the earnings distribution, and especially for those who have lower income parents relative to those who have higher income parents. In the paper, we have a bunch of robustness checks looking at how different assumptions about the behavioral responses to these policies would affect these results. Finally, we can look at the effect on these contribution gaps. So what we find is that these counterfactual would reduce the black-white gap in DC retirement wealth by roughly 1/3, especially for low-income earners, the Hispanic-white gap by similar amounts, and the gap between those with the highest income parents and lowest income parents by also roughly 1/3. Okay, so to conclude, we've conclude, I want to go over this site from Hamilton and Doherty, Doherty being one of the members of the Institute Advisory Board, that conjecture that if the existing federal asset promotion budget were allocated in a more progressive manner, federal policies would go a long way toward eliminating racial disparities and building an inclusive economy for all Americans. And so what we do in this paper is try to put numbers behind this statement. We show that retirement and saving incentives are a large part of the US federal asset promotion budget. Their mechanical effect alone accounts for over 40% of the wealth in retirement accounts. And budget neutral reform could close roughly a third of the wealth gaps in these defined contribution accounts. More broadly, I think our evidence suggests that distribution analysis of policies should look beyond income. Differences by income tend to understate how regressive the system is. Even among people with the same income, depending on your parental background or race, you'll receive different amounts from these incentives. And the current institutional design, although it is race neutral, is going to amplify racial wealth inequality and lead to more intergenerational persistence between generations.
So did I manage to turn this on? Okay. Hi, everybody. So my name is Nadia Karamcheva. I'm an economist at the Congressional Budget Office. Thank you very much to the organizers for inviting me to participate. I'm very happy to be here. And also, thank you for giving me the opportunity to read this paper. It's a very interesting research project, which I enjoyed reading. I had just started reading the paper when Taka sent me a revised copy, and I was very happy to see that instead of 130 pages, the new copy was only 100 pages. But actually, he did an excellent job of summarizing the main set of results in his presentation. So I'm going to say very little about that and kind of focus on, just asking some questions and a little bit more food for thought and what else can be done with this paper, or maybe in future research projects. So my disclaimer is much shorter, just one sentence, but I think just as important. So these are obviously my views, should not be interpreted as views of the Congressional Budget Office. So what I'm going to do first, actually, is I just want to highlight the importance of this topic. So I'm going to step back and kind of talk a little bit more about the overall background and how, why should we care about retirement saving, either in the form of employer-sponsored retirement plans or Social Security. So I just want to highlight how important those two aspects are in the overall U.S. economy. So I'm going to start with a few pictures coming from recent work that I and some other colleagues at the Congressional Budget Office have done. So the first one is just to highlight how much the federal government actually already spends in terms of tax expenditures. And more importantly, I think there was a number at the beginning of your presentation highlighting tax expenditures that go to retirement savings plans. So I just want to highlight that they're actually the second biggest category, only after tax expenditures for health insurance. So this is analysis from 2019. Overall tax expenditures, including both for defined benefit and defined contribution plans, are about $276 billion, or 1.2% of GDP. And CBO looks at these like separately. Think of those as income tax expenditure and payroll tax expenditures. Where do the payroll tax expenditures come? Well, employer contributions to DB plans and DC plans are not subject to payroll taxes, while employee contributions are. But again, so just looking, oops, I guess I can't go back. So just the colors here actually highlight, in terms of the dollars, how these are distributed across households in different parts of the income distribution. So you can already see from this graph that they are pretty heavily skewed towards higher income households. So actually just looking at the shares, what CBO has found is that income tax expenditures for retirement savings plans, 63% accrued to families in the top quintile of income. The payroll tax expenditure is somewhat more evenly distributed, but even then, almost half, or 45%, get accrued to families in the top income quintile. And just in terms of the share of households who benefit at all, so think of this like just incidence, among those in the lowest quintile, 19% of households see any benefit from these tax expenditures versus 77% of households in the top quintile. So overall, these two categories of wealth, like retirement wealth, are quite important for the overall wealth distribution in the country. So this is actually a report that we just released yesterday. Hot off the printing press, if we were still printing things, but now we're just posting them online. So just to give you, an idea, in 2022, for example, the combined wealth of held in defined benefit and defined contribution plans accounts for roughly 20% of total wealth in the economy, and similarly for Social Security. And both of these categories of wealth contribute to actually alleviating some of the wealth inequality that we would have seen in their absence. So for example, we know that, the Gini coefficient, if it were calculated just taking into account non-retirement wealth, would have been 0.88 in 2019, but it drops to 0.83 once we account for DB and DC assets. And in terms of Social Security, it actually has an even higher importance. For example, if we look at wealth inequality in terms of the shares of, held by different groups in the distribution, we know that in its absence, like the top 10%, hold something close to 69% of total wealth, but that share drops to 60%. So maybe, the statistic that I usually like to focus on is more like what happens at the bottom 50%. So not accounting for Social Security, that share of the population holds less than 3% of total wealth, which goes up to 6.4. So again, these are relatively small numbers, but just to show you the importance of Social Security in kind of alleviating some of that inequality. Even then, what we find is that after we have accounted for retirement plans and Social Security, we still see this gap in median family wealth, where white families have about 3 times as much wealth as a median Hispanic or Black family. I do want to highlight, though, that in general, both retirement savings, retirement assets, and Social Security are much more equally distributed across racial groups than any of the other categories of wealth. And especially for Black families, actually both retirement assets and Social Security, even under baseline, these policy simulations, account for a larger share of their total wealth than other components of wealth. And something that is not a focus of this paper, but I think might be something to be explored in the future, what we have also noted is that out of the 2 components of retirement savings, defined contribution plans are actually much more unevenly distributed across racial and ethnic groups than defined benefit plans. And I think some of that has to do with access, but also, as Taha pointed out, in DC plans, there's a lot of room for decision-making that is in the hands of the individual, like whether I want to participate, how much to contribute, how to invest the assets, and whether to make withdrawals. So just the characteristics of DC plans are kind of driving some of this inequality among the racial groups. So again, these graphs here are not controlling for income, which is actually the great aspect of this paper, that the authors actually are able to quantify these racial differences once we control for income and other characteristics. All right, so as you just heard, the main question was, how do retirement incentives, or to what extent they contribute to the retirement wealth gap that we see between racial and ethnic groups? And then more importantly, what the authors do is they design some policy simulations and calculate counterfactual outcomes to see whether these interventions would be able to reduce the wealth gap and to what degree. So the authors have this amazing data set where they managed to link 3 different sources of information. So federal tax returns are linked to the American Community Survey data, which is a large data set with very rich demographic information. And then more importantly, they use, I'm missing a 5 there, the Form 5500 data, which I can't even imagine how painstakingly difficult that work must have been and how many people it involved. But it's just truly impressive work, and I hope that there's a lot more work to come out of this project. And I think Taha was just too humble. He should have bragged more about this accomplishment. So what the paper also does is, it's now that they have this amazing data set, they're able to document using data with like less measurement error, they're able to document these differences in retirement contributions and withdrawals, both by race and by parental income. And last but not least, they built a pretty impressive microsimulation model, most of the details of which are in the appendix of the paper, in order to be able to examine distributional effects on a lifetime basis. So that is very important with retirement saving, because just looking at one point in time, just as a snapshot of contributions or withdrawals or tax expenditures at a given point in time is not enough, because there's that delayed component of retirement saving. So what are the main contributions? Well, the first one is just linking these data sets. Honestly, if the project just had stopped there, I would have said that's a pretty significant contribution to the literature. And I would say that probably the data set that they created is kind of like a dream data set to any researcher who works in the space of retirement saving. What I think is more unique about this is not only that you can get tax return data, which is, as we know, administrative data is less prone to measurement error in terms of like measuring contributions and also withdrawals, but then they're able to get the detailed characteristics on these DC plans from the 5,500 data. So in the past, researchers have been more these similar type of questions obviously have been researched in the literature, but typically researchers either miss the demographic aspect of the information, if they're working with plan level data that gives them detailed information on the characteristics, or the other way around. If they have rich demographic information, then typically that comes from survey data, and it has been shown that people don't always have a very good idea of what are the characteristics of the plans at the workplace. So having these linked allows us with a much more accurate measurement. And then what I also really liked about the research aspect is that they're also able to incorporate future Social Security benefits and discount that back and kind of get a measure for Social Security wealth. So that also gives us a much more comprehensive measure on the effects on total retirement wealth when we consider both DC and Social Security. So overall, as Taha pointed out, I guess I'm just going to highlight one aspect is, so they document that the current system channels more of the tax and employer resources towards people who are white versus those who are Black or Hispanic, and also those more towards those with higher income parents. The counterfactual policy reform that they simulate also shows that the retirement wealth gap can be closed by about a third. So I'm just going to pose a few questions and challenges and kind of food for thought for what else could be done either in this project or in future work. So it is great that the authors are able to control, as I said, for income most importantly, and then also other characteristics. I did have a few questions though. I was wondering, are there any other factors that we should be thinking about when we're estimating these racial differences in either contributions, well, mostly in contributions. My question is, I know that mostly the project and the data set is conditional on people who are already in plans, working for employers that sponsor DC plans, but still, are there reasons for us to worry that they might not have equal eligibility? The kind of what I'm thinking about is it possible that Black and Hispanic workers are more likely to be maybe in part-time jobs that don't have the same access? I don't know if that's something that can be explored in this data or maybe verified with other data sources. And then also in terms of the microsimulation model, and I like the counterfactual simulation, and the way I think of that is kind of like giving us an upper end like estimate in a way, like if we totally remove individual saving incentives, from DC plans, and instead we simulate this intervention where both tax expenditures and the employer match contributions are proportionately distributed across the income distribution, what would be the resulting wealth inequality? And of course, for that, as a first pass, you have to assume that there are no behavioral responses. But I would like to challenge you a little bit more, and even if not for this paper, like whether you want to explore that in the future. So you do point out correctly that the literature is not very settled on the effect of parameters in the DC plans of the sort of automatic enrollment on the employer match, to what degree they actually influence behavior and result in higher saving rates. So I would say that some of the challenge there has come from the fact that the literature has had to use imperfect data, which could have been either from plan level data, or as I said, survey data with self-response that might not have been accurate. I had a paper with a colleague of mine at the Congressional Budget Office where we used administrative data on the 401k plan, the TSP plan for federal workers. What we find there, and I would be interested to see if you can simulate a policy of that sort and what the findings would be. What we found is that both automatic enrollment and the employer match actually has a differential effect on individuals in different race and ethnic groups, conditional on income. So perhaps not surprisingly, we found that Black and Hispanic workers, in a way, respond more strongly to default. So they're more, so the increase in participation from automatic enrollment and in the increase in contribution rates would be stronger for them. And we find the opposite with the employer match. So in the absence of automatic enrollment, we find that Black and Hispanic workers actually respond with slightly lower participation and contribution rates relative to white workers. So I like the policy simulation, but I would say, can we use this model for something more and kind of see what the distributional impacts would be if we tweak other parameters of DC plans rather than the total tax expenditure or employer match. And then also, should we also think about whether Black and Hispanic workers are more or less likely to have DB plans either at the current employer or from previous jobs, and could that be affecting some of their behavioral responses to these incentives? And then last but not least, I just want to point out that this impressive data set and microsimulation model that you've built has enormous potential to be used for other policy reforms. So as we know, the Social Security system is facing a funding gap, and sooner or later, policymakers will have to address that with policy reforms. So it would be interesting to see how this model can be used for interplay between Social Security the potential other reform in DC and DB plans. And one thing that I'm conclude with here is automatic IRA plans. So the initiatives on at the federal level for bridging the coverage gap in pension coverage have not gotten much traction, but a lot of states have already started instituting their automatic IRA plans, mandating employers to provide access to DC plans for workers who don't have that at the job. So I think that this kind of a model can be used to measure interplays between these policies. So that's it. Thank you so much. Appreciate it.
Thank you, Taha and Nadia, for your stimulating presentations. We are going to go ahead and collect questions from the audience. And let me just remind you to make sure you introduce yourself before asking the question. So please raise your hands.
I'm Bacon. I'm at OIGI. I am interested in the way that people's shocks in this kind of framework are connected to each other. Like we did a survey for our basic income experiment in Minneapolis, and something like almost a fifth of low-income people reported like sharing income with other households. And so I was thinking about your counterfactual simulation and wondering if you had thoughts on the extent to which equalizing retirement savings and that kind of security would affect like how my community or my peers or my family are experiencing shocks that might have been triggering me to do these penalized withdrawals. And so if that were a relevant channel for thinking through where these things come from.
Thank you. So Diego from USC. So I found the data super interesting, but I work more with structural models. So first I have a very basic question. What is a microsimulation, I guess? Like what's endogenously reacting to the counterfactual? And then I'm trying to think more like the theory-wise. like, in which world do you, because I understand we want to have redistribution. There's a value that we don't like inequality, but why do you want to do redistribution through asset accumulation policies in the sense of like, I reward you for accumulating rather than just I tax wealth and I give money to people, right? So in which world I want to do that through asset accumulation rather than just redistribution, plain and simple.
So I thought it was excellent paper and excellent discussion as well. I'm Jonathan Heathcote of the Minneapolis Fed, and I like the policy experiment that you did. But I mean, the key assumption, as you highlighted, seemed to be that you can take out the incentive to save by removing the match component, just giving everybody the same contribution into their saving account. And the question is, how much is that going to reduce total savings? And you said that there maybe isn't much consensus on the literature there, but I was thinking that you can look at your data and you can see firms that offer more generous matches than other firms. Do workers in those firms have systematically higher total retirement savings? So maybe you can leverage the data you have and shed some new light on that.
Abby Wozniak here at the Institute. I just want to follow up some of the comments on the policy counterfactuals and lean into my soapbox issue, which is implementation. I think economists just have to think about what is the simplest change that could be implemented that could be useful, because it avoids all of the complications that come in the policy process when you try to do something more complicated. So I just kind of urge you to kind of go from that end of the spectrum versus the other end of the spectrum. Maybe just a couple of ideas would be, what would be the impact if individuals just forewent one withdrawal? So if we could incentivize waiting on one, that might be one very simple option. What if vesting was staggered? That might be something that's very simple to achieve. And there could be others. Perhaps these individuals should save less in the first place in these vehicles and not have to take the penalties. So just some ideas to try to think about the very, very easy changes that might be helpful here.
Hi, Gray Gordon, Richmond Fed. Could you comment on the contribution of direct contribution wealth to either total wealth or Social Security, like relative to Social Security wealth, over like education groups? It seems like it's very heterogeneous by demographics.
Hi, I'm Karen Kopecki at the Cleveland Fed, and I love this paper. Cormac knows that I've seen it before, and it keeps getting better. But one thing I think it's important to think about, or I wonder if you thought about this, is sort of what's driving the differences. I think it's really important for thinking about the policy implications, right? Because the welfare implications of policies, that's going to depend on really why we see these differences in saving in these DC accounts. And I know there's a literature in behavioral finance that really, that believes that this is kind of lack of forward-looking behavior that varies with, demographic characteristics of the population, things like their education levels and income levels, and they're really pushing things like automatic enrollment and automatic escalation, which is that your contributions also escalate automatically unless you do something about it. And whether that's good policy or not really depends on, is this really some type of myopathy, or is this something else like liquidity constraints driving this, when maybe we want to think then about very different types of policies?
Hi, I'm Alex Albright. I'm at the Institute. And I'll just follow up on Karen's comment. And I was curious if you have a capacity to link people to their parents to see what their parents' retirement savings behavior is. Because with a lot of this, we're conditioning on the parental income level. But I'm curious if conditional on similar parental income level between, let's say, Black and white parents, there's some gap in how they are contributing to retirement savings, and then that's getting passed down. So I think this could maybe get a little bit at the mechanisms and trying to sort that out more.
Hi, Anusha Nath from the Minneapolis Fed. So I had a question about, just a follow-up on what Nadia said about vesting, and because Black workers are more likely to have high turnovers and they move from firm to firm. And so if they have, sometimes these defined contributions depend on one, how generous, but also tenure of the worker. So if you have some, because you have data across firms, and I don't know how long the panel is, but that might be one aspect of behavior that's driving these differences.
All right, thank you so much. We have a lot of questions, so we'll have Taha address some of them.
Thank you. Thank you, and thank you, Nadia, for a really insightful discussion. So I'll try to answer a question in the reverse order, starting with a question about vesting. So we did look at a subsample of people who are fully vested, where vesting is not an issue, and we find almost identical results. So it doesn't seem that vesting is driving the results. There's this question about the parents' saving behavior. So we're an analysis where we control whether your parents have a 401k or have contributed to a 401k plan. That could be they know how the system works and could teach you about it. Conditional parental income that has no explanatory power. So it really seems to be the material resources of the parent rather than having some knowledge through having experience. This question about auto-enrollment, auto-escalation. So what we find is that auto-enrollment can increase, at least in our data, seems to increase participation, for instance, but doesn't really change the gaps. And this is also linked to the fact that most of the gaps we document, say by race, are mostly on the intensive margin, not on the extensive margin. So conditional income, there's almost no gap on participation. It's really how much you save, and it seems, at least on the evidence we have, that auto-enrollment, auto-escalation doesn't really narrow those gaps. We did run, I think it's buried in the appendix, the analysis by education groups, and you find the same thing. Conditional income, firm, all the characteristics, those with more education save more, get more of these benefits, and so you could run the same analysis there. The interpretation is a bit more complicated in thinking of how education interacts with Social Security and when you start to work. The question about implementation, I think that's a great question. How should we think about the implementation of these counterfactuals? One thing we've been thinking about is the government, at least on the employer matching part of it, almost half of plans use what's called a safe harbor plan. And the idea is if you take a specific matching formula, vesting schedule, you don't have to deal with non-discrimination testing. And right now, the government also encourages you to give these matches. You could think, well, the government could say, if you want to be a safe harbor plan, it has to be the same contribution for everyone. And that could be a way to implement it. We could do, right now we do non-discrimination testing just based on income. You could expand on non-discrimination testing to other characteristics, and this could help us get to the counterfactual we're thinking about. There were a few questions about behavioral responses. I think that's really, really important. So first, in terms of the interpretation, what we're doing kind of gives you almost a lower bound for the welfare effect. Because you say, well, you get the transfer, and then if you choose to reduce your saving because you get more of a transfer, if anything, utilitarian framework, you should be a little bit better off. So even, so in a sense, if what we care about is welfare, not only savings, but also the fact that people are going to receive more resources, I think that gets at that. Getting at the behavior responses is complicated. What we know from some of my other work, for instance, when it comes to matching, 60% of the employer match contribution go to people who are inframarginal. What does it mean? So if you have a cap at 6%, 60% of the matching goes to people who contribute 7, 8, 9, 10. For these people, if anything, the behavioral response should be that these incentives lead you to save less because of wealth effect, but it doesn't change your incentives on the margin. There's work by Chetty and co-author in Denmark. We find almost no behavioral response to tax incentives. The upper bound of their estimate is at 10% elasticity. And so I think we've done some counterfactual, but at least what we have in terms of evidence to date is that these are relatively small. The question about communities and how these counterfactual could change the way people can self-insure and help with shocks. And I think that's where the two parts of the paper link. If you think that part of parental resources matter for their children's ability to take advantage of these incentives, then getting more resources in the account of current children means that in a few years, when they reach retirement, they'll have more resources to either help their kids or not have to rely on their adult children, who then can take advantage of more of these incentives. And the other thing is that we want to think a little bit harder about the hardship conditions. Right now, What is encouraged by the tax system, where you're not penalized, are things like paying for education, buying your first home, but losing your job doesn't exempt you from these hardship conditions. Supporting a family member health emergency is not, doesn't get you off for the penalty. And so thinking seriously, carefully about these conditions so that these accounts can be both used for retirement saving, but also for insurance is useful. I mean, this question about micro-simulation, I think the key difference is that we can talk offline. Thank you.
All right, so we're going to take a break and resume at 1:45 p.m. Central Time. So we'll go off streaming for a little bit. And everybody who's here, we're going to have lunch up in the second floor dining room. So you can start right now, and our staff will help lead you up there. Thanks.
All right, so hello everyone. So I am Lufo Koulibaly from University of Wisconsin-Madison. So we are about to start the afternoon sessions, and the first talk is going to be by Jonathan Dingle from University of Chicago. He's going to present No, I kind of remember the title, Market Size and Trade in Medical Services. And the discussant is going to be, do I remember the discussant? Oh my God.
Jim.
And from American
Enterprise Institute.
Enterprise Institute. I'm very sorry for not bringing the schedule here. And yeah, you have 1 hour.
Great. Thank you very much for having me here. I grew up in Minnesota, so it's always nice to come back home. This is joint work with Josh, Mai, and Pauline. One way to understand what we're trying to do in this project is to jump into a very long-running health policy discussion, which is asking whether America's doctors and clinics are in the right or wrong places. And the way that this concern is usually raised is by drawing a contrast between the geographic distribution of the patients and the geographic distribution of the doctors. Okay? So what we know is that smaller towns, rural areas tend to have worse health outcomes, but the doctors and clinics are geographically concentrated in the more populous regions. There are 50% more physicians per capita in the biggest hospital referral regions compared to the smallest. Okay? And the sometimes implicit, sometimes explicit benchmark that people have in mind in this policy discussion is saying we should probably equalize physicians per capita across space. That's going to be our starting point. And what we're going to point out is if you want to evaluate that kind of suggestion, you're taking a stance on two key economic mechanisms. The first is whether there are local increasing returns. Okay, so think about your favorite source of economies of scale. They're all plausible in medical services. We have a finer division of labor, sharing of lumpy capital equipment, learning by doing. These are all reasons why putting more doctors and hospitals in the same location would raise quality, reduce costs. If there are local increasing returns to scale that generate all those benefits, how broadly those benefits are shared depends on the second economic mechanism, which is trade costs. How costly is it for the small town patient to travel to see the big city doctor? Okay? Now, this is a case where society faces a proximity concentration trade-off, the race between the benefits of being close to the patients versus the benefits of concentrating production. Unlike when we're talking about proximity concentration trade-off for manufactured goods, here the patient is the one that has to travel to see the doctor. And so you might also have interesting, heterogeneity in willingness to travel, or those trade costs might be specific to what consumer we're talking about. So there's both efficiency and distributional considerations on the table. And so the purpose of the paper is to say, let's go estimate these two key economic mechanisms. How big are the local increasing returns and how big are the trade costs for the sector of the US economy? That's 1/5 of GDP. The way that we're going to do this is by studying claims data from Medicare. Okay? So Medicare is the US government program that provides health care for people that are over 65 and the disabled. And basically we're going to take advantage of the fact that the physicians and the clinics and the hospitals send the bills to the government. And so we get a lot of information there. But this is a distinctive setting because the government sets the price. It's basically a fixed price environment because the Medicare fee-for-service reimbursement rates are these regulated provider payments that are named by the government. So I'm going to write down a model in which I have my two basic ingredients, trade costs and scale economies, in a fixed price environment, and show how the familiar logic goes through in which size can be an advantage. Okay? So this is what trade economists call a home market effect, where having more local demand, well, in a constant returns to scale world just means I need more of this, so we import some more. But in a world of increasing returns, more local demand can call forth a supply response that not only meets that local demand, but also causes you to export services to patients that live in other regions. And so to take that to the data, I'm going to write down the simplest model I can think of,
which is logit demand, which will give me a gravity equation describing the number of patients from each region that are going to travel to see providers in every other region. So a model that describes those flows of patients to providers region to region, which will allow me to estimate a notion of the quality of service that's produced in each region. If you as a patient are willing to go an extra 100 miles to see a doctor, I'm going to infer that that's a higher quality doctor. Okay, so that revealed preference measure will give me a notion of quality of service. And then I can take that quality of service and relate it to the volume of patients that that region is treating. So I'm going to estimate the scale elasticity of the production function. That's going to tell me how big are increasing returns at the regional level in the production of medical services. Okay, we're going to find that domestic trade in medical services mimics trade in manufacturers. And I say mimics trade in manufactured goods because the economic logic is completely familiar, but here the magnitudes are going to be different than when we're talking about stuff that comes in container boxes or Amazon boxes, okay? So we're going to find that 1/5 of production is exported, by which I mean on a dollar-weighted basis, 1 out of 5 times the doctor is treating a patient who came from a different hospital referral region. If you say healthcare is a non-traded service, then 20% seems like a really big number. If you're thinking about manufactured goods, 68% of those leave the location of production, the metro area where they're made. So this is less traded than manufactured goods, but way more traded than the claim that like all healthcare is local. Okay? What we're going to claim is that market size effects are the reason that large regions are net exporters of medical services. So big cities make a lot more medical services than are consumed locally because they're exporting them to the patients that are coming from the small towns. And we're going to show that consistent with the predictions of the model, those consequences of market size have the biggest kick when we're looking at rare medical procedures as opposed to the common medical procedures. And we think the reason that we're finding these market size effects is there's various ways that we can document the sources of local increasing returns. So we're going to show that geographic concentration leads to a rise in service quality, and one of the things that we can measure in the data is which doctors are performing which activities. So we'll show you that there's a lot finer division of labor when we're looking at larger markets. Okay? There's an opportunity for specialization brought about by size. And so we're going to estimate that the scale elasticity in the production function alpha is about 0.8, which means if your volume of patients treated is 10% higher because you've got higher demand, quality is going to go up about 8%. Okay, so that seems like large increasing returns in terms of the benefits of seeing more patients to produce a higher quality service. We're going to take that relatively simple model and use it to describe counterfactuals that help us illustrate the sort of trade-offs that we face. And sort of, we want to try to expand the scope of what policymakers might be thinking about in terms of what are the trade-offs and how you might confront them. So as soon as I tell you that there's a bunch of region-to-region trade, then you've learned that changes in the quality of output produced in a place are not the same thing as changes in the quality of service to which patients who live in that region have access to. Okay? And so now we can think more creatively about ways that you might address these access concerns. Like, for example, instead of subsidizing production in rural locations, you might think about subsidizing travel. Make it easier for the rural patient to travel to see the big city doctor. And we'll explore how these different scenarios about production subsidies versus travel subsidies have different spillovers on the neighboring regions. Okay? And I won't have much time, but if you look at the paper, you'll find some other things that we think are interesting, like low socioeconomic status patients show less willingness to travel longer distances to get higher quality care. Okay? So there's some inequality concerns here that are related to willingness to travel. We hope that other people will investigate, well, is it information or referral behavior or literally the fiscal expenditures of you got to pay to stay overnight in the hotel next to the hospital while your spouse gets the treatment, et cetera. There's a whole lot that could be explored there. But one thing that we find is that the geographic expanse of the United States is one of the reasons why it has a stronger relationship between regional mortality and regional income levels. If we just shrank the US to look like Germany, you would find less regional inequality in health outcomes. Okay, so I'm going to start talking faster, and I'm going to start with the empirical setting. So we're looking at claims data from traditional Medicare. We're going to look at 2013 to 2017. Medicare covers people over 65 and the disabled, and basically all doctors and clinics and hospitals take Medicare. So think about this as a very broad choice set. And we're going to be using the fact that these are bills that are sent directly to the government, which means we get an incredible amount of detail. There are 12,000 different procedure codes. So usually when you try to study production and trade in services, it's a really amorphous or badly described concept. Here, because it's a bill, they're telling you exactly what the medical procedures are, so we get a lot of detail. we're going to look at everything that's done by a doctor that's not in the emergency department. So we're thinking about trade and people shopping around. If you're unconscious in the back of the ambulance, you probably aren't modeled by our discrete choice framework very well. Okay, geography. The claim gives you the zip code of the patient and the zip code of the place of service. We're going to aggregate that up for the health people in the room. We're going to use your standard, hospital referral region. I'm an urban economist. My default would have been a metropolitan statistical area. Luckily, the data has been very kind in the sense that our results are not sensitive to the choice of which geographic unit you use. So we're going to study the 306 hospital referral regions in the United States. Okay, 2 facts I want you to know. The first is going to be about the pattern of production and consumption across space. Okay? This is going to be relating it to market size. So the population of the hospital referral region on the horizontal axis goes from like 120,000 residents to 10 million people. You know there are more physicians per capita from the prior literature. Here we're plotting output per capita. Okay, so this is dollars of production in traditional Medicare per eligible beneficiary in the region. And you can see that there's this positive relationship. The big places are making more medical services per capita. What's happening to consumption? Well, the red dashed line is basically flat. You have about $6,000 of consumption per beneficiary in the region that isn't really related to market size. So market size predicts the location of production. It's not really predicting your amount of consumption. And the fact that those 2 lines are different immediately tells you that there's trade between regions, right? Production minus consumption is net exports. It tells you the big cities make more than they consume, and it's the small regions' patients that are taking up that big city care. If you look at the import and export lines at the bottom of the graph, the gap between those is the same thing, right? Net exports. But what I want you to notice is that the imports line for the smallest regions is like $2,000 per patient, and their total consumption is about $6,000. So that's telling you 1/3 of consumption in the smallest regions is them going to see a doctor or a hospital that's in a different region. Okay, so there's a lot of trade happening here. The second fact that's going to be key to some of the modeling choices we make is that trade declines with distance in a very conventional way that is consistent with a gravity equation that trade economists would use. So on the left, I'm just showing the average distance they go. The blue line is the 80% of consumption that's in the same region. The red dashed line is the 20% of trade between regions. If you're going to a doctor in the same region, you're going like 10 kilometers. If you're going between regions, the modal trip is something like 40 or 50 kilometers. But there are patients that are traveling hundreds or thousands of kilometers in order to go get medical services. And if you take the residuals out for origin fixed effects and destination fixed effects, you get a roughly linear relationship between the amount of trade between a pair of regions and the distance between the 2 of them, which we'll leverage when we estimate our model. Okay, so the 2 basic facts are large markets are net exporters, and it looks like traveling for care is costly because it declines with distance. And so we're going to ask a set of positive questions and a set of normative questions. The positive questions are the large markets net exporters because they have higher demand? Are there these increasing returns to scale in medicine? And are they big enough that they're generating the pattern where the big markets produce a ton and treat patients coming from other regions? We're going to answer yes to both of those questions, and then turn to what might be normative or at least counterfactual exercises, which is how could we think more creatively about policy in a world that has trade costs and increasing returns to scale? So what's the marginal return to subsidizing production in each region, and what happens if you subsidize travel instead of production? And I'll probably run out of time, but one of the provocative findings of the paper is that we find that the marginal return to a production subsidy is highest in the big regions, not the small regions, which means production is actually under-concentrated, not over-concentrated, contrary to conventional wisdom. Okay. I'm going to write down the simplest possible model I can do to study this problem. So I'm going to write down a partial equilibrium competitive model of a market for a single medical procedure where the government is fixing the price. I'm going to index regions by I and J. The number of potential patients in region J is going to be NJ. Look, they don't pay prices, so it's going to be pretty simple. Demand is higher at your clinic if you offer a higher quality service or if you're closer to the patient. Okay? So quality is going to be this delta I, the quality of service produced in region I. The proximity, rho ij, depends on the location of production and where the patient is coming from, and there's some idiosyncratic component we'll call epsilon. Supply is also going to be very simple. It's going to be a competitive model, and we're going to assume that these providers hire inputs to produce a service quality delta, and crucially, they're going to take this exogenous productivity AI is given, and they're going to take regional output QI is given. Okay, so this is a model of external economies of scale, in which the total size of the industry affects my own productivity. This is the output quantity that I produce. And then we're going to say it's a competitive model with zero profits. The government has announced the output price, what you get paid for the medical procedure, and that needs to be equal by free entry to the unit cost. Okay, so the reimbursement rate, R bar, is equal to the unit cost, where the unit cost is increasing in the wage, or the price of the factor input, decreasing in the exogenous productivity bit, increasing in quality, so it's going to be more expensive to produce higher quality services, and then crucially, it's going to be decreasing in the total output in the region, QI, if there are increasing returns to scale. So alpha is the scale elasticity that governs how much you get higher productivity for an individual provider as a function of total size of production in the region. So that alpha is the scale elasticity that we're going to try to estimate. Okay, so I've got an ISO cost curve, and I've got a demand curve. I can give it to you in a simple two-dimensional diagram that looks like familiar supply and demand, except everything is upside down, okay? On the horizontal axis, you have quantity in the usual way, but remember, prices are fixed, so my vertical axis is quality, and so everything looks upside down because if you have a higher quality of service, you get more patients showing up at your clinic door, so demand slopes upward in this diagram. In a constant returns to scale world, the ISO cost curve is flat. There is one level of quality delta that's consistent with breaking even as the producer. In a world with increasing returns to scale, if alpha is strictly positive, then this ISO cost curve is upward sloping, right? If you produce more and serve more patients, your costs are lower, then you can provide a higher quality of service and still break even. And so you have this upward sloping supply ISO cost curve. So what happens if I compare a small region and a big region? Well, a big region, we're going to say, differs in only one respect. It has a larger population, so more patients show up at your door. In a constant returns to scale world, you move from A to B, nothing interesting happens. Higher demand, you serve them at quality delta. But in a world of increasing returns, more people showing up means that you're doing a larger volume of production, you get a higher quality of service, and so you move from A to C, okay? So in a world with increasing returns, patients are happy when other patients are more likely to have the same condition as them because it means that this is going to be, treated better, okay? So that's the benefit of scale and autarky. In a world with trade, you say that I need a description of the number of people that live in J that are going to see a provider in I. We're going to assume that epsilon term follows a Gumbel distribution, which means that you get a familiar logit shares expression that says the fraction of people that show up that demand services from region I is increasing in I's quality delta I. If you're more proximate, closer, if I, J are closer, you get more demand relative to every other element in their choice set. So this capital phi J, we're going to call patient market access. It summarizes the value of access in terms of the distance discounted quality of service that you could be receiving from every region. And this is handy because it means that trade follows a gravity equation where the flow of patients who live in J that see a doctor in I has three terms. An exporter fixed effect, which is the quality of service in region I. Destination fixed effect that depends on the number of people that live there relative to the value of their choice set, and the distance between the two places. So what happens with larger size? Well, if there's no increasing returns, larger population just has one effect, which is there's more people here, so it raises demand. It raises demand from every origin, so you import more. In a world of increasing returns, higher demand raises the quality you produce, which means you export more, right? Higher demand means delta goes up, and so you see more patients from every destination. And what we show in the paper is this effect is larger for rare services. Okay? So the consequences of market size are bigger when we're talking about things that are being done at low volume, right? Scale has a bigger kick there. Okay, so first set of empirical results, we're going to try to estimate the scale elasticity. I'm going to take that gravity equation, take the exporter fixed effect, that's going to be my measure of service quality in region I, and then put it on the left-hand side and rearrange my isocost curve, because in our model, we say that you get a higher quality of service for one of three reasons. Either you're seeing more patients and there are scale effects, right? And then alpha governs how size benefits your quality. Or you've got lower input costs, that would raise your quality in the free entry equilibrium. Or you've got exogenous productivity advantages, right? Those are the three possible sources. So we're going to go recover these qualities. I'm going to tell you that the qualities we think are credible in the sense of it's this revealed preference measure of it's a better region if people are traveling farther to get there. And it correlates with more objective health outcome measures like survival rates for heart treatments, for example, for cardiac arrest and stuff like that. Okay. The reason I feel okay with my simple model where I just said we need one parameter alpha is because of this relationship between quality and quantity. It basically looks like an isoelastic function. My two outliers are Honolulu and Anchorage, where clearly number of kilometers you got to go is a little bit different, and so the functional form doesn't fit it amazingly well for those two outliers. Okay, we estimate alpha. We get numbers like 0.8. You can do this in the cross-section. You can do this in first differences. You can use an instrument like population in 1940 in order to predict where there's going to be more demand. Medicine was practiced very differently 80 years ago. So this is going to be something that we hope is shifting demand and not shifting the supply curve. All of those give us numbers like between 0.7 and 0.9. So we're going to say that alpha is equal to 0.8. Okay, does the fact that there are big increasing returns to scale explain why these big regions are net exporters of medical services? We're going to say yes. The way we get to that answer is by running a gravity regression where we have a proxy for demand in the origin, the doctor's location, that's population I, and a proxy for demand in the patient's location, which is population J. Here we're following some work by Costello, Donaldson, Kyle, and Williams. And the logic is that if you get a bigger kick from size on your exports, if lambda x is positive and it's bigger than lambda m, it says that the consequence of greater demand from a larger population here, yes, it raises your imports, but it raises your exports by even more, and that would allow us to explain the fact that in the basic descriptives I showed you, the big regions are net exporters. You can do that in the cross-section. You can do that in first differences. And I've sped up a little bit, but trust me that the blue numbers, which are in the neighborhood of 0.6, 0.7, are bigger than the red numbers like 0.3, which means it has a larger effect on exports. So demand or population size is explaining that you get net exports from the big regions. Okay. Why do we find these big market size effects? Well, let me now use the fact that we have a lot of detail about what procedures are being done to put some color on this. Our model predicts that it should be the rare stuff that responds more. Bigger markets are producing just a much wider variety of medical services. So here we take 7 categories. They're all sloping up and, as we move from left to right. The left is production and the right is consumption. So the set of distinct services consumed is linked to market size, but not as strongly as production is on the left. We run that same regression, but now for 10 different deciles of procedure frequency. So the most common medical procedures are on the right. The rare stuff is on the left, and the gap between the blue and the red coefficients is getting bigger as you go look at the rare stuff. So population size has the biggest kick on your net exports when we're looking at rare medical procedures on the left side of the graph. You can estimate that production scale elasticity separately for rare procedures. When we do that, we get slightly bigger numbers, something like closer to 1 as opposed to 0.8. And so it looks like there are stronger economies of scale. That is, market size matters more for reduction when we're looking at rare medical procedures. Okay? All right, why do we have increasing returns? Well, there's some stuff that we can measure very well, like which doctors are doing which procedure. That comes in the billing data. There's other things where we have to make a few more assumptions to figure out like what capital equipment are they using to perform this medical procedure. But the brief summary I'm going to give you is it looks like the rare specialists of doctors are found in the big markets and the rare capital equipment. Okay, so division of labor and sharing of lumpy capital equipment look like 2 of the mechanisms. So here I've got 209 different job titles for physicians, right? The 2 most common are internal medicine and family medicine, and there's stuff that is extremely rare on the left side of the graph. And what I'm plotting on the vertical axis is the population elasticity of the number of MDs per capita in that specialization. So if you wanted to think about physicians per capita, look, if I combine internal medicine and family medicine, the 2 types of like primary care physicians, that population elasticity is basically 0. The number of PCPs per capita is basically evenly spread across space. What is uneven geographically distributed is the specialists, right? You got a transplant hepatologist. There's like 34 people in the country with that job title. Where do you find those rare specialists? They are in the big markets, right? All of these population elasticities are way above 0. So those are who geographically concentrated. It's the specialists. And similarly, we take a bunch of types of capital equipment, and there's some stuff that's very common and some equipment that's very rare, and the rare stuff seems to be geographically concentrated in the bigger markets. Okay. So what are people doing? Well, one thing that travel to the big regions is letting them do is access specialized services. Okay? So I'm going to tell you 5 facts, and you're going to trust me or go look at the PDF. The traded procedures are specialist intensive, and that's especially true when you're looking at smaller markets imports. Smaller markets locally produced care is sometimes, using the wrong person to perform it. So if you're a small town doctor, you're a jack of all trades. You're performing lots of different procedures. In the big cities, you're more likely to have the right specialist performing a given medical procedure. Okay? Larger regions in imported care tend to have more experienced physicians. So you don't want to see a doctor who's like, oh yeah, I remember that from med school like 4 years ago. You want somebody that did it a bunch last year. We measure that and show that if you're traveling to see a doctor, you're traveling to see somebody more experienced and to use rarer equipment. Okay, so you believed me about those 5 facts. So I get to do counterfactual scenarios. So how do we do health policy with trade and increasing returns? The paper is 3 different scenarios. I won't have time to talk about shrinking in the US to make it like Germany, but let's just focus on, should I subsidize output or should I subsidize travel? Okay? So here we are in Minnesota, so let's talk about what would happen if we raised the reimbursement rate and we did it just for Rochester, Minnesota. Fun fact, by the way, the Rochester metropolitan area exports about 2/3 of its output, okay? So it's an extreme outlier. You probably can guess why. It's, you know, the Mayo Clinic is presumably playing a large role there. So, you know, they have a lot of production, and it's not from, you know, the folks in Rochester. They're a big exporter. And so what happens if you raise the reimbursement? Rochester expands output. The neighboring regions contract output because patients are now going to Rochester. And so you have quality going up substantially in Rochester and down in the surrounding regions. Now, you might think that's bad for the surrounding regions. Not necessarily true, because remember, the value of the patient's choice set, they're traveling to Rochester for a reason. So the value of patient market access in the surrounding regions goes up. So it's bad for locally produced quality, but it's good for access of patients to quality services. Okay? You get a similar picture in Boston, but I'll skip it. Take Paducah, Kentucky. Okay? Now this place is a net importer. Same quality spillovers if you subsidize production in Paducah, but the folks in the neighboring regions aren't very likely to go to Paducah for care, so they don't value that quality improvement. But they've lost the Paducans that were coming to get care in their region, so their output has shrunk, so their quality's lower, and so the value of their choice set's gone down. So the pattern of regional spillovers depends on whether you're a net importer or net exporter. If you amp up production in a net exporter like Rochester or Boston, it benefits the surrounding communities. But if you're amping up production in a net importer, then it's going to have negative spillovers on patient market access. We don't have to subsidize production. We could instead subsidize travel. And in the travel subsidy scenario, if you make it easier for Paducans to leave Paducah, then they're going to raise demand in the surrounding communities. That causes them to scale up, so they produce higher quality services. And so the neighboring regions are happy that the Paducans are being, you know, subsidized to travel to these neighboring locations because the value of their own patient market access is improving. Okay, so the pattern of spillovers is governed by the baseline pattern of trade and whether we're talking about subsidizing production or subsidizing travel by the patients. Okay? So our hope is that we can sort of expand the scope of the policy discussion by saying, look, this is not a local service. This is a traded service. We've documented that, measured it, and we can think more creatively about what potential solutions or potential policy instruments might be available in terms of changing the pattern of access across this varied geography. So domestic trade looks like trade in manufacturers, just with different parameters. We find big increasing returns. We think they explain why the big markets are net exporters. And you can think about a much richer set of menu of policy options now that we've put trade on the table. Thank you very much.
Well, good afternoon, everyone. Thank you for inviting me. I'm Jim Capretta with the American Enterprise Institute. Thanks for having me at this conference. I was not aware of the Institute prior to receiving the invitation, and once I became aware of it and its mission and its orientation, I'm very pleased that it exists, number one, and it's got this mission and it has this annual conference, and very pleased to have been invited to take part in my small way and participating in your conversation. So thank you for having me. I was really pleased to be given this paper as someone something to discuss because it's interesting on a lot of levels, as you just, I'm sure, are realizing also, that it's runs contrary to a lot of preconceived notions that go on in healthcare. I go to a lot of healthcare conferences, or have over the years, and one of the truisms that gets repeated often, I may have said it myself, is that healthcare is local, which to a degree we all kind of understand that. This, of course, challenges that particular notion, which I think is very useful on a lot of levels, as I'll discuss. The second notion that it challenges is that patients exercise very little agency in the selection of service location or provider or context within which they receive services. To a degree, there's a sense in our healthcare analysis that the patients are entering into it and then get directed around by forces that maybe are outside their own control. This challenges that to a degree. It doesn't give us a set of reasons why some patients are making the choices they're making. We can surmise from some of the data and analysis that's in the paper. But it challenges the notion that there's no degree of choice going on here, that on some level there is. Now, maybe the person is being directed this way by a primary care doctor or some other factors, but the truth is they are traveling to go get services. Another very important dimension of this is that the data set that Jonathan and his co-authors look at is pulled from Medicare fee-for-service. And Medicare fee-for-service, of course, is our largest insurance system by total number of people in one type of plan, also the dollars involved. It produces a data set that allows for a lot of rich research. But the truth is that traditional Medicare, as it's currently designed and operates, is somewhat unique in American healthcare at this point. It's a national program. If you are enrolled in traditional Medicare, you're allowed to go see any doctor in the country you want, as long as they accept Medicare. And if you're in traditional Medicare, it's probably a 95% probability that you've got an additional insurance option that pays the cost sharing down to zero. So, as Jonathan said, it's a fixed price system. Moreover, for people in traditional Medicare, there's zero price irrespective of anything, even if it wasn't a fixed price from the government, because they're mostly in a situation where they're paying zero cost sharing at the point of service through Medigap supplementing on top of traditional Medicare. So you've taken price entirely out of the equation in this context, which as you can read in the newspapers, you know that that's not true for a lot of people. A lot of people are very sensitive to the price of health care. And so in the context of the commercial insurance market, or even Medicare Advantage, which is now more than half of Medicare, the context within which importing and exporting is taking place isn't necessarily present. If you are a patient who is in an commercial insurance plan with a network, and you're unclear if that specialist that's 150 miles away and you heard is pretty good is in your network or not, and it takes you 2 weeks of research to try to figure it out, the hesitancy, the cost factors, other things may impair your ability to do the kind of transactions that are studied in this paper. So that gives you a little bit of the context, I think, policy-wise, within which this paper provides its research. Don't get me wrong, I think it's incredibly useful in the setting it's applied. And it has implications for other things, which we'll get into. Now, another aspect of this is Jonathan mentioned several times in his remarks, is that it reinforces something that has been studied extensively in healthcare, which is that low volume, complex procedures, it's not a great idea to go to the person who does a heart procedure once every 2 years, okay? So high volume, routinization, the economies of scale associated with locating it in one place and doing a lot of them is highly beneficial in healthcare. It's been studied in a lot of different ways, quality being a dimension of it, cost being a dimension of it. So this reinforces that and then brings it forward in a way that says, well, maybe we ought to be leveraging that in a more significant way in the policy conversation. Okay, now, maybe you're probably picking up, I'm not a researcher. Actually, I'm a little bit out of my element in this audience. I work in the policy realm. I don't do any of this kind of research myself. So, I'm discussing a paper that I could never in my lifetime write. However, I do work in the policy realm, and I think about these kinds of products and, how does it react? How would one react if one were trying to design different policies to improve American healthcare, which is obviously a major challenge. Jonathan mentioned travel subsidies. Here are a few things that come to mind as I think about the implications of this finding that exporting and importing is a big factor in healthcare, or potentially could be a big factor in healthcare. Let's put it this way. It's a big factor in Medicare fee-for-service, as I tried to say. It could be maybe a bigger factor in some other elements of the insurance market. And how would that occur? Well, first thing is to think about Medicare Advantage itself. So Medicare Advantage, as I said, is more than half of the Medicare program now. It's the commercial insurance arm of Medicare. When you take Medicare Advantage, you're signing up with a commercial insurance plan, and they're providing the Medicare entitlement to you. They have quite a bit of discretion about how they organize it, but there are federal rules on qualification. One of them being you got to have a network, and it's got to be within some proximity of the patient. And you're sold locally. You're not sold nationally. So, by definition, there could be more restrictions on out-of-location travel to get services because it might actually push you out of the network that was approved by the government, and that might mean you have to pay more costs if it's out of network. So Medicare Advantage comes with some rules that might restrict this. However, one might think in the policy response could be, why don't we test and maybe think about allowing Medicare Advantage to be sold locally with out-of-network travel being the norm for certain highly specialized services within reason, and of course that those costs would be covered by the plan, which is not normally a part of the coverage for these products. So instead of having a service provided at, in a city of 100,000, maybe it's provided in the major metropolitan area that's 2 hours away, and it comes with travel costs covered, and hotel stays maybe for the patient and a family member, et cetera. So there's ways to be creative about this to allow Medicare Advantage potentially to leverage this finding that there's some potential here for certain regions of the country to be exporters and others to be importers, and it would be win-win in a trading environment, okay? So that could be done more in Medicare Advantage through an alternative design, potentially. Another thing to look at would be allowing providers to pay for travel, not only in the Medicare context, but in the non-Medicare context. There's a lot of regulations around what providers can do for patients, especially in the Medicare. There's inducement kind of restrictions. They don't want people to be sort of paid to use services so that they could drive up government costs in Medicare. However, this might be something where if a specialized location is capable of doing something and wants to export that services more broadly around the country, why not allow them to experiment with exporting that to low access areas through travel subsidies that they pay for themselves? So their economies of scale finance it. And if it turns out that that's financeable within the reimbursement rate system that's established for that procedure, potentially it's a win-win for everybody involved. A third area is more on the negative side, which is, do we need all these rural hospital subsidies? Maybe we should be rethinking some of our ideas around geographic dispersion. That is, instead of trying to have a community hospital accessible within a drive time of an hour or so of everybody, maybe we have to scale that back and use the money you save to allow the necessary in the locations that it needs dispersion, and then travel and payment through some kind of subsidy system for the things that can be specialized in metropolitan areas. That doesn't sell well politically, I will say that, but it's a potential. They've been trying to solve the rural healthcare challenge. I've been working in healthcare policy a long time. you can rewind the tape to the 1980s and some of the same conversations that occur today about, oh, we're closing hospitals and access is terrible, and it's a repetitive conversation. It's not an easy thing to solve. They've been subsidizing production in lower density areas for a long time. It has not solved the problem. So how to think about that problem and that particular challenge somewhat differently might be useful at this point. Okay, now, to pivot to just a little bit, one of my focus areas is on the high burden that today's system imposes on families trying to afford health care. I think that, is, of course, fits very well within the sort of general dynamics of what this research institute is trying to get at. And, of course, pricing is central to that. That is that there are many, many aspects of American healthcare with lots of dysfunction associated with it. And the question is, what could be done to bring a little more discipline to the pricing system? Now, this is a group of economists, so you know there's sort of a binary choice here, right? You can just have the government regulate the prices, as they do in most other high-income countries. That is an option, and it comes with certain trade-offs that another long conference can explore. But let's assume that that's difficult to get done for any number of different reasons. What are the options to improve pricing discipline through some kind of more market-oriented system? And in that context, it seems to me this paper brings out two. I already mentioned that the patient agency may be a bigger factor in our system if it's allowed to operate. And I think if you look at the history of many of these concepts, one of the big impediments to more patient agency is complexity and uncertainty. That is, this paper looks at a situation where all of the complexity is taken out and the only variable is the practice where I'm going to go to higher quality than the one I would go to locally. And that removes a lot of the considerations out. Now, that's great because it's a regulated pricing system. But what about when there's more pricing variability? Is there any way to leverage patient agency in this kind of export-import model where they take advantage of similar quality but much lower price? Now, that's a different kind of deal. And I think there, again, it would have to be some kind of context where the complexity of the choice is really boiled down through standardization. That would require regulation. But if you had very similar medical procedures where it was defined and there were no possibility of outside bills coming 2 or 3 or 4 months later from some provider you didn't even know was involved in the intervention, if it was standardized and then it was priced and everybody knew what the price was in advance, these are common procedures, okay, not things that are uncommon. Could you allow more exporting and importing where the patient would take advantage of the savings? That, I think, is a potential area of a lot of savings, frankly, because specialization in high-volume surgical procedures benefits from many of the same considerations that went into this paper around economies of scale. You could probably do a lot of savings price-wise by concentrating some of these high-volume procedures in the best practices with lower prices. The question is, can you get the patients to choose that? And some kind of situation where they benefit from the savings seems to me to be a very important part of that conversation. I'm going to make one more point in the 10 seconds that I'm over time, which is that this is a group of economists, so I really want to stress this amongst you here, which is that this is very important conversation for another element, which is that to solve our difficulties in healthcare, the key really is productivity. That is, we're going to need the people that are delivering the services to do more with less. That is, it's such a simple thing. But if you just say to everyone, we're going to pay you less, and therefore that will solve our cost problem, of course, its potential response from the production side is potentially more efficiency, same quality, just lower costs.
Potentially, but not always. It could be that they substitute lower quality and lower access, lower supply, for lower price also. And so the question really is, what is going to drive productivity? This paper points to productivity is potentially there and untapped in a larger way. And I think that's one of the main reasons why I very much liked it. So thank you very much.
Thank you, James, for this great discussion, and thank you, Jonathan, for this amazing presentation. So now we are going to open the floor to the audience. I'm going to gather some questions, and please introduce yourself before asking the question.
Okay, Greg Gordon, Richmond Fed. So it was very interesting. Have you tried comparing the estimated sort of travel costs that arise from the model with what plausible travel costs might be in real life? Because the wedge there might give something like informational effect or some sort of psychic cost of trade.
Neel Mehrotra from the Minneapolis Fed. Two questions. The first is, if I understand your model correctly, wouldn't it imply that the aging of the population is somehow beneficial in that we all generate more healthcare utilization and healthcare becomes higher quality and cheaper and beneficial in welfare terms? That would seem kind of strange. The second question is, what implications does your model have for healthcare mergers and sort of antitrust in this area?
Thanks. I'm Kyle Greenberg from West Point. I was just going to ask, are you able to distinguish between a story of increasing returns from a story where higher quality providers simply prefer to live in more populous regions?
Yeah, so David Wixer from the Atlanta Fed. I guess I'm going to be next, so you'll find out who I am. So one of the really cool pictures was kind of the imports and exports as a function of population size. And I was struck by, at the very top of the population size distribution, you still had large gross flows. There were still some imports. And I guess the model went by a bit too fast for me to see how that kind of fits in with it and what you think of it.
Hi, Diego, again from USC. So I'm a bit biased because my dad is one of those exporters back in Argentina. So we've talked about this thing. So I had, first, you mentioned that you have data for particular experience. So my thought is, like, can you distinguish the relative role of being in a big population in which basically the benefit of going there to see a doctor is that you can get referrals, because that's one benefit. And then the other is like you get the experience part of, like, the guy sees a lot of patients. You mentioned you have data on that, so I was wondering what's the relative share. And then the second thought I had is, like, at least that's the case of my dad. So he works at the public hospital, which in Argentina pays basically nothing. But he does that to get experience, and you get to learn a lot, and you get experience to rare cases, but then you can charge more in the private sector. Okay, and that's kind of like what could be happening here. Medicare pays you nothing, but then you can charge more outside. So sometimes there is a reward to quality.
Hi. So first, I was also wondering to what extent doctor preferences for big cities would look a lot like increasing return to scale. But I was also wondering whether there's something special about this population of Medicare. These are mostly retirees. It may be easier for them to travel. They don't need a medical leave to take time off. And so do you think they have lower travel costs? These may also be people who were living in dense cities, had relationship with doctors and hospitals, moved after retirement, and so travel back to where they used to get their care. I have a, go ahead.
Okay, thank you. Ping Hui from Boston Fed. I have a question about the IJ travel cost or the trade cost. I know you presented that the population or the patient size or the provider size, that parameter is different between rare and common diseases. Do you see the travel cost also shows systematic differences between different kind of diseases?
I have a question here, Abdul. So my question is related to Taha, but more on the demand side. Could it be driven also by hospitalizations, and that people who get hospitalized maybe want to be in a big city, as it's like a long stay? I'm curious about that, since part of that Medicare is hospitalization.
One last question.
So Amanda Michaud from Minneapolis Fed. Early in your presentation, you made a comment about mortality differences across locations and how these different travel costs or access to medical care feeds into that. I think it'd be really nice if you can frame your policy exercises in terms of these really like human costs instead of just dollars and so forth.
Okay, go ahead. Yeah.
Thanks, it'll be fast. I'm Karen Kopecky at the Cleveland Fed. I just think that, I don't know if you've thought about the fact that, there could be important negative impacts on the inequality in health outcomes from concentrating healthcare more in big cities, because the people who are potentially need it the most are the ones that are not going to travel to get it, right? Like if I'm very poor health, it's harder to travel, or as you mentioned, low SES households are less likely to travel, and so it could lead to increase in health inequality and mortality, life expectancy inequality.
Thank you for the questions. Jonathan?
Thank you very much for the very large volume of questions, so I will be happy to talk to you during the break. There's no way I'm going to get to all these. Thanks to Jim for the excellent discussion. It was very helpful in terms of contextualizing what we're talking about. I think it's a great point that the traditional Medicare is distinctive in being a choice set. It's national, all the providers are in it basically, and the price is fixed. I guess I would hope that it would let us think about counterfactual choice sets. Like your suggestion about how the Medicare Advantage eligibility rules is a great example of how learning that in a market where it's a national market and people can travel, we see lots of trade in medical services, should hopefully spur us to think more creatively about what the other segments of US healthcare could look like in a world that had this specialization in trade. Let me put one caveat on the discussion of hospital closures or rural hospital subsidies. So I guess I'll just criticize my own paper, which is one thing that we haven't really assessed here is about economies of scope. And to answer this question about rural hospital closures, you need to say, like, what is the complementarity between having an emergency department and then having another department doing non-emergency care? Remember that we excluded emergency department claims from our analysis. And so I think we're the first step or another step in pushing this policy discussion, but not going to be the last word on sort of the trade-offs that you face in terms of rural hospital closures. And again, I hope we spur a lot of people to work on willingness to travel and who's more likely to do this, et cetera, because I think there's a lot of interesting things there. Let me say a couple of things about that. So in response to Greg's question, it's hard for us to translate our travel costs to fiscal dollar terms because I'm in a fixed price environment. So the one parameter I can estimate is the price elasticity of demand. So it's not easy. I would have to make a lot of assumptions to get into dollar terms. So I can think of other research designs to try to separate, like, is it literal physical distance or is it information sets? And there's a nice paper by Zach Brown and some co-authors looking at the NHS, the UK system, and like they have a Yelp-like thing where it was like rounded to the nearest half star, and rounding up instead of down causes a bunch more patients to show up. So it's clearly a setting where information matters. And I could think about other research designs you could try to do for referral effects and that kind of stuff. But we hope other folks will follow up if we fail to follow up. It's not going to happen in this paper. Neel said it was a little strange that aging is helpful. If you believe in market size effects, that's kind of where you wind up, right? Ajmoglu and Lin, QJE, like pharmaceutical development is tilted towards the big populations. As the U.S. gets older, old people get more drugs that treat old people conditions. So yeah, that is where you wind up if you think in directed technical change as market size effects, or in our world that get these regional increasing returns. A couple people asked about what if doctors like living in big cities. So I didn't have much time to go into that, but this is clearly the #1 threat to telling a story about increasing returns to scale is no, you don't have a demand shifter, you have a supply shifter. Doctors want to live in big cities because they all love Broadway shows. Okay, so I'll summarize what's in the paper. The first thing is it turns out that doctors are only about 1/3 of the labor cost. And so while physicians do take nominal wage cuts, there's slightly lower nominal earnings in big cities. The non-physician labor earnings, those rise with market size. And so the total, the total labor cost for producing medical services is higher in big cities, and that's before we even talk about like real estate prices in big cities. Then you might say, okay, well, I don't want to talk about the average doctor. Let's go talk about specializations, like these transplant hepatologists don't want to live in Alaska or whatever. So one fact that we found that was completely surprising to me is that it turns out that the average, so a story about amenities is like, if I'm in a specialization that makes more money, I want to live in New York City especially, right? It's a story about non-homothetic preferences or these, urban amenities being a luxury. What shocked me is it turns out that the total number of doctors with your job title in the country is orthogonal to mean earnings in that physician specialization. And so we have these results that relate market size to the number of people with your job title, how scarce is that specialization, and adding in what's the average earnings in that specialization does nothing to that regression because it turns out those two things happen to be orthogonal. So we think we can distinguish those for at least the most basic stories you would tell about doctors' supply shifters. Okay, I think let me answer both a referrals question and another question about the people that are not traveling or severe conditions and who would be traveling for that. So clearly there's this inequality concern in which, to the extent that we can measure it, low SES people are less willing to go longer distances for better care. We haven't constructed the patient histories that let us do more sophisticated things about which doctors refer long distance, short distance, and this other kind of stuff. If you were the planner, and we have 3 income terciles in the paper, and you put only weight on the lowest income tercile, then production subsidies in rural regions would have the highest return. So I went through it, I basically skipped it, but if you put equal weight on all types of patients, then the bang for the buck is biggest in large regions. But if you said, I have this inequality aversion, so I put larger weights on the lowest income tercile, then production subsidies would have a higher bang for the buck with that weighted objective function. So I think the paper has lots more details on this, gives you the ingredients and the set of trade-offs. There's no simple answer, but we hope that we can give you the tools to do the economic analysis of that complicated environment. Thanks very much.
All right, so now we have about a 10-minute break, and we'll meet back at 2:55.
Oh, no, don't worry about it. It was fine. Yeah, don't worry. It was fine. Don't worry about it.
Welcome back from the break. My name is Ping Hui Wu. I'm an economist at the Boston Fed, and it's my pleasure today to introduce our speaker of this session, David Wickser from the Atlanta Fed, and the paper he's going to talk about today is the place-based redistribution of disability insurance. And the paper will be discussed by Kyle Greenberg from West Point. Thank you. The floor is yours.
Great. Thanks very much for having me. I'm always super happy coming back to Minneapolis because I did grad school here. And I made a place-based decision today also in that I wore my best flannel for the presentation. So great. So this is joint work with Amanda Michaud and Timothy Moore. And then the set of disclaimers are with the Fed not being represented by us. And also we're going to use some Social Security data. Okay, so to kind of tee up the idea of the paper, it's that we have a lot of these social insurance programs, and they generally treat individuals and households that they're trying to insure uniformly across space, or at least they kind of try to. And so in our case, this is a national program, which is Social Security, or at the state level for UI. But programs are kind of geographic in their take-up. So I'll show you a lot of evidence that the take-up of this program differs a lot across space. And these reasons for different take-up can kind of fit into like two big buckets that we're going to use. So one of these reasons is that the state of people being insured can differ across space, right? So the frequency or severity of the adverse effects can be very different across space, different health in different places. And then the other is that actually, even though they're trying to be the same, right? Like my parents always say that they treat my brother and I exactly the same, but they never did. We're going to talk about something else actually, though. So even though the program tries to treat people the same across space, actually the value of the program can be very different across space. And so we'll talk about that also. So this is that eligibility and benefit rules can interact with place-based characteristics. And then also, even if I'm giving the same nominal dollar across space, that dollar goes a different amount in different places. Good. So today we're going to talk mostly about geographic variation in DI. So Social Security Disability Insurance is the largest transfer program that we have in the country. More people are on it than any other income replacement. It's close to 1/10 of the federal budget, so it's gigantic. And the spatial reallocation of dollars is also gigantic. It dwarfs the kind of spatial differences that you saw in, for instance, the American Recovery and Reinvestment Act between high receipt counties and low receipt counties. So one way of kind of looking at that, so 1/3 of working age adults live in counties that account for more than half of DI beneficiaries. So there's this long tail. In that long tail, 6 million Americans are in counties where that's more than 10% of the working age population. So really high penetration in the places in which it's big. And then in this tail, DI is the largest single employer. So DI payments in a lot of places can be up to 20% of the local labor income. So to kind of show this tail, I kept talking about a tail, so we've got to have a distribution. So the tail of awards goes way, way out. And then to look at that on a map, there's this kind of big regional variation and a lot of concentration in the southeast. You can stare at this and kind of find your favorite state. So Minnesota, again, like up by the boundary waters, rural and poor, whereas cities, okay, so I now live in Georgia. You know, rural Georgia is a lot of dark red, and then right around Atlanta, it's white. So Virginia is kind of one of the best states for seeing this. So about 60% of the variation geographically is within state at the county level. And you can see this very clearly in Virginia. Appalachia in Virginia has really, really high rates of receipt, whereas the wealthier DC suburbs, it's much lower. So the picture that we're kind of trying to paint is that it's poor rural areas have very large receipts, whereas the richer urban areas, it's a much smaller portion, it's a much smaller program. Good. So with all that wind up, here's our paper slide. So what we're going to do is we're going to examine the county-level differences in DI applications and allowances. And I said two things, applications and allowances. So we're bringing in data that's a little bit unique in that using Social Security administrative data, we have both the application and the allowance. So we can see kind of how many people in a place were asking for the program and how many of the people in the place were receiving the program. So that's unique because now we can kind of get both the supply of the program and the demand for the program. We're going to combine that with a lot of the things that might be driving differences in receipt at the local level. So we're going to combine that with county-level information about earnings, employment, poverty, mortality, and local price levels. So these are the ways in which the program either might interact differently with the different states in the place, right? Different places are going to have different mortality rates, different levels of health, and also might inadvertently be treating them less equal. You know, teaching the younger sibling how to play clarinet when the older sibling was never given such an opportunity. So that's the differences in local price levels. Great. So then, you know, what do we do with this data? We don't really have clean experimental variation. We at some point started kind of looking at marginal R-squares, but it's difficult to kind of disentangle. Is this high take-up place high take-up because people are sicker there, or because the circumstances mean that at a lower sickness cutoff, people are deciding to start applying? So what we're going to do is create a model in which we explicitly consider kind of the latent selection in applying for DI, right? I can't exactly see where you are in the cutoff, but we're going to model that. And we're going to give a lot of room for these place-based features. So we're going to be kind of computing more than 1,000 little economies that are all linked potentially, and calibrating them separately with very specific place-based features. So what do we find? So we're going to estimate place-based differences in welfare from DI. That's going to be kind of the big thing that comes out of the model, in which I'm going to kind of talk about being a big deliverable from the work. So first, just kind of as a, you know, trying to understand this variation. So why is the tail of DI receipt so large? What's different about these places? Well, 45% of the variation comes from health differences. So that's the largest single reason, but it's also not the majority, right? Differences in the program that favor the rural poor areas is actually the majority, but health is the largest single contributor. The next thing that we're going to do is ask whether this receipt is efficiently distributed. And so for that, we're going to modify the program and kind of play the, can I do an optimization problem across more than 1,000 little counties and say, could I create a place-based program that treated every county differently rather than the national Social Security program, and try to reallocate resources to better optimize welfare? So of course, if we let the computer do it, it does a better job than already. So one of the things that comes out is that the distribution in this optimal place-based program is a lot flatter in real terms, which makes sense, but there's still a lot of curvature. You still want to give more to places where the marginal utility of receipt is higher. Great. And then the other thing that we can kind of see with that is that there's two reasons that a place gets more than others. One is because the insurance is very valuable, and the other is because ex ante, I know that I'm going to get it more likely. So counties with high DI rates currently get lots of ex ante redistribution. So it's not just the insurance value, it's also that if I'm born in rural Virginia, I know that I'm going to get it very likely, but also I'm paying the same premium on the insurance as everybody else. So it's just an ex ante redistribution towards them. And when we do this welfare analysis, we'll split those two. Uh-oh, I'm pushing the button. Okay, great. Related literature, let's skip that. So in the interest of time, I'm going to talk more quickly, although I kind of told you everything that the paper was about. We have county-level data, and the way that we're going to kind of motivate most of our work is using DI applications and allowances from the SSA Disability Research Fund file. So that's actually a lot more granular than we're going to utilize in this work. Yeah. And then we're going to link that with, very importantly, we're going to use mortality at the county level. And so that's going to be kind of my indicator of local health. So something really important is that in some places, health depreciates more quickly than in others. And despite our best efforts to really measure that well, kind of one of the best indicators that's available at a very local, fine level is mortality among 40-year-olds and mortality among 70-year-olds in every county. And so you can kind of draw a line, and you can say this is the way in which health is depreciating differently across space. And then we're going to use a lot of the kind of economic indicators. I'm also going to highlight, we're going to look at different price levels across counties. So if you get the same receipt from SSDI, that goes different amount in different places. So very quickly, just kind of the raw correlations go in the direction that you would anticipate. So as mortality risk increases in a county, receipt goes up. So sicker places are getting more disability insurance. And then on the other hand, as earnings in a place go up, receipt goes down. And then because we have payments in the county and earnings in the county, I can compute like a kind of real replacement rate. And as the replacement rates, as the amount that I could get in DI relative to in employment on average goes up, DI goes up. So that's kind of the broad idea that we're trying to capture. So going into this model, so the main idea of the model is to capture the individual's application decision, because we have these kind of different motives. They're sicker, they're also poorer, and the program kind of can go further. And how do we disentangle that? So what we're trying to do is to measure how individuals' DI application decision and welfare depends on the local characteristics, like how old and how disabled they are, and then also these ways in which the same program is going to treat them different. So we're going to have differences in the price level and the DI allowance process. Great. So then DI insurance is going to provide some insurance against both the loss of earnings and the medical insurance. There's basically two choices in the model, and I can kind of describe the model just like by tilting my arm. So the first choice is whether to work or not, and then conditional on not working, whether to apply for DI or not. So every agent in each of these counties is going to have kind of a health degradation rate, right? And so in like less disabled counties, the degradation rate isn't going to be as fast, and in more disabled counties, the degradation rate is going to be faster. And then the big thing that individuals in the model are doing is choosing where to make the cutoff and do the leap into applying for disability insurance and into working or not. So it's kind of a stopping time problem, right? Like as time catches up with us and hips and backs are getting worse, it's getting harder and harder to work, and at some point it's not worth it anymore. So that's kind of what's happening. So showing preferences. So preferences don't depend on place. We're going to have a marginal utility of consumption. We're going to have a cost of working that changes with age, a cost of working that changes with health, and a cost of applying. Great. And then kind of the budget constraint is going to be that expenditures equal income. Expenditures are going to be the price and times consumption, so there's like a real price level in there. And then there's going to be some medical costs, which are also determined at the local level. And then what you get is you get labor income that's locally specific, or a DI payment, or this kind of non-employment payment, which is like our big residual. So I'm going to manipulate this non-employment, which I can't really observe, in order to exactly match the applications in every county. And so then what we're going to do is we're going to have a disability process that depends on place, a level of income and poverty risk that depends on place. So everywhere is going to have kind of its own set of competing risks, getting sicker and getting income going up and down. And then because, again, I was trying to highlight that we observe both the applications and the allowances, so we can actually disentangle kind of what's driving the probability of an allowance. So we're going to model that. We use a lot of kind of logit magic in this paper, and one of the nice places where it shows up is we can disentangle the probability of getting an award into health and age, and this kind of location shifter. Great. So talking more about how we map this into data. So what's going to drive these county level differences? So the first thing that's going to drive the county level differences is the way in which the program provides different value depending on place. So one of the ways in which it provides different value is that when I get Social Security disability insurance, it's actually going to provide me medical insurance. And so we directly observe that. The other way that it's going to provide different value is that relative to my outside option, it's potentially different. So we're going to infer how hard is it to survive in a different place were I not to be employed or getting disability insurance. So that's kind of a residual. And then we're also potentially going to have differences in the allowance process. That's what the DDS is, the Disability Determination Services, which also can differ across place. Then the other thing that is going to be a determinant of disability insurance is going to be the actual state that's different in different places. So there's going to be different age, incomes, and health differences. Great. So let's see, we've got 8 minutes. Oh, I'm actually doing pretty well for time. So in order to calibrate the model, we're kind of doing 2 sets of things. One of those sets of things is a big national level minimum distance kind of calibration that we think of. And so what that's going to do is going to target the slope of working age and the age structure of disability allowances. And so that idea is that we have county level allowance probability. So for every application, do you get it or not? And so we're going to try to maximize the correlation between the model's allowance probability and the data's allowance probability. And that's the way that we're going to back out those logit coefficients that I showed you in the probability of getting disability allowances. And then at the county level, we're going to fit exactly. So we're kind of doing this national calibration for the working rate. And then in every single county, we're going to have a set of county-specific parameters which match exactly the rate of applying, the claim rates, the allowances per claim in the DDS, and then the age-specific mortality. So that's the way in which health is depreciating in every single county differently. Great. Oh, I can't click on anything. So one of the nice things, I didn't mention this. Sorry, I briefly mentioned this. So we have this kind of residual, which is the out of disability cost of just being non-employed, this residual. And so one of the nice things that comes out of this calibration is that this residual is very uncorrelated actually with the DI rate. So that kind of says to us at least that the things that we think are driving disability uptake being different across space, the differences in health, the differences in age and income, that's most of the important variation. Okay, so some table of parameters. We don't have to spend that much time on this. Okay, let's talk about determinants and implications. And I'm going to spend a bit of time on this slide because I think this is kind of one of the more interesting ones. So in this one, we're going to do kind of an accounting exercise in which we try to understand the variation in disability uptake across space. So what's the way that I'm going to measure variation across space? I'm going to measure it by interquartile range normalized by the median. So that's going to be my dispersion. And I'm trying to say how much does differences at the local level in health, how much does differences at the local level of income, and how much does differences in the local level in the price level determine the dispersion in disability uptake, right? So if I think about this high DI receipt rural Appalachian county, it has a low price level. It's relatively easy to survive on the nationally determined payment level. It's also relatively poor, so the value of DI relative to work is pretty high. And then also, this is interacting with these kind of deaths of despair, the health in these regions is quite bad. So relative to the rest of the country. So what we're going to do then is turn off the variation in each of these categories. So I'm going to make it so that what if I could magically have health be consistent across space? What if I could make income consistent across space? And what if I could make prices consistent across space? So taking out variation in health knocks down dispersion in awards by about 30%. So that's the largest contributor among these factors to awards variation. I also have a lot of data on applications at every county. And so in that, what you notice actually is that dispersion in income is the largest determinant. So the idea there, which I'm going to corroborate in just a second, is that income differences will change the desire for the program, the kind of claim rate, the uptake rate. But because income doesn't explicitly enter into the probability of getting the receipt, of getting an award, it's lower income is kind of bringing in lower likelihood applicants. So having worse health brings in applicants who both want the program and are more likely to get it. Good. So you can kind of see that with this elasticity bit. So that's where if I were to modulate health a bit, how much does that change awards and applications? And if I were to modulate income a bit, if I were to make places a little bit richer or a little bit poorer, how would that change awards and applications? And so applications respond a lot to changes in income, as do prices, because prices and income are almost symmetric, right? If I make the price level lower or I make the income higher, that's kind of the same. But they don't change awards by quite as much. Just having more people who want the program doesn't necessarily mean that more people get the program, because it's people who are on the margin not quite as likely to be awarded receipt. Good. So in the last little bit, let's talk about kind of our two welfare outcomes. So this is going into, okay, so now I've decided why different places get different amounts of disability insurance, and I know that there are large differences across place in the probability of getting it. But because this is a national program, the kind of premiums on this insurance don't adjust. So everybody in every county pays the same Social Security tax, but some places are much more likely to get the payout than others. So it's not an actually fair program. So what we do is we rank all of the counties by how much welfare they get out of the program, and then on the vertical axis, we disentangle how much of the welfare program, the welfare value, comes from the fact that you're getting this ex-ante redistribution, from the fact that your premium in some sense should be higher because you're more likely to get it, from the value that comes from this being an insurance program and you need it in times of high marginal utility. So at the very bottom, the below county welfare, the below median welfare, these are low because they're just not getting very much from the program, and they're mostly giving redistribution. So if I go to an urban county in New York, they're very unlikely to get much out of it, and so they're basically just paying very high high premia. If I go at the top, this is where the marginal utility of the dollar is very high. And so they're not, although they're not paying very high premia, so they're getting a transfer, most of the value comes from the fact that it's insurance. So less than half of the value in the very high willingness to pay counties comes from the redistribution, even though there is some redistribution. And then finally, let's think about what would happen if we were to optimize the payments. So this is where I choose actually the optimal place-based policy. Hence, at the very end of my talk, I'm coming back to why we gave the paper the name that we gave it. This is the place-based policy. That's a good narrative structure for my talk. So the optimal place-based replacement rate. In this, we're adjusting the place-based, the replacement rate by county. So we're allowing each county to kind of have its own program. And so what you see is so the blue line is the optimal program, and the red line is the data. So two things to notice here. One is that it's much flatter in terms of its real replacement rate. So what this is pointing out is that there are places that get a lot of receipts that have very high replacement rates. And that's largely because income is low in these places, and the price level is low, so it's worth a lot. Am I a minute over? Yes. OK, so it's worth a lot. So what the optimal program would do is flatten that out quite a bit. It still slopes up, however, and that's because in places that are currently getting a lot of DI, they still have a high marginal utility from these payments. So 39% of the counties get more DI income in this program, representing 70% of the population. So it's paying more into large, wealthier counties. Great, so I'll leave it on the conclusion slide. Thank you.
Mic's not on. No, it's just not picking up. Is it better now? All right, good enough. Okay, so I'm Kyle Greenberg. I'm from West Point. I'm excited to talk about this paper that David just presented with Amanda and Tim. What is this paper about? I can think of no better motivation than this map right here. Clearly, we can see that there are some places that where take-up of a disability or receipt of disability insurance is much higher than other places. If you look at the map not very hard enough, you can clearly see that there's some patterns here. And what's sort of interesting is when you, I went backwards, sorry, wrong button. If you look at specific states, if we look at Virginia, you can see that a lot of this geographic variation in the receipt of disability insurance is within states. So it's not something specific to states that's causing this variation that we saw. And if you wanted to ask a question, like how would non-economists think about this sort of geographic variation? Maybe you read the Wall Street Journal about 3 days ago. On Monday morning, there was an article with this title, "Americans are more reliant than ever on government aid." If you flip through this a little bit more, you would see that you would get to this figure right here, which is showing all of the counties in yellow are counties where more than 25% of income is from some sort of government transfer program. Full acknowledgement, this is clearly not all disability insurance, but if you looked at this map, you would say, it seems kind of similar to what we saw in the map 2 slides ago. And so if I had to sort of summarize this article for a room full of economists, paraphrasing a little bit, it would just be moral hazard. Okay, great. And so this isn't the only story, though, because if you watch Last Week Tonight with John Oliver, last week, not tonight, but last week, he had a segment on disability insurance. And the general gist of this segment, translated and paraphrased for the room, is the consumption smoothing benefits of disability insurance. And when we think about most of the papers that are written about disability insurance, they tend to analyze this program from one of these two frameworks. It's certainly not to say that the authors of these papers necessarily agree with the viewpoints of the Wall Street Journal or John Oliver. It's just to say that it's easy to analyze disability insurance from the framework of it's moral hazard, or it's like work disincentives, or it's consumption smoothing benefits. I think what's really neat about this paper is it develops a model where it allows us to analyze it from the perspective of both frameworks. And so, there we go. What does this paper do? Just a real quick summary of what David already mentioned. It identifies factors that contribute to the geographic dispersion of disability insurance. And then it develops a structural model of work, the decision to work, as well as the decision on whether to apply for DI to estimate counterfactual disability dispersions under different county level health, income, and price levels. And so what they find, there's really like three big questions they sort of answer. One is what is it about location that drives DI outcomes? About 45% of the geographic variation in disability insurance is explained by variation in health. About 36% is explained by variation in earnings, and 19% is explained by variation in living costs. Are these payments highest in areas where they're valued most? The answer to that question is yes. And then the third question is, could we do even better with sort of this optimal reallocation of disability insurance, holding the current disability insurance budget constant? The answer to that is yes. Just a quick summary. The welfare optimal local replacement rates would redistribute towards counties that currently have much lower receipt. And so I think these are some nice figures just showing the raw correlations between disability insurance and different factors, including like health characteristics such as mortality, as well as wages and the replacement rate, another measure of, essentially a measure of economic conditions. And one recommendation I would have is maybe complementing some of those raw correlations with linear regressions. I think you're absolutely right to point out that these would not be causal regressions. I just think it would be nice to have some descriptive regressions showing how much of each of these factors explains sort of the county level variation in a way that allows for some of the sort of residual variation that might not be explained by mortality, wages, and prices. And then additionally, how do these sort of partial R-squareds, how do they change with and without the inclusion of state fixed effects? And then on the topic of other things that might be influencing county level variation in DI rates, perhaps your model already incorporates many of these things, or would already would be easy to sort of incorporate. There's some minor assumptions. There might be some other ones that are worth thinking about more. For example, the last one I have there, is there anything related to networks or knowledge of disability insurance, the ability to navigate the program that might explain some of this county level variation? Yeah, I'll move on to the next one. So I was looking through the slides this morning, and I was thinking I really should have put this slide in backup because I don't really have a great point to it other than to say I think it's a great robustness check. Consider adding a line of best fit. Clearly it should have been a backup. However, this was a slide you were not able to click on, so I'm really glad I kept it. Poor planning in this case has really paid off. Great slide. Okay, so another one, when we talk about the optimal sort of place-based replacement rate, as I was thinking about this figure, and I've got some excerpts from the paper in there as well. One thing that sort of came to mind is if you're changing the replacement rate, so in other words, if you're allowing for disability insurance in areas with like high wages, if they end up having higher replacement rates than the current replacement rate, which they would under sort of this optimal allocation of the current DI budget. If you're adjusting that sort of replacement rate, I think that's also going to adjust the distribution of award rates. And in particular, I think it might be helpful to show the sort of the extensive margin effect. I think it would be like figure 1 from your paper where you could overlay on top of that, okay, as we increase the replacement rate in regions that currently have very low take-up of disability insurance, how might that adjust the share of individuals in that county who are now receiving disability insurance? And then I think you also mentioned in the paper, and you mentioned this in your talk, that about 40% of counties or 70% of the population, I think, are to the left of the intersection point. And so it would just be good to sort of see, all right, that there's that huge mass of counties that currently have very low award rates. But in general, I think this is a very good point to get across that you have a very large share of the population where there's under coverage, so to speak, of disability insurance. In other words, because the replacement rate is so low, you have a lot of individuals who are basically working even though they're in very poor health. Another way to sort of frame the paper, if you look at the recent paper by Deshpande and Lockwood, I think they ask a very good question about how well does disability insurance insure against health risks, and then how well does it also insure against non-health risks. And I think your structural model offers an interesting way to sort of explore this. To think about this more clearly, if you can identify how much each county is valuing disability insurance, then is there a way to sort of partition that value into some part that's explained by the how well it's valuing against like variation in health, and then how much of that valuation is due to any risks that are related to like other factors besides health. And I think it would just be very interesting to look at sort of the geographic dispersion of DI to maybe identify those counties where disability insurance is predominantly insuring against non-health risk, because from a policy perspective, it raises the question, well, if DI is insuring against non-health risk in certain areas, might there be other policies or programs that work better? And then I think it also relates to this last sentence of your intro, which I thought was really great. I wanted to more of a minor comment. I didn't see where these comparisons were in the paper. It's possible I just overlooked it, but I think showing the valuations of DI relative to other programs would be super helpful. I wanted to take the last few minutes that I have to take a step back and give you an idea of some of the changes in federal disability programs over time, including workers' comp. So right here I'm showing the annual expenditures for disability insurance, or SSDI, supplemental security income, and workers' compensation over time. This is only including adults, so I'm excluding children from this. And actually, I don't know how many of you are aware of this, but in a few months, SSDI will no longer be the largest federal disability program. It will be replaced by Veterans Affairs Disability Compensation, or VADC. And this is quite remarkable because the share of military veterans in the country has actually been declining over the last 25 years. And so right now we're at a state where if we look at annual benefits paid per eligible veteran relative to annual benefits paid from DI per eligible adult worker, VADC is now paying about 10 times as much as DI. So another thing I thought about, if this is figure 1 from the paper that we just saw, it's showing the distribution of DI receipt across counties. If we did something similar with Veterans Affairs Disability, where for each county, the numerator would be the share of veterans receiving VADC, or sorry, the number of veterans receiving VADC, and the denominator would be the total number of military veterans in the county, you would see the distribution that I've put on my left or your right. And I think what's clear from this is that they're at sort of completely different ends of the spectrum. Whereas it's very rare for a county to have more than 20% of the adult population receiving disability insurance, there's almost no county, or there's very few counties where fewer than 20% of veterans are receiving veterans disability. And then I also wanted to point out that among younger veterans, receipt of veterans disability is even higher. And in some recent work that we've done, we can show with pretty solid evidence that this very high rate, or this growth in VADC, is not explained by combat deployments to Iraq or Afghanistan, nor is it explained by changes in who's been enlisting in the military. And then looking at geographic variation in disability insurance, again, another graph, another map. If there's one thing this conference definitely needs, it's more maps. And so here we go. We've got the map showing the distribution, or the geographic dispersion of VADC across counties. If you look closely, there are some similarities between these maps, but looking at Virginia in particular, here's figure 3 from the paper we just saw. If we looked at that with VADC, we can kind of see that, again, for all counties, there's a relatively high share of veterans who are receiving VADC, but the geographic dispersion towards VADC sort of leans towards the eastern part of the state, whereas with disability insurance, it leans towards the western part of the state. I guess here's a question: why am I showing all of this? I certainly don't expect you to bring VADC into your paper, but I think it is helpful as researchers, when we're thinking about disability programs, to think through kind of are there certain things about VADC that might help us confirm or deny some of the reasons for geographic variation in disability insurance or other patterns that we've noticed with disability insurance? One thing I'll mention is that VADC, it's meant to compensate veterans for injuries sustained or aggravated during military service. So in that regard, local health conditions really should not have very little impact on the geographic variation in VADC. At the same time, veterans disability payments, they increase with the number and severity of veterans disabilities. They're not in any way tied to how much a veteran earns. They are not work limiting with a few minor exceptions. So in that regard, local economic conditions and living costs should have less impact on disability compensation versus disability insurance. But I also want to caveat all this to say that maybe these comparisons aren't fair. There's sort of a lot of differences between the programs, and probably the most stark difference is that they both tend to be on very different ends of the insurance spectrum. I don't think it's too much of a normative statement to argue that DI appears to inadequately insure against health risks in many counties, as your model shows. I think that's less likely to be the case in the context of veterans' disability. And so the last thing I'll mention is that maybe this offers an opportunity to sort of understand what disability programs might look like under sort of a very different set of rules regarding how we would distribute payments relative to what we currently have with SSDI. Okay, so thanks again. It was a great paper, and I'm glad I got to discuss it.
Thank you, David and Kyle, for the excellent presentations. Now we open the floor to questions.
Hi, I'm Bacon from OAGI. I am, in other contexts, really interested in the use of allowance rates to infer things about how transfer programs work. And I was wondering, in your logit, maybe I missed it from how the estimation was conducted, but if you have areas, if you're just mapping some of the allowance probabilities onto area statistics, do you know or do you have a strategy to find any kind of observables about the implementation of the program? So if it turns out that programs fundamentally operate differently just in areas where people are also sicker, like you're going to conflate them, could you use observable stuff like there's a paper by Hilary Hoynes and Nicole Maestas about like disability insurance attorneys, for example, as important moderators of like people's access and process through the program. I just thought that step would be really interesting to see if there's any leverage for observable implementation features to see how it affects that part.
So based on Amanda's, Greg Gordon, Richmond Fed. Based on Amanda's previous work, we should see disability applications sort of fluctuate with the cycle. So did you look at whether the applications and awards fluctuate maybe at a state or national level?
Hi, Kosli Simon, Indiana University. I am curious whether you can get at something to do with networks and information, because I'm thinking about areas where there are higher rates. Is it, other than the factors you're looking at, is there a way to get at how much of it is because there's better information about how to apply, in addition to maybe leniency differences, as Bacon mentioned? Another thought I had is whether you can look at the different kinds of health risks by breaking out the age-adjusted mortality, particularly looking at opioid overuse deaths. And separately, that's just the descriptively, but whether you can use ways that, like looking at which states had triplicate laws, looking at a causal story of the opioid crisis and the distribution of awards by looking at whether there's a way you can look at down the road from the times when the origins of the crisis started in a causal way.
So I was wondering,
With the idea of insuring against local costs, it's always tricky when we think about these insurance programs, whether we want to equalize marginal utility of consumption or something else. And to follow up with that, I want to point out that there's another big program, of course, which is just Social Security, the retirement benefits. Those, you could argue, redistribute against all these counties because people die young. And you can say, oh, from a purely utilitarian perspective, that's the right thing to do. They die young, why should we give them any money? But most people would be a little uncomfortable drawing that conclusion. And so you're taking the conclusion in the opposite direction. There's still that component. Should we think about ensuring marginal utility of consumption or just redistributing resources in nominal terms across these places, and how do we think about the two?
Hi, Aaron Sojourner from the Upjohn Institute. I know Dr. Michaud is familiar with this work, but I was curious what role you think about. Is there any scope to study migration in this? Like, there's some evidence from other places that, people might become disabled in an expensive place and then take their benefit and migrate to a cheaper place closer to parents or family of origin. And I don't know whether your data would allow anything on that front, but might be. I wonder what role that kind of mechanism might play in the patterns.
Thank you for all the questions. Now I turn the floor back to. Oh, we have one more? Okay. Sorry.
Thank you. Abby Wozniak with the Institute. Kind of piling on mechanisms, but wondering about the potential for peer effects. And I think normally those are hard to distinguish from network and information effects, but Kyle's discussion of VADC makes me think that's another place where that's a useful wedge, because I suspect that the information there is pretty well distributed, but you would still potentially see peer effects or social norm changes.
Okay, excellent. These were really, I mean, the discussion was perfect, and the questions were also really good. So one of the things that I think came out really strongly in the discussion and also in the questions, so this idea of, is the program addressing, should we think mostly about the program and how it addresses the moral hazard of, who's getting it, and is it serving the people whom it's intended, or is it providing consumption smoothing the best? So something that I kind of sped through a bit at the end, and I was very happy for Kyle to highlight this, is that what the optimal tries to do is to redistribute back towards some of the people who are in poor health, have a difficult time working, and are kind of underserved by the program. And so in that sense, it's kind of highlighting that some of the consumption smoothing is underserved. I think the other thing to point out is that this paper is kind of playing in the gray area of, a lot of people have some health problem, and so it's not black and white. And so when we change incentives, we change a bunch of marginal choices, actually. And so I think that's where, like, this dichotomy between moral hazard and consumption smoothing, we're kind of trying very hard to play in that, like, little line right between the dichotomy. Yeah. So this actually, I think, comes in really well to this question about, like, what are we actually trying to ensure? Is it trying to provide kind of equalizing marginal utility or redistribution? And I think that's a really useful question here. And we took a strong stand that we wanted to equalize kind of individual level marginal utility of consumption,
And that's obviously not the only choice we could have made. And I think a really cool thing to do is kind of let's just change the objective function and see how that changes our optimal allocation in this. And so I'd love to talk more about that. Let's see, a quick hit, time variation in applications, to Gray's question. There's a lot of cyclical variation overall, but it's almost rank preserving, which is kind of interesting. So the spatial disparity doesn't change that much over time, actually. Let's see, and then this other question about the logit, that I skipped over this a little bit, but the decision is actually made at essentially the state level, this Disability Determination Services Office. My cousin worked at one, actually, in New Mexico. And so there is some leeway, actually, at the state level. So when we say there's 60% within state variation, but state level variation, we're using that. We essentially have state level shifters. And so we're using the fundamentals of the program for that kind. But there might be other stuff that you were thinking about, and so I'd love to talk more about that. And then something that came up several times before I run out is this idea of so Abby and Kosali and others talked about kind of networks and information versus pure effects and kind of spatial correlation of these claims. So the picture that I wasn't able to click on, but which Kyle very helpfully showed, was the kind of residual, right? So when we do this kind of county level fitting exercise, we say, I want at the county level to exactly hit the number of applications. And I'm going to do that by moving around the kind of cost of being non-employed while not getting disability insurance. So I had this kind of residual, which is like the outside option, right? And so we move that around. And in some sense, that's capturing a lot of these other contributors to DI take-up, like that I know somebody that did it, or that I have a network that kind of helps me do it. And so then, what we did is we could do a bin scatter, or we could just show the scatter plot and say, oh, look, it's not correlated, hurrah. There's no other possible explanations. It's just random variation. And I think the interest that was shown here says that that's kind of insufficient. That like one of the things that we could look at is what's kind of the spatial correlation of these residuals. And I think that would be a really interesting way of looking at this. County level spatial correlation maybe isn't quite fine enough to get it, but I think we all have a lot of ideas for what could drive disability uptake, and we hit a lot of that variation in this residual. And so I think Kyle pointed out, and then this room also pointed out, kind of interrogating those a bit more would be helpful. Great. Okay. I think there were several other questions in here that I didn't get to, but I really appreciate the feedback.
So we will have a break and resume with our final paper at 4 p.m.
time to return. I'm Diego Darwich from USC. So last but not least, we now have Abdu presenting about flexibility incentives and wage rigidity. And then Ernie back there is going to discuss. Take it away.
All right, thank you for organizing this conference. Thank you, and everyone who is in the committee. Hopefully, this is last but not least. Oh, yes, I need to turn it on. Can you hear me? It's green. Testing. Okay. Great. So I am Abdu here. I'm a macroeconomist from NYU. And all right. So in this project, we really look at one thing we think is fundamental for maybe the dual mandate of the Fed here, which are both unemployment dynamics, so how unemployment moves, and inflation, how inflation moves. The way economists think of this is usually that sluggish wage adjustments or rigid wages allow to amplify the movements of unemployment and inflation, are some frictions that are needed. However, when we reconcile these models, when I look at rigid wages, is that in fact there is some form of compensation which is pretty flexible, which is incentive pay. All right? If you look at base wages, they are pretty sluggish, they rarely change, and they are weakly procyclical, depending on the study. But bonuses seem flexible. They change frequently, and they're strongly procyclical in some studies and context. So in this paper, what we're going to do is to try to understand how do flexible incentive pay affect the consequences we have in these two segments, inflation dynamics and unemployment dynamics, that we know from rigid wage models. Now, when I say here, when we choose this name, bonus question, this came from my co-author, Joe. I'm going to give it on him. Maybe LSE people are good at catchy titles, Hank, and so on. But we're not only thinking of bonuses. We want to think more broadly of incentive pay. Incentive pay, in fact, is very common. There are, overall, you can think of it as piece rates, bonuses, stock options, commissions, and profit-sharing agreements. Lemire, McLeod, and Parent found that 30 to 50% of US workers get some incentive pay. And even when you look in Makridis and Gittelman, their paper, looking at low-wage workers, 25 to 30%. So this is not a model of CEOs. So we want to think broadly as incentive pay. So what is our main conclusion? And then I'm going to show how we do it, and then finally repeat again what we find. Our main conclusion is that when you look at wage cyclicality from incentives, okay, even if you can have some non-rigidity from incentives, it does not mute unemployment responses, okay? Economists often think that wage cyclicality can mute unemployment responses because you can cut wages instead of firing workers. We say that the source, the point of the paper would be that the source of the cyclicality of wages will matter. So to make this point clear, what we're going to do, we're going to have in this paper, we're going to look at incentive pay. This incentive pay will come from long-term contracts between workers and the firm because there will be some moral hazard in the relationship. So think models we know, like Holmstrom or Sannikov model, where there is a hidden attribute that is not observed, and then because of that, the firm needs to expose the worker to their output and will not just give them fully intraday wages. And we're going to have unemployment, which will be in a standard labor source model, Mortis et Pissaridis. And we're going to look at as well the Phillips curve, which is the other segment of the dual mandate, which is going to be where we're going to think of a sticky price model with labor search, a la Cristiano, Eichenbaum, and Trabant. We will allow here in this setting incentive pay and flexible wages and long-term contract that will be consistent with microdata. So the point of going to be also will be one of measurement that these long-term contract, in fact, are things that we can link to the data. So that links our theory to the data. So what do we find? So our first result is just a benchmark to set ideas, which is, imagine all the wage cyclicality is there to provide incentives for work. So think, let's go back to bonuses. Think there are two types of bonus. One bonus is an end-of-year bonus that's just based, let's say, on your performance, and another is one that is bargained by a union, and it's like a starter bonus, okay? Let's just shut down the starter bonus and just think of the end-of-year bonus based on your performance. If we look at the wage cyclicality, variation in wages, and that is only driven by this, we're going to show that this is equivalent to an economy when you look at unemployment fluctuations where wages are essentially rigid. And the intuition of that is the following, is that even if wages have flexibility, when, let's say, there is a negative TFP shock, revenue falls. But if you cut wages as well, since wages are there to provide incentives, workers will provide less incentives, will provide less effort, and on net, from an envelope theorem idea, in this hypothetical scenario, it's as if you are in a rigid wage economy when it comes to unemployment fluctuations, which means that it doesn't this wage flexibility coming from incentives doesn't dampen, does not mute unemployment response. We have a similar result when we think of the Phillips curve as well. We're going to consider a new Keynesian model where we have a retail sector and a wholesale sector, and we'll be interested also in looking at the real marginal cost of the wholesale sector. And a similar idea that I just explained happens to work for the wholesale sector as well. And the wage cyclicality from incentive does not mute the slope of the Phillips curve, doesn't make the Phillips curve flatter, okay? So that is going to be our two results in this benchmark setting. Now, of course, not all wage cyclicality are there to provide incentives for work. There are other things. There is bargaining with the firm. There is the cyclicality of the outside option, whether it is home production or whether it can be that you could match with another firm. When there are good times, there can be more jobs, you have better outside options, so the firm has to increase your wages in these good times. That's what we call bargaining wage cyclicality, okay? The cyclicality of wages that comes from some sort of bargaining or the outside option of the work. We show that wage cyclicality that comes from this part, let's think of like the starter bonus, which is bargained, that does dampen unemployment fluctuation because these are essentially parts that you can cut for free, okay, when you are in a recession without affecting much the effort of the worker, and they do dampen unemployment fluctuation. Now, the quantitative result now, which is at the end of the day, is how do we use our theory that we develop here? We take our model and we put it in a structure that we can go and match the data. What is nice about our long-term contracts is that we can match them clearly to moments, micro moments of the data, and to calibrate and understand what part of wages are due to incentives, wage cyclicality is due to incentives, and what part is due to bargaining. We find that 45% of wage cyclicality is due to incentives. And the main point that we take from it is that we need more empirical work to separately measure wage cyclicality because the source of wage cyclicality matters, whether it is to provide incentives or whether it is for bargaining. And we can also calibrate simpler models that instead of having this rich structure of dynamic wage contracts can just match their models to a lower moment of wage cyclicality, not just 100%, but to a lower moment that abstracts out from these incentives. All right, so now I think for what I'm going to do now is to show you how do we do it, okay? What is the intuition? I think going over that would be useful, and then I'm going to show you some numerical results. So I'm going to show everything in a static setting for the sake of time, and then show you why our dynamic model would be useful when we want to think of the data as well. All right, so we're going to consider a static model where we're going to proceed now in 3 steps. So in the first step, I'm going to introduce a DMP model where I'm going to shut down everything coming from bargaining. So there will be no bargaining. There will be a take it or leave it offer. And I'm going to show you this equivalence result between this economy where you have this rich incentive pay when it comes to the fluctuations of unemployment to an economy where wages were as if they were rigid. Then I'm going to also show you how this result translates into the new Keynesian setting when we want to think of the slope of the Phillips curve. And finally, I'm going to show you the role of non-incentive wage cyclicality, or what we call bargain wage cyclicality, where you have fluctuations of the outside option. All right, so first the labor market. So we're going to have a frictional labor market where we have a measure of workers that they begin unemployed and they search for a job. So those who remain unmatched, okay, we call them unemployed. Firms post vacancies V, and they have a cost post a vacancy. We have a matching function, and from there we get a Cobb-Douglas matching function. From there we get theta, which is our market tightness. Now, in this setting, we want to understand how does the market tightness vary with the aggregate state. Workers have preferences. They derive utility from consumption, but they dislike effort, okay? And they receive a wage W from the firm after supplying some effort A. Unemployed workers, they have unemployment benefits, and here, like I said, the outside option of the worker will be completely acyclical. This is to just isolate this force. Now, the technology, and this is where we're going to have more friction, which are the micro frictions essentially, where the firm and the worker match, they produce output Y, which is the aggregate state Z, times a combination of two things, the worker effort and some idiosyncratic mean zero shock, okay, which we know the distribution, but we'll not know the realization of it. Then the firm will pay the worker a certain wage. Here I'm just going to call it W without giving the dependencies, to maximize the profits from the value of a match will be the expected revenue minus the wage that the firm pays. And to close, of course, the labor market model, we're going to consider now free entry so that the cost of posting the vacancy is going to be equal to the probability of a filled vacancy and the value of the filled vacancy. Now, in this Cobb-Douglas setting of a match function, we can show easily, like I talked about earlier, the elasticity of market tightness, but we can just think of employment. The elasticity of employment to aggregate shock Z is just going to be proportional to the firm profits. So it is, for all purposes, enough to just focus on the elasticity of firm profits to the aggregate shock Z. So now let's look at that and think intuitively how these change. And that's what we have here. And now let's look at the firm profits and see how they change when there is a change in aggregate Z. So first we have these three terms. And the term in red is the novel term in our paper that plays an important role. The term in green is going to be that we have a direct productivity effect. Okay, imagine there is a recession, okay, revenue falls directly, right, through just marginal cost. But then wages can adjust when they are flexible, and that is the second term, right? So the firm might want to cut wages. Now, if we are in a situation where wages are there to provide incentives for work, incentives effort as well will move as a response. Okay? So and will counter the change in wages, because when workers have lower wage, there is a substitution effect and they want to work less. So that, in a sense, already tells us beyond optimality of a contract anyway, even if the wage contract that we have between the worker and the firm, this effort movement will offset at some point, to some degree, the fall in wages. Now, in an optimal sense, through an envelope theorem, okay, if you look at small changes of this aggregate state Z around a steady state, you're going to have that it will be equivalent to this term, these two indirect terms, the wage response and the effort response exactly offset each other. Now, I want to map what we have learned from grad school to this setting, to certain models of effort, choice, and wages. So that's what we're going to do. The first one will be to think of one where we have fixed effort and wages, like the Hall economy, right? So the whole 2005. So in this one, we get the following. The direct term, the marginal productivity effect, is just the effort that is produced, but the change in wages, since wages are rigid, is 0, and the change in effort is 0 because effort is fixed. Therefore, when you can have large responses here that is just coming from the overall level of effort, the direct term, okay? That leads to large responses of firms' profits to aggregate shocks and therefore employment. Now, another point I wanted to mention is if you just think of models that look at just wages moving through bargaining, you will have response in wages. So think of, let's say, a Scheimer model. But in our paper, what we'll have is one in which we're going to have moral hazard. And how does moral hazard operate? Is that the firm cannot distinguish between whether when the worker gets high output, whether it's coming from a lot of high effort and a high shock. What this means is that the firm will not insure all workers, okay, but will expose them to risk. The full problem, we can write it here, is a mechanism design problem, where you have this contract that is chosen by the firm to maximize profits, to set the wages. The wages will depend on observed realizations, which is output, and they know also the aggregate state, but they cannot disentangle effort and eta, subject to an incentive compatibility constraint, which is that the worker will choose the level of effort that is optimal for them, and to give the participation level, the participation constraint that needs to be satisfied, that they should get more than the unemployment benefits in terms of utility. Here we find the following, is that in this situation, the firm will not insure all the workers, but there is an incentive versus insurance trade-off. So the firm will expose the worker's wage to the outputs. Okay, so in this setting, what we show is that these two terms, by an envelope theorem, they cancel each other out again, so it's as if we return back to the rigid wage world. That's what I'm going to show you here. Now, to link it to employment, employment is proportional to the change in firm profits. And the change in firm profits, like I showed you here, are equivalent in a rigid wage world, in a world with incentives. The way to express it, it's going to be something that we are familiar with for people who know, for example, the Hagedorn and Manofsky paper, where it's just going to be the expectation of the inverse of 1 minus the labor share, which is the excess surplus that is between the relationship between the worker and the firm. And that's all we need to match the two economies to generate similar unemployment fluctuation. Here in this graph, I show our both economies. So this is a static economy. You look at employment. Z is our aggregate shock, and 1 is the steady state value, and we have shocks of +5 to -5%. The red curve is one where we have this flexible incentive pay economy, and one is rigid wage. And we see that the employment responses are the same. The slopes of these two curves are identical. When you go off to larger shocks, they start deviating, especially at the bottom, but they align pretty well. All right, now let's note that one thing I wanted to just highlight here is that this is not just a model where we're trying to create wage rigidities through the back door. In fact, we can have, this holds even though average wages can be strongly pro-cyclical in our benchmark. So we have on the left-hand side, average wages in the flexible incentive pay economy are pro-cyclical, but effort as well follows it. Okay, now I'm going to introduce sticky prices now to think of inflation and give the general idea of this. Now, the setting we're going to consider is going to be a new Keynesian model where we're going to have search frictions, labor search frictions. So we're going to have two sectors. We're going to have the final good producers, and we're going to have retailers. The final good producers, we're going to have an aggregator, Y, which would be aggregator of the intermediate, the wholesale production, and we're going to have an aggregate price. The retailers set their prices and pay a real price of Z for their inputs. And the optimal price that we get in this setting is the usual standard one in this sector, is that the price of each variety J will be the markup times Z over A here. A is an aggregate shock, and Z over A, this real price, will be the real marginal cost. And then after these frictions we have here, we have the usual Calvo frictions on top, which is that only a share of these wholesalers will be able to reset their prices. So in this setting, rho being the Calvo parameter, we can show that the change in the price level is from the price, which is just the markup times the real marginal cost, is going to be just the change in this Z price and the change in the aggregate A. Previously, we showed that there's elasticity of employment to the aggregate to Z. Z was the aggregate state here. Here it is going to be the price that they pay for inputs. It is going to be essentially, they are equivalent in an incentive pay world and a world with rigid wages. In our setting, we'll show that the Phillips curve is combined of two things. So one will be the aggregate friction, which is the Calvo parameter, and this I here is going to be one that is coming from the wholesaler setting the wages as in our previous section, where you have these incentive wages and you have this frictional labor market, as long as they are matched to the same labor share, which is this big alpha. The two Phillips curves are equivalent, and they have the same slope. Okay, so now what I'm going to do now for the remaining time is to show why incentive wage cyclicality, non-incentive wage cyclicality does dampen fluctuations. And the intuition essentially there is now I'm going to make the workers outside option depend on the aggregate state. Okay, so this is one way to think of many things like reduced form bargaining. Then what we find here is on top of this envelope theorem, when you have this, just like this final direct effect, you're going to have indirect effect now, which you're going to have the Lagrangian multiplier of the participation constraint and the cyclicality of this outside option of the worker does dampen the unemployment fluctuations. Okay. Now, what I'm going to do now is to show. Is there a way to click? Because I was going to skip the dynamic model, so because of that, I'm just going to click quickly to get to our numerical exercise. Okay, so why is this model useful? Is that we can match it to, match moment from microdata. How do we discipline these models? So we use a tractable incentive long-term contracting model, a la Edmonds and Gabay, Sannikov, Sadzik. And we're going to have cyclical value of unemployment, and we're going to calibrate the models. How do we calibrate the models? The first thing is, what informs us about incentives? So for incentives, we have two things. We have short-run incentives and long-run incentives. Short-run incentives are going to be just pinned down by the pass-through of firm-specific probability shocks to wages. Okay, so when the firm passes through profitability shocks to wages, that will give us incentives about how much we want people to work harder today. And the long-run incentives are, the way to think about it is like promotion, okay? Promotion, what promotion does, it may promote some and leaves others, so there would be a variance in wages. So we're gonna match the variance of wage growth as well. That tells us about long-run incentives. And finally, we're gonna match the fluctuation in the wages for new hires, okay? That will give us the bargaining and outside option part of our model. So what we do here is that we consider this rich model with long-term contracts, and we are able to match it with the data from this heuristic identification. Now, this is our headline table. We are going to target the standard deviation of log wages in our data and baseline of 0.06. The new higher wage cyclicality of 1 for 1, and the pass-through of firm shocks to wages. We're going to take a lower bound. We have estimates from 0.03 to 0.15. We take a lower bound so not to overestimate the importance of these incentives, and the unemployment rate in the steady state of 6%. Our model, if you look here, the standard deviation of log unemployment, we are able to explain half of the variation in unemployment from our model. So think of that as an R square, essentially. And now, given this half, the part in the wage cyclicality that explains this standard deviation of unemployment is around 45%. Okay, 46% of wage cyclicality is due to incentives. Now, how can you use what we just did? Okay, what we did is simply the following. Now we're going to write a simpler model. That's our 2 here, where we don't have any incentives whatsoever, just the traditional DMP model, okay, in this dynamic setting, but we shut down all the incentives. But instead of targeting this wage cyclicality of 1 for 1 here, we just target below. We reduce it, we take off 46%. We find that it matches well the elasticity of market tightness, and it matches well this standard deviation of log unemployment, like the 2 models are the same. And the main idea then is that we can calibrate no incentives models to non-incentive wage cyclicality, which are less pro-cyclical, and we need more empirical studies of this. All right. All right, I'm going to conclude because I'm out of time. So the question is, does flexible incentive pay affect unemployment or inflation responses? Okay, and the answer is, first, incentive pay matters and is important. The second is incentive pay effort moves and offsets the wage effect, okay? So that marginal costs are essentially rigid, and this puts us in a world where unemployment dynamics are equivalent to in a world with only wage cyclicality coming from incentives, same as the slope of the Phillips curve is the same, whether it's a rigid world or a world where wage cyclicality coming from incentives. So the source of wage cyclicality matters, okay? And one thing I would end is, I think it's very important for empirical work to estimate where this source is, what part explains wage cyclicality, and I'm happy also to elaborate on some of the policy implications as well. I'm sure they will come up in question. Thank you very much.
Thank you. So I want to start by thanking the organizers for having me. I don't want to thank them for making me the last hurdle between you and dinner and alcohol, but I am cognizant of that, so I will try to go fast and efficiently. I also want to thank Abdu for the thoughtful and important contribution to the literature. It really is an impressive piece of work, and it was a privilege to be able to read it beforehand. The focus of most of my work in my career has been empirical macro and labor economics, whereas, as you saw, what Abdu presented was primarily theoretical, albeit with empirical calibration. Through that lens, though, let me say that this paper was exactly my favorite kind of theoretical paper for 4 reasons. First, it was impressive, I think, because it audaciously questions, a seemingly obvious conclusion, that real wage cyclicality stemming from incentive pay would surely affect the Phillips curve and the unemployment response to a business cycle shock. It's exactly the patient precision of theory, so walking through the definitions of models, of incentive pay, and matching that allows them to reach the perhaps counterintuitive conclusion that it in fact does not. Findings like these are what make the discipline of economics, I think, so interesting. Second, I found the paper impressive because it manages to fit in the Venn overlap of 3 literatures at once. So business cycles, the Phillips curve, and real wage cyclicality. So that alone, 3 at once, is a pretty rare feat for a paper. Even rarer is the fact that these are not obscure literatures. These are not gathering dust in the restricted section of macro labor. These are the existential literatures of macro. Without them, there would not be macro. Now, let me pause for a second before I go on. One discipline that I find helpful with my own research is to ask in very plain English, why do we care? So why do we care about incentive pay, and why do we care about this question? So for starters, let's just start with magnitudes. As Abdu told you, incentive pay is widespread. So we know from Makridis and Gittleman that 35% of workers in 2019 received some form of incentive pay. Now, what's interesting from their work is that that share has come down. It's come down from 47% in 2004. And I'm going to talk a lot more about data later on, but keep that in the back of your mind. Even so, even in 2019, this was not a minor compensation phenomenon that we're talking about. Back to their paper, the thing that I loved about it is that it's proving their hypothesis by making a series of reasonable, like almost painfully clear choices. So they are doing both static and dynamic exercises. They start with a standard Diamond-Mortensen Pissarides model for matching. They add a sticky price Phillips curve in the vein of Blanchard and Gali 2010 and Cristiano et al. 2016. And in particular, I appreciated that they tested 2 incentive pay models. One is the rigid pay model of Hall 2005, and of course, as you heard, one is the flexible incentive pay model of Hallstrom 1979 with moral hazard, which when I started reading this paper, I was anticipating and wondering whether they would incorporate moral hazard into their modeling, because I am a former financial sector employee that received incentive pay, and I can tell you that the model of incentive pay in the financial sector is full of moral hazard, because they absolutely cannot identify specific effort in their way of distributing incentive pay. Obviously, as you saw, it turns out not to make a difference with their results so long as the models are calibrated to the same steady state labor share. So going back to why we care, how do the authors' results inform our motivations? The authors find that wage cyclicality from incentive pay does not dampen the unemployment response to a business cycle shock. Now, note what their analysis is not saying, as Abdu said. It is not saying that wages with substantial incentive paid components cannot be pro-cyclical. In fact, their model can lead to meaningfully pro-cyclical wages with incentive payments. But again, the cyclicality does not dampen unemployment responses to business cycle shocks, nor per their second finding does the cyclicality affect the slope of the Price-Phillips curve. So why does this happen? Well, while incentive pay does dampen the response of profits from wages in response to a business cycle shock, there's a perfectly countervailing effect on incentives and effort that mutes the movement in marginal costs. So I found this result fascinating and really one of the most interesting parts of the paper. And finally, their third result, which is, I think, going to be the springboard for the remainder of my comments about extensions. 45% of the cyclicality of wages is due to incentives, and 55% is due to bargaining, the availability or lack thereof of other offers. So, this paper is an interesting mix of positive and negative findings. I think that we can take their paper in a number of different directions. Validation and application, and I think that Abdu was absolutely right that empirics are the natural sort of next step of where to take this theoretical paper. There are lots of possible directions, and I think that that's a testament to the importance of their research. So in the short time that I have left, where I've decided to focus my remarks were on sort of three practical implications and applications for policymakers going forward. And I thought that since this is a Federal Reserve Bank of Minneapolis conference, that you would agree with me that the best economics research is not distinguished by whether it's empirical or theoretical, or whether it's macro or micro, but whether it is of use to policymakers, whether it makes the economy work better for the American people. And I think that that's really the fourth and final reason why I found this paper so impressive, is because there are actual distillable implications and tools for policymakers that we can draw from it that are helpful. I'll briefly talk about three. So better data, real-time monitoring of incentive pay dynamics, and extending their research into the empirics of real wage behavior. And I'm going to focus on the pandemic in particular there. So let's start with the data. I hope that Abdu convinced you that incentive pay is important. And so in order to know more about incentive pay, we need data on incentive pay. The problem is that the data that we have on incentive pay is bad. It's very bad. Even though their first two findings on, never mind, sorry. Let's see, the National Compensation Survey, which you may know is the source of both the Employment Cost Survey and the ECEC series from BLS, is sort of the main source of incentive pay data that a lot of papers use. It's a fairly small sample quarterly survey of about 25,000 establishments that's released. It produces an aggregate measure of what's called non-production bonuses. That's what they call this incentive pay measure. That's not incorporated into wages. That's a separate benefit that is separately spun off. But as the chart on the right shows here, that average can get skewed by idiosyncratic factors. So in this case here, it was skewed by sample selection in the National Compensation Survey. Now there is microdata available in the National Compensation Survey, but it's restricted to researchers. It's not publicly available. The ECI, of course, produces a measure that excludes incentive paid occupations, not the incentive pay component of compensation. There's a slight distinction there. And I'm going to talk a little bit more about that specifically in my next point. There's the current population survey. Now, the current population survey is a much larger data set. It has a monthly sample, not a quarterly sample, and its microdata is publicly available. But it has a horrible measure of incentive pay because, number one, it combines tips, overtime, and commissions together and doesn't allow you to distinguish them. Number two, it only asks that question of hourly workers. It doesn't ask them of salaried workers. So it really is poorly designed for these sorts of questions. There are some metrics in some of the longitudinal surveys that we use, the PSID, the NLSY, and the SIP. But they're not suitable for real-time analysis that policymakers might use. Also, before I came to the conference, I did a really quick and dirty analysis of the SIP, and it seemed that the SIP seemed to understate incentive pay relative to measures like the PSID and the National Compensation Survey. So I'm not sure what's going on there. Anyway, given the budget constraints that we know are plaguing agencies like BLS is even talking about cutting the current population survey. It seems like the most realistic, feasible way forward on data is through private payroll providers. We know that ADP, for example, in their software has ways of integrating incentive pay into their software and keeps data on this. So this seems like a great example of a place where private data, for once, can help augment what the government already has. Next, I want to talk about why incentive pay, and specifically the cyclicality from incentive pay, can matter from policymakers. And I want to give you a specific case study. And so, to this day, the Council of Economic Advisors, when we report on the Employment Cost Index for the president, we include the measure of ECI that excludes incentive paid occupations in the presidential memo. And there's a reason why we do that, and the root of it goes back to 2014. So back in 2014, in the wake of the Great Recession, the labor force participation rate that you see there on the left, that's the prime age labor force participation rate, fell by 2 percentage points. Now, obviously, from the real-time standpoint of 2014 and 2015, we didn't know what was around the corner for prime age LFPR, and so I've grayed that out as data incognita from the real-time standpoint of 2014 and 2015. So from the standpoint of the debate of 2014 and 2015, there was a debate about whether or not the economy was at full capacity at the time. And observers were looking for any sort of confirmation of that hypothesis, that that was as good as it was going to get. Well, enter into that debate ECI in 2014, which began to accelerate in the second quarter. That's the orange line. I'm plotting private sector wages and salaries. So if you thought that trend productivity was between 1 and 1.5% at the time, and then of course the Fed's inflation target was 2%, you can see from that orange line that in 2014 and 2015, ECI was rapidly accelerating toward what you would have thought was trend nominal wage growth at the time. And you might have taken that as a sign that, as a matter of fact, we were at full capacity in 2014 and 2015. But actually, what was not accelerating was the blue line, which was ECI excluding incentive paid occupations. So what real-time observers were concluding at the time was that the cyclicality from incentive paid occupations in this case might be having a meaningful effect in real time on the measure of wages that we were using, because there was no similar spike in non-incentive paid occupations. And in fact, it turned out that they were right. The incentive paid wages came back down, and then of course prime age participation started rising further. So finally, just as a what I think is a pretty obvious extension of their research, there are just so many questions around cyclicality in the pandemic specifically. And I'm just going to throw out a couple of them here. Real wage dynamics have become sui generis over the last several years. And incentives and bargaining have been a substantial story in this. Remember, as I said before, the importance of incentive pay, as far as we know based on the data available, have probably been coming down. In the meantime, the importance of bargaining during the pandemic have shot up. We know that job-to-job transitions rose to historic levels in 2022 and 2023, have since come down, but during that time were quite high. So here I've done nothing fancy. I'm just showing ECI, the wage, on the left, ECI on the right. This is the level of ECI for private wages and salaries and benefits, deflated by PCE with a high, smoother HP trend. Obviously, this is not making the important cyclical distinction between bargaining and new hires. I'm going to show that in a second, but just as a cursory observation, notice right off the bat the negative gaps in recent quarters for both, despite the positive or surplus reads in most cyclical measures. On the left here, I'm showing the Upjohn Institute's New Hires Quality Index, which is a nice way of trying to get at the what we think of as the most highly cyclical measure of real wages. That is currently negative right now. As a crude way of trying to get at bargaining power, I'm showing the Atlanta Fed's wage growth tracker for job stayers only, which I've deflated by PCE on the right. After briefly turning negative, it's become positive. So as you can see, there's a very interesting recent cyclical story here, where what we think of as the most cyclical measure is actually negative now, and the less cyclical measure is actually positive now. Now again, to be absolutely clear, neither of these measures in principle should include incentive pay in them, but incentive pay more broadly in compensation could be part of the story here, and the interplay between incentives and benefits could also be part of the broader dynamics going on as well. So since I'm out of time, let me end there, and let me thank you one more time for having me, and let me congratulate the authors one more time for a very important paper. Thanks again.
All right, thank you, Abdu, for the presentation, and Ernie for the discussion with the empirical linkage there. So now we have time for questions. All right, I can ask one too. Yeah, go ahead.
Turn this way. Yeah, so I guess this is actually kind of two questions, but they're related. So one is the kind of pass-through from firm-level shocks to wages. I guess there's another margin, which is like inflows and outflows from the firm. And so that kind of, you would think of another use then of incentive pay is also as retention or recruiting. And so I guess it's kind of both, right? It's like when we think of the pass-through, we're kind of talking about stayers, and that seems a little bit understated, and that lends to another. And so I guess the second question is, what do you think of kind of other forms of adjustable pay and how that would kind of go into this work?
Thank you.
Thank you. This was fascinating. So two questions. First, there's a third view of what incentive pay is doing. So you've talked about incentive, about bargaining. There's this paper by Harold Howe, Rocher, and co-authors that argue that incentive pay is about risk sharing between shareholders and workers. The idea with incentive pay, you can put more of the risk of the firm on the workers, and they have some empirical evidence that it's completely unrelated to the worker productivity, but when the firm's doing well, you share the risk. And so I'm just thinking, how does that map into your framework? It seems that in terms of your empirical identification, it would look a lot like incentive pay. The second point, I'm trying to think of what would it take to break this result that incentive pay doesn't matter that much? And I'm thinking whether kind of assumption about MPCs, a model where you have saving and consumption. Do we have any evidence that the MPC out of incentive pay is different than the MPC out of regular pay? Or if you think that incentive pay is transferring risk from shareholders to worker, and you think that shareholders have different MPCs because they're richer than workers, then incentive pay changes how consumption fluctuates. And so I'm just trying, it's probably not for this paper, but just thinking a little bit of what would it take to break the result.
One more here. I'll follow that comment just before. So I was wondering, like, what would take to break this result? Because you presented everything that's like, this is robust to A, B, C, kind of like you said, dynamics, different kind of payments. But then I was wondering what's going to take to break it. And my thought was not on the MPCs, but you assume that there's complementarity between aggregate state of the economy and effort. And I was wondering if you change that, if that would change the result. But I guess in general, it's what would break this. All right, we'll give you time to answer now.
Okay. Thank you very much thank you, Ernie, for a very fantastic discussion and very complimentary to what we said. On the issue of we need better data, absolutely, I agree, and I think we do as a first step here, and we really think that we need more micro data on wages. In fact, an anecdote is that when I started this project, John Grigsby had this paper with Eric Hurst where they had access to the ADP data. And that was also, so at some point they lost that. I heard from here in this room that this data might be available again. So we would love to look at that where they have some micro data as well. So really, like you said, the private data I think is really important. And thank you really for highlighting that case study. We didn't know of that case study where you have this surge in now the non-incentive pay wages and the incentive pay wages remained. We will investigate there to see whether we can discipline it as well. So on questions here, that David's question, you said that there is other forms. So like retention is another. And so we just we had a view here where incentive pay is driven by moral hazard. But if you thought of like retention in an endogenous way where the worker can then go and search for another job, but that outside option requires some search effort to the worker, then yeah, that you can think of it as well, that retention as a form of incentive pay. So, but how the worker, worker exerts some sort of effort into getting to that outside job. So that's why we do not have on-the-job search or things like that. But if you had on-the-job search, you would need to think of how that margin as well will be a form of incentive, okay? So that's related also to kind of, when you ask the question of how about the other forms of adjustable pay, and I think the main insight that we have is we really need to think of whether this adjustable pay will generate endogenous responses of workers and how these responses move with the overall level of productivity. That's like the key insight. So incentive pay is one, but incentive pay is pretty broad and defined. I think we could even think of promotion as form of incentive pay as well. Yeah, so I think that's kind of I wanted to just say that also broadly defined, I think our results are related to some work that has been done on when you think of, let's say, in the consumer markets, where there are sales and people need to make effort to search, and they find rigidities as well arising from there. It's the similar ideas. So you cannot just look at some sort of flexibility in variables and then say from there that, okay, there is dampening of unemployment or the Phillips curve. All right, and this gives me an opportunity also relate to the data to mention also one thing that was even if there is this measurement error on how people think of incentive pay, I wanted to mention as well that so in John and Eric Hurst's paper, where they defined incentive pay as a residual, the base wages were pretty fixed. There was only a 2% cut. But the bonuses, even if it was a smaller share, they can cut up to like 17%. So even if it's a smaller share, even if you take a smaller share, they have large responses. So they play an important role. So on Taha's view, that Hall and Rocher and others have said that this can be a risk sharing, that the stakeholders, the shareholders have the firm value can change, and this is a way in which they share risk. Now, this is similar to the Weitzman idea of profit sharing, and that is going to also help me comment to give some policy. So Weitzman idea of profit sharing was, and this is also something that happened, kind of think of Japan, it's like, but we need to have more risk sharing between the worker and the firm, because then, when firms profit falls, instead of just firing workers, they can just cut wages. And I think we wanted to just say we need to look at more the wages. They can certainly cut wages. So the way we would think then, this firm value would be also in the outside option of work. As long as if you assume that a worker in a team is kind of atomistic in affecting a firm value, then that's the way we think about it as well. And I think it's important. What would break down the result? So dynamics don't break down our result, right? But the result there is very important the way we think about it. It's an impact elasticity we're going to be, which is what is going to be when you are at a steady state, the elasticity of market tightness to aggregate shocks at the impact. But beyond that point, okay, they are equivalent in these two worlds. The level of assets differ, level of output differ, and these can differ. So it's really on impact result. So you can think of some sort of MIT shock type of economy. And of course, the world is more complicated than that. Diego's question was also related. One other thing I wanted to mention as well, but this is more nerdy, it is that if the set of contract that the firm has changes in recessions versus normal times, then that matters as well. Let's say, imagine they cannot have the same compensation packages now, they need to change. Then there it can be a situation where they can extract from the worker more effort without having to give them incentive pay. But that's those are the situations where our results do not hold. All right, thank you very much.
Hi, My name is Andrea Raffa. I'm the research director here at the Minneapolis Fed. It's my pleasure to give a few remarks before our reception and dinner. First of all, I wanted to echo some of the thank you that Abby and Amanda have provided before for all the work that the team put together to organize this event. Let me start with the organizing committee, obviously the program committee. So Amanda, Diego, Ilanin, Lufu, Oksana, Pingui, and Sandy Black. So if we can give them a round of applause, please. Second, thank you, presenters and discussants, for the great material and research you share with us, the insight. My sense is that we had a very robust discussion, so the papers will be better after this conference, and we all learned a great deal, so thank you for contributing to the event. And with that, there were also people that couldn't make it today. A number of folks had either important holidays, family needs, COVID. It's sad, but I wanted to provide reassurance that actually the recording, the proceedings of the conference will all be available, so people will be able to access this event tomorrow, or if we put them on YouTube, maybe somebody today said forever, so we could do that. As you may imagine, it takes a great deal of work and preparation to organize events like this, so now I would like to recognize the contribution of the team that actually made the event possible. So within research, I think Lisa, Brad, Jordan, Scott, and our research assistant, Natalie and Richard, thank you very much for all the work that you put for this event. And the list will become quickly long, but I'm gonna summarize it by saying our colleagues in IT, law enforcement unit, facilities, it's actually a big team that has helped us throughout the year to make sure that this event would happen and be successful and smooth. So please join me in thanking them. Last but not least, this is not only one of the key events organized by the Opportunity and Inclusive Growth Institute. It has now become a traditional event of the Minneapolis Fed, and it has received growing attention over time, and we wouldn't be here without the leadership of the director of the Institute, so I would like to thank Abby for all that you did over the years to take an idea to an event like this one. So thank you, Abby, for all your leadership. And speaking of the Institute, I actually would like to connect a little bit with one of the highlights of the day, which was the intervention by President Bostic. And I think he provided a grounding of why do we have this conversation at the Fed. I think he made a very clear connection with the employment mandate. My way of summarizing that connection is, ultimately, we want to understand at the Fed, we want to understand how the economy works. And it's thanks to research like this that we have a better understanding, better insights on how the economy works, and we can inform policy. And it's also the level, the quality of the research that is typically discussed at events like this that makes us different from other agency or private sector, for that matter. So I really, it's reassuring to come out of an event like this to say, well, the Fed is unique in the sense that it is a research-based policy institution. And thanks to this conversation that we have a better understanding of how the economy works, and we can provide better policy advice to the policymaker. Sometimes we get it wrong, inflation gets a little bit high, but on average, we try to do our best to inform policymakers on what is happening. And so thank you for joining today and contributing to that mission. Last but not least, conferences are great events for disseminating your research, getting feedback before submission. but they're also a key moment to actually strengthen and, if anything, broadening what is a research community. I was talking over lunch with Oksana. We were saying, oh, we were in the job market together, and then we saw at that conference, and then at that conference. It was not too long ago. But it's basically what gives value and what makes these events rich. So please enjoy the social activities now with the reception and the dinner. Perhaps, Veronica, at some point you will have a map of in which conferences research ideas actually are coming out and which one become papers, and that will be the new measure of productivity for researchers. That's all. Enjoy the rest of the evening, and thank you again.